7. Welcome, DeSci.Berlin is open, yay! Okay, we've got a very tight schedule today, so we are going to be moving quite quickly, but this is our CEO and co-founder of Molecule, Tyler Golato. He started his career out in oncology research and then moved to the National Institute of Aging, where he worked for a couple of years. Kind of needing a change, he moved to Cape Town and started working for the Desmond Tutu Health Foundation. Worked there for a bit, and then in 2018 met Paul, his co-founder, and they started building Molecule and BioDAO. But I think more importantly than any of that, I think if you've had the luck to meet Tyler, you know that he is in the space for all the right reasons. He truly, truly, from the bottom of his heart, is running and involved with the DeSci space because he wants to make the world a better place, and I think that's a wonderful character trait. So yeah, without further ado, here he is.
Thank you so much. That was a really nice introduction. It's really lovely to see a bunch of familiar faces and also quite some new ones. I'm excited to chat about disrupting the decline of disruptive science. Is this what I'm using, by the way? Is this like a clicker? Yeah, cool. So today I'll try to be setting up really the rest of the conference and contextualizing the problem space that I think many of us are here because of. This image here on the side is a figure from a Nature paper that was published last year that was looking at a really interesting trend. It uses something called the CD index, which measures, on average, how disruptive science is, a publication is, or a patent is, by looking at how the trajectory of the field changes after a specific publication occurs. And one of the things that was found that was really, really striking is that across pretty much every vertical that was measured, so the social sciences, technology, the life sciences, biomedicine, the physical sciences, over time between the 1940s and today, there has been this quite precipitous decline of what is termed disruptive science, innovative science, science that is really, in some ways, making a fundamental discovery that is changing the nature of how the space evolves afterwards. And I thought it would be an interesting place to start by maybe questioning why that is. The paper itself doesn't actually make many claims trying to understand that problem. It really presents it more as an objective study. And the commentary that came out was basically nobody knows why this is happening. But I think in the interest of the work that we're doing and also contextualizing the work that we're doing in DeSci, I thought it would be interesting to kind of analyze this problem and better understand it. So a little bit of a lay of the land. I'm going to be talking first just generally about the institution of science, the institution of academia, understanding what science is. Many of us know, but I'll make an effort to kind of explain. Then I'll talk about decentralized science, which is the space we're in almost as a reaction to some of the problems that I'll be discussing in the first part. I'll talk a little bit about the work that we're specifically doing at Molecule and how we contextualize the problem. And this is really coming from a biotech perspective and from a drug development perspective primarily, which is a very specific part of the translational sciences. And then I'll try to do my best to paint a picture of what I think a better future could look like if we're successful with the work that we're trying to do here. And one thing that I think is important to remember through all of this is that DeSci, this space, is like a laboratory for experimentation. Like, if we're successful, the space is trying to innovate, test new models, and create this sandbox environment from which we can actually experiment on the institution of science itself and how it works. So on science and academia. So science is not just for scientists. There was a landmark essay last year that marked the relaunch of the British Science Association, where Chief Executive Imran Khan argued that science is too important to be left to scientists alone. It did a very large kind of population survey of the British population, and most people were embarrassed that they don't understand science. Many believe that it's too complex for anyone but experts. But this is kind of a core conviction that I have. I think it's something that's too important to be left only to professionals. Science is the lens through which we question the world. It's the lens through which we progress. And ultimately, having a scientific mindset, trying to better understand nature, is what leads in many ways to a better society. If you look at the trend of human progress, science and technology have really been instrumental in enabling us to live better lives. And what does science actually mean to society? So, for many people, they think about science as objective truth, or the arbiter of truth. They think that it's infallible, that it paints a picture of objective reality, and it's these prestigious institutions that are basically coming and explaining the world to people. It's really not what it is at all. In a lot of ways, and I'm quoting a molecule investor here, he would appreciate this. In a lot of ways, science is just a method for the reduction of uncertainty. And so this quote is, "The biggest misunderstanding and representation of the institution of science is that science is not the ultimate arbiter of truth, but rather is a process for gradual uncertainty reduction. This shift in perspective changes how scientific findings are used, communicated, and judged." And if we think about science, how maybe people who are outside of academia even, interpret scientific findings, you'll hear things like, a study was published that showed this, and then you have people basically reacting to that, saying that okay, that's why things are the way they are. It's not really the case. The scientific method is useful for getting closer and closer and closer to truth, because it's a very good methodology to reduce uncertainty. But it doesn't necessarily mean that it's the arbiter of truth itself. And so, kind of with this in mind, contextualizing, we should all have a strong interest in contributing to the scientists. We should all try to be scientific in our daily lives. There's about 7 million people today that are professional researchers, and one of the kind of important motivations for the work that I do, or the beliefs that I have, is that we can really increase that number. Can we 10x that number, plus better empower everyone to contribute meaningfully? Everyone in the world. And that brings me to another point, which is really about the institution of academia. Basically, the institution from which science is really disseminated. My personal view is that academia itself is a bit of a dying monopoly. And if you analyze it through the lens of the life sciences, you can begin to ask yourself, why do we need academia? What is academia good for? There are so many things that scientists do in their day-to-day life that cost a lot of money, that have a lot of risk. There's a big regulatory overhead, and universities themselves are, kind of the vehicle through which people are able to get funding. Research is very institutionalized, and there's a theory from systems research that refers to, it's called, the purpose of a system is what it does. And I think if you look at academia, you could say a lot of things about academia that are completely unrelated to, producing world-changing research, for example. I think there was a quote that Harvard is like a hedge fund with with some classes happening at it. I think these types of things are worth keeping in mind when we question institutions, which obviously have a lot of value, but I think it's worth kind of asking these questions what does a life scientist need to succeed? Okay, do they need physical lab space? In the future, there will be cloud labs that are basically you can interface with via the internet, through robotics and AI. Do we need these kind of gate-kept commercial journals? We have the internet. We have the means to communicate findings with each other, to regulate ourselves to a certain extent. Do we really need physical research institutions that are constricted to certain places of the world? DAOs enable us, for example, to interact and come together around specific values, ideas, principles. And do we need the current intellectual property system? We have blockchains. We have ways that we can basically, with technology, recapitulate a lot of the functional processes that are associated with academia in different forms. And my personal belief is it's just a matter of time until this happens. And really, academia needs to evolve in order to survive. Many people who I think maybe have, are coming of age in the COVID era, we realize that, you can get classes from the best professors of the world in the comfort of your own home. Many people are changing the way that they educate their children, but these kind of geographically restrictive models of academia in many ways are outdated, they're lagging behind. 50 years ago, I think they made more sense. I think there's reasons to question them today. And so, in this lens of through this lens of enabling more people to do science, thinking about how we could tap into, the collective contributions of everyone, the internet and Web3 enable structures for kind of self-organization based on shared values. And so this is something I would like you guys to keep in mind as we go forward here. There's what has been termed a great resignation hitting academia at the moment. There's this kind of mass exodus of health researchers that are flocking into industry. And if you think about this, you have people who are spending 10, 15, 20 years training, many of them with the intention of getting a tenure track position at a university. In the US, about 8% of people who are trying to do that manage to. A lot of people go on and do postdoc after postdoc, a lot of training for a very small amount of money with high expectations and this constant need to try and survive and prove yourself kind of at every point in your career. There's this publish or perish thing where basically, the incentive structures, which is the core thing that I'll get into, that basically drive forward academic progress are really broken. And so there's all of these factors that are kind of coming to a head now, and I think in many ways I see the DeSci space as a reaction to. And if we play our cards right, and if we kind of lead from a place of values, I think there's a way, my thesis is that there's a way to almost take advantage of this and create a better system. So back to this headline, disruptive science has declined and no one knows why. I think there's some really, really strong telling answers as to why, and my thesis is that it relates fundamentally to the nature of incentives. And so science teaches us to question everything. Let's start with the institution of science itself. And yeah, important to note, I'm not questioning science, but really the institution specifically. So let's try to diagnose this problem a bit. When we look at why disruptive science that's changing the world might not be happening, and I'm not saying it never happens, we're just observing that it happens less, we could think about what incentive structures exist to actually reward disruption. And if you look at how science works, the career of an early academic is typically trying to prove themselves. They're trying to publish in peer-reviewed journals that have a high impact factor. What does that actually mean? Impact factor is really looking at the popularity of a publication, so how many times it's being cited over a relatively short timeline, not how often it's actually doing something disruptive. There's this kind of publish or perish mentality, so you have people cherry picking pieces of data, for example, in order to get a paper in a good publication, in order to get tenure track positions. If you look at the incentives that exist in drug development, for example, what kind of drugs come to market? What kind of drugs warrant the risk? Taking a strong risk, for example, they need to have good health. They need to have good economics. They need to be able to recoup very expensive development costs. And all of these things basically create a structure of incentives that is what is basically pushing behavior forward in the context of the current system. And so science, the institution, is really full of these incentive problems. It occurs at the funding layer, the replication layer, the competition layer, and the communication layer. Funding is very highly competitive and asymmetrically distributed. Most science is not actually reproducible because people are often cherry-picking data in order to publish in papers. Science is intensely competitive, with less than 2% of NIH funding going to people under the age of 35, which is a shocking statistic when you think about the fact that many of the world's most successful companies are built by people in their 20s, and most of science is actually inaccessible to the public. And some of these problems are really created by centralized authorities. So funding bodies are largely centralized around governments with tax funding. The public's largely excluded from making decisions. The replication crisis tends to be perpetuated by more centralized scientific communities. Competition for publishing in these and tenure track positions is predicated on engagement with a few centralized and powerful agencies and universities. And as we know, journals, there's a few large journals that basically control the dissemination of scientific information. So what if we ask the question, what if science is decentralized? Is there another way that we can do things? And decentralized science, as you know, is basically a movement that's aiming to build public infrastructure for funding, creating, reviewing, crediting, storing, and disseminating scientific knowledge fairly and equitably using Web3 technology. Web3 is a little bit of a buzzword. It's really referring to this kind of third instantiation of the internet, going from read, Web 1, read and write, Web 2, and kind of read, write, and own being Web 3. So a much more user-centric, decentralized internet. And I really view this as the incentive layer for open science. I think if we're successful, DeSci itself serves as an ecosystem that is experimenting with creating new incentive layers for open science. And so we're trying to build on the open science movement by creating these kind of new systems that enable anyone to participate, leveraging technology that enables scientists to raise funds, runs experiments, share data, and distribute insights more openly. DeSci ultimately means that anyone can contribute to science with ideas, with data, with funding, with execution. It doesn't necessarily mean that anyone is a scientist, but it ultimately means that, as a member of the public with an interest in seeing something moving forward, you can contribute your data and be rewarded for it. You can contribute funding and have a stake in the science that you're actually helping to move along. And you can also, as a scientist, you can actually get involved in executing experiments in a more permissionless way. And if you think about the scientific method, I think just as a thought experiment, you can begin to think about all of these various processes: questioning, forming hypotheses, experimenting, recording your data, analyzing it. There are ways with DeSci to make a lot of this process much more transparent, much more collaborative, and much better incentivized. And ultimately, all of it costs money, which is why I think the funding vector of DeSci is one of the most important. I'm rushing through my slides a bit because I'm getting the 1 minute sign. And I still have quite a ways to go, so apologies. I will quickly go through what DeSci looks like in practice. I think ultimately it's a big experiment in new incentive structures. You'll be hearing from quite a few folks today that are building in this space, and I won't go too deep into detail around what they're doing. I think they'll have the chance to do that themselves. The work that I'm doing specifically relates to funding and intellectual property in the DeSci space. So it's actually looking at, in an area like drug development, how can we turn intellectual property, which is kind of this monolithic right to basically exploit a piece of technology, and change it from something that is ultimately leveraged by companies in order to fund a drug, in order to recoup cost around a drug that is commercialized, into this kind of agile incentive that can motivate collaboration, early funding, and participation in therapeutics. And so Molecule is ultimately changing the way that funding and intellectual property works in early stage drug development by trying to turn IP itself into a kind of community level incentive. We have two core technologies, IPNFTs and IPTs, that basically take a patent or a right to a piece of intellectual property, a sponsored research agreement, and make it programmable, transactable, liquid, and data rich, and ultimately enable us to turn IP ownership and IP governance into something that can be given to researchers, funders, collaborators in exchange for their work. And the goal of this is really to align incentives. The example that I normally give is, what would the world look like if the method of production for insulin, for example, was collectively owned by diabetics and diabetic advocacy organizations? How would these drugs be priced? How would they be accessed? This is the type of world that we're really trying to create, one where we can have strong aligned incentives with communities that have a strong interest in the best possible healthcare outcomes. This is just a little preview of a platform that we're building right now called Molecule Catalyst. For researchers in the room, you'll basically be able to upload an idea, a video, describe the impact of your research, and basically have people fundraise through this platform and reward the community that participates with governance rights in your project. It enables you to form communities around your research that are interested in helping you advance it and secure funding in hopefully record time. And yeah, I'm going to rush through now, sorry. yeah, ultimately the goal with these IP NFTs and IPTs is to turn IP into this cohesive, programmable, and collaborative incentive unit. I'll skip over the BioDAO stuff and just get to trying to paint the future. In 10 years, science is going to look very different. I think a lot of it's going to be more closed loop, AI-driven, cloud and robotic space, much more in silico stuff happening. We have an opportunity to build the incentive layer and the infrastructure that is powering this kind of transformation in science in a very community and stakeholder-centric way, and really have what I think is an outsized impact on humanity. And I hope we take the opportunity to do this. I think this meeting today is really the opportunity to discuss how we do it. We have the opportunity to collaborate and create dynamic and interoperable systems, define new standards together, and learn from the mistakes of the past and course correct. But at the end of the day, experimentation is key. We don't really know the answers yet, but we have this space to basically experiment. And so my hope is that in this future, in the picture that we're trying to paint, clever people will have the ability to work on anything that excites them. Anyone will be able to fund and participate in science, independent of institution and geography. 80% of our time as scientists will be spent doing science, and 20% of our time will be spent applying for it. Patient and researcher communities will govern cures and access to medications, as opposed to pharmaceutical companies. We will share our knowledge, data, and resources openly. We will learn from our mistakes. We will publish our negative results. And scientists will be fairly paid and incentivized for their work. And ultimately, science itself decouples from institutions and becomes something that is just as much of a part of the fabric of day-to-day life as anything else. Thank you so much, and sorry for going over time.
Cool, thank you so much, Tyler. The theme for this year's conference is outlining the issues in translational science and then to sort of discussing how DeSci can solve them. So I think that was a really good sort of aligning point to start us off. Next up, we have Balazs. Balazs works with PsyDAO. He currently works as a clinical data scientist working at the Translational Psychedelic Research Program at UCSF. And he's well known for inventing a self-blinding method which was used to do the largest placebo-controlled study on psychedelic microdosing. So that's pretty impressive. Here he is.
Thank you for the introduction, and thank you everyone for being here. So I work at UCSF. I used to be at the Center for Psychedelic Research at Imperial College before, and at both of these institutions I have been part of the team that ran some of those clinical trials about psychedelics that probably you have heard about. And those are the trials that are really driving the current renaissance in psychedelic research. However, in parallel with that, within the psychedelic research circles, I am also known for running complex citizen science experiments. And here I want to make the case that while traditional clinical research with psychedelics is great, but I think there is a lot more untapped potential in using citizen science for pushing forward the boundaries of psychedelic research. The way this talk is going to look like, that first I am going to give you 2.5 arguments for why I think citizen science is the future of psychedelic research. And then after that, I'm going to transition into describing some of our plans with PsyDAO and how PsyDAO fits into the whole picture of using citizen science for the benefit of psychedelic science. So first, I'm going to give you the arguments for the thesis of this talk. And the first argument is going to be very, very simple. It's money. It's the cost of doing research. So when we are putting a patient through a psychedelic clinical trial, it costs about $10,000 per patient. Now, one thing which I need to emphasize at this point, that a lot of that is driven by sort of like advanced research methods. So for example, if you put neuroimaging into your trial, that is going to really significantly increase the cost. But even if you're just like thinking about like legal psychedelics, the costs are really mind-numbing. So in this first, whoops, is it going? What do I do? Okay, there you go. So this is a picture that was going around on Reddit a few months ago, and this is basically the price list of a psilocybin service provider in Oregon. So right now in Oregon, you can access psychedelic therapy legally, and this is basically the price sheet of one center, but the prices are similar across the state. And what I would like you to pay attention to, let's just look at this last line. So a high-dose session with 2.5 to 4 grams of mushrooms, 6 hours, that costs $3,500 US. Now, that's a lot of money, especially when you are considering that the street price of 4 grams of mushroom is about 20, maybe 30 US. Now, to be completely fair, I left this text here to be not to be unfair. So this $3,500 also contains some psychotherapy, specifically 1 hour of a preparatory session and 1 hour integration session. However, if you're looking still the value proposition of $30 for 4 grams of mushroom or $3,500 for the same amount of mushrooms plus 2 hours of psychotherapy, I think still the first version comes out to be much better. I am not a hardcore libertarian by any sense, but I think there is something to be said that, in the black market, you can buy mushrooms for $30, but if it hits the legal market, then the prices go up to $3,500. So regarding the costs, so I started with the talk saying that I'm going to have 2.5 arguments for citizen science. And the first one is the cost, and the half argument is something which is very closely related to the cost, and that is going to the sample sizes that you can achieve with citizen science. So some of the largest studies on psychedelics are citizen science studies, and many of them are like this survey kind of research. So there's a researcher, the research team comes up with a question, and they put some surveys on the internet that people are completing. And because everything is run through on the internet, you can globally recruit, leading to the large sample sizes. And that sort of research is often associated with citizen science. However, I think we can think about it a little bit more broadly. Of course, if you're running a citizen science experiment that requires in-person contact, then things are going to get more complicated. For example, if you want to give your participants a variable, you can't just fly to everybody and give them the variable. However, I think there is something like unique about psychedelics is that a lot of these logistics problems around more complex citizen science experiments could be easily solved only if there would be a place where there are lots of people in a small area doing psychedelics together. So is there anything like that? Of course there is. It's called raving. So this particular photo was taken at the Boom Festival, which is one of the bigger raves. And it happens every second year. And let's just think about the numbers quickly. So this is attended about 30,000 people, I believe. And I think it's a conservative estimate that 90% of the people there are doing psychedelics. So let's just say that, okay, not everybody is going to do your experiment that you're running on the festival grounds, but let's just say that we convince 1% of the people to do an experiment at a Boom Festival. So that would mean we started with the 30,000 people, 90% does mushrooms, you convince 1% to do your study. That means that you would have a sample of 270 people, which would make it easily one of the largest studies on psychedelics. Like literally in 1 week at Boom, we could collect data from more psychedelic experiences than how many psychedelic experiences are going to happen in the traditional research context within the next few years. And I think this is exactly the power of the citizen science methodology, is that because so many people are doing it, you just need to have find 1% of all of these experiences and just channel those experiences into a format that is scientifically useful. Note that my argument for citizen science is the future of psychedelic research. The reason why that works is exactly this, because people are doing it. So for example, RTMS is another methodology that is gaining a lot of momentum for treating depression. It's where we are basically using a magnet to give electric stimulant to areas deep into the brain. The future of RTMS is not citizen science. people don't have those machines that cost hundreds and thousands of dollars sitting in the basement and they can play with zapping their brain. However, with psychedelics, there is a very, very large user base. So that's why this argument for citizen science works there. It's because this is something that is going to happen regardless. We don't need even to encourage psychedelic use. We just need merely to find the channels to, or to reach out and make sure that a small percentage of psychedelic experiences, we are collecting data about them in a format that's scientifically useful. Okay, yeah. So I said 2.5 reasons for psychedelic citizen science. I have one more left, but I think that's probably the most important one, and that's something that I'm going to call relevance. And what do I really mean by that is that there are lots of interesting questions regarding psychedelics that you're never going to get funding through traditional channels, nonetheless, that are very relevant to a large number of people using psychedelics. Let me explain what I mean. I'm 36 years old, and this is an age where a lot of my friends are settling down, getting married, maybe having a baby, and getting a mortgage on their house. And for a lot of these people, like, everyday life is just becoming a lot more monotonous, a lot more gray, a lot less exciting things are happening. And I see that a lot of these people are like struggling, but it's not that they have like a medical diagnosis of depression or anxiety. It's just simply their life is very boring, and I think there is a potential for sprinkling some color on top of it, potentially with psychedelics. So in this next slide, this is a sample from the population, and it's about a measure of depression scores. And with the blue ones, you see the cases. So those are the ones who are going to meet some criteria for depression. And there are two important things about this figure. So one of them is that notice is that not that, like, you know, we have one bucket of data here, people who are depressed, and another bucket of people who are non-depressed. It's a continuous measure. It's a totally continuous thing, meaning that depression, it's not a binary yes or no thing, rather it is something that lives on a continuum. Now, the important bit is that with current psychedelic research, the paradigm is that we are using it as a treatment. You have a diagnosis, and we are treating that diagnosis. So we are only caring about the people who are here in the blue. But notice that if you would add up the height of these bars, then the sum of the green bars would be much, much higher than the sum of the blue ones, meaning that there are a lot more people who are, do not meet the medical diagnosis. Oh, why is this? Yeah. Who do not meet the medical diagnosis to be included in psychedelic research. Another way to think about it is that I think we can start to maybe think about psychedelics not as a treatment, but also like as prevention of future problems. Generally, in medicine, there is a recognition now that it is much more difficult to treat conditions rather than trying to prevent that. And I think if you're thinking about psychedelics from that perspective, then the questions that you want to ask are suddenly very, very different. So typically what we're doing in clinical research is, in a sense, like, you know, very short-sighted in time. If you're doing your baseline measure, you go through the drug experience, and then 6 weeks later, we measure how you have changed. But it's a very short time window. If you're thinking about more in a broader picture of like psychedelics as prevention, then the questions that are relevant are, for example, that what happens to adult people who are, let's say, use psychedelics a few times a year after a decade of that dosing regime? There is not going to be any traditional research funding to answer this question, but I think this is a question that is relevant to the psychedelic community at large, and I think these are the questions that are going to be potentially unlock the benefits of psychedelics for a much broader population, because now it includes people who do not meet the various medical conditions or medical diagnoses where currently we are using psychedelics. One more thing that I would like to emphasize here is that the way I think about it, it's not that citizen science needs to overtake or compete with traditional clinical research. I think clinical research is great, and, like, you know, in many ways that's how I earn my living. I'm not going to talk against it. But citizen science has a great opportunity to complement traditional clinical research. We can ask questions that are never going to get funded in traditional channels and that are relevant, I think, to a much larger number of psychedelic users. So this was my 2.5 argument for psychedelic citizen science. And right now, I am going to transition into how PsyDAO can help push forward psychedelic citizen science. So the way a lot of citizen science work happens in this space is what I call like the traditional old school method, and that is the research team is proposes a question, they put, let's say, a survey online, and then members of the psychedelic community are going to fill out that questionnaire, and then with the data collected, we write a paper, yay. But notice is that here, like, really the value is only created in one direction. It is created for the research community because they are the ones who are getting the publication and the prestige associated with that and the ability to apply for further funding. And as somebody who has been involved with many studies that have used this model, let me tell you that this is actually very strongly in decline. And I believe the reason for that is because like 5 years ago, there was a lot of incentive for members of the psychedelic community to help the research community to make the case for broadening the application, the medical application of psychedelics. However, now that escape velocity has reached with psychedelics, and nobody wants to do these survey studies anymore because they're not getting anything out of it. And this is where I think using Web3 technologies and PsyDAO can come to the rescue. So the vision that we have for PsyDAO is to be this interface between the research community and the psychedelic community. One of the flagship projects that we are hoping to start very soon is what we are calling OPSI, the Open Science Psychedelic Platform, which is a platform that we are building on top of existing survey engines, but they are going to have this Web3 layer where if you are giving us data, if you are contributing to the research that we are running, we are rewarding you with PsyDAO tokens. So right now, the creation of value does not go just to the research community, but value is also created for the psychedelic community. But not only you get tokens, but one of the other important aspects of this platform is going to be the open science part. Unless you have been living under a rock, then you know that scientific research is in a replication crisis. And there are many reasons for that and many solutions. But one of the simple set of practices that we can do is open science, which is about pre-registering your hypothesis, sharing data and protocols openly, so on and so on. OPSI is going to be an open platform where everybody can propose projects, but we're only going to allow you to the platform if you're following some of the open science principles. Because we owe it to the psychedelic user community that research that we are supporting going to go for maximum scientific impact, and the best way to ensure that is to embrace the practices of open science. So we are hoping to build out OPSI starting later this year, and we want to launch immediately with some studies that we ourselves, PsyDAO, is going to propose, but we are in contact with other research groups of what other research they would be interested in running on this platform. So one research project that I immediately would like to start with is like a lightweight survey project that focuses really on the long-term outcomes of psychedelics. So this would not be something where we are trying to measure what happens before and after a psychedelic experience in a short time window, but rather to really ask the questions is that how psychedelics affecting people who are using it responsibly but over a span of a decade. We want to start with that, with asking this research question because it's going to take a long time to get to the end of it. Another question that we want to ask is do an experiment where we are really going to a rave, maybe to boom, where we are giving people wearables. There's this notion in the psychedelic community that ego dissolution is one of the central mechanisms of the benefits of psychedelics, and we also know that at rave, some physiological signal between participants are synchronizing. So with OPSI and psychedelic citizen science, we have the opportunity to measure is that people who are more synchronized with the crowd in the rave, are their positive benefits of their psychedelic experiences are larger than those compared to who are not synchronized with the crowd. Now, this is a provocative and very hippie question, but exactly that's the point, is that this is a question that I think is going to be relevant to many psychedelic users. They would like to know the answer, but there is zero chance of ever getting funding for it through traditional means. So again, OPS is going to be an open platform, and the core technology that we are developing, which is about incentivizing the public to give us data for some of the studies that we are running. This core technology of tokenization, I think, is going to be useful not just for DeSci.DAO, but it is something that can be used across the DeSci ecosystem. So I am going to wrap it up here. Thank you very much for your time and attention.
Cool, thank you so much, Balazs. I, for one, am ready to buy my boom ticket in the name of science. Could I make a request that everyone moves forward a little bit in the seats? Is that okay? Yes, no, seeming no? If possible, next time you get up, come sit down in the front, please. Okay, next up we have Ethan Perlstein. Ethan is the CEO of Perlara, which is the first biotech public benefit corporation, which works hand in hand with motivated families to develop treatments and cures for genetic diseases. He's also the CEO of Everyone Foundation, whose mission is to make individualized medicine safer and accessible to everyone. Thank you so much.
All right, hello Berlin. And to all our DeSciders on the live stream, hello you beautiful people. So I flew in from California recently, so don't mind this trad bio exterior. Underneath is pure unadulterated crypto anarchism. Okay, so I want to tell you about building a direct-to-patient decentralized biotech. Let me tell you my why before I tell you the what and the how. So genetic lightning can strike anyone, at any time, in any place. Who in this room has or knows someone with a rare or genetic disease? Wow, that's higher than the statistics. Should be 1 in 10. I should have raised my hand too. So I had this observation about 10 years ago when I met a mother whose twin daughters had a very, very rare fatal disease, and we were chatting at the NIH, and she was talking about cholesterol homeostasis and cell biology, and I thought to myself, does she have a PhD? And of course she didn't. She was a marketing person, but when her children were struck by genetic lightning, everything changed. And then that made me realize I need to build with these builders. And so I created Perlara, the world's first biotech public benefit corporation. And it was established 10 years ago, so it's 10 years old. It's been through many, many pivots. Right now it's a marketplace for rare disease research. It was started out as a brick and mortar lab, very, very trad bio, and then during the pandemic went fully decentralized, fully remote. And with this model, we were able to basically invert the current pharma business approach, which is patients come to us and they will own all of the IP for all the research that they do, and Perlara will provide guidance and assistance through a network of consultant PhDs called Cure Guides that are all around the world. We're all connected through Slack, maybe one day Glue, I guess. And we were able to completely bootstrap a 26 disease program, all paid for by the client. I'm an alum of YC, so I like building with builders and came to realize that these parents are just builders like anyone else. It's just they're building for a different reason maybe than some of us. And in the course of working with these families, I met one particular family in particular, the family of a little girl named Maggie. And we worked together, and we ultimately joined forces and created a joint venture, which is also very different from the traditional trad bio approach. And right now we actually have a phase 3 trial in progress. I can't tell much about it yet. It's still in the randomized phase, but it's a proof that you could build from zero with a family that had no experience, no professional management or biotech education, and we're able to rapidly and very cost-effectively move from 0 to 1, not just 0 to 1 in terms of one patient being tested, but now we have a phase 3 trial with 38 kids. So I'm a builder, I'm an operator, I'm a scientist first, and I'm also an investor. I've been lucky enough to be able to invest in YC bio companies since 2019. Here's some of the companies listed here. That top performing investment should be updated to 70x, I think was the last time I checked Bitcoin price. That's actually my Bitcoin investment. It's not actually a biotech investment. So maybe there's my crypto cred. So you have to understand that this is a very long tail of diseases, right? There's 10,000 rare diseases. You might have heard of cystic fibrosis or sickle cell anemia, but there's 10,000 plus. And the vast, vast majority of rare diseases are ultra rare, meaning they affect maybe a few dozen, a few hundred, maybe if you're lucky, a few thousand across the entire world. So given this distribution, what's the best way to actually proceed with a business model in pharma? I actually think Web3 is quite compatible here. So I'm not going to tell you about DAOs. I'm not going to tell you about NFTs, because we've built on TradBio rails. But everything we've done here, you can hopefully imagine transplanting and moving over on-chain. So again, thinking about the business model, most of TradBio is organized around serving common disease markets. Heard of Ozempic? But the rare disease market is fragmented by definition. So for example, there are 1,000 plus inherited metabolic diseases. There are 3,000 plus neurodevelopmental diseases. On average, each of these are very tiny markets, maybe between $70 and $200 million. It may sound like a lot of money actually, but to pharma, that's a rounding error. And so what we need is some kind of a model that can take advantage of this fragmentation and actually build processes that can scale and turn these fragmented market into something quite gargantuan and quite massive on their own. Together, I should say. And don't wait for the pharma white knight to save you. He's not coming. Pharma is too big to scale down to this problem. We've all heard this oft-lamented statistic, over $1 billion, maybe it's $2 billion with inflation, 10 years to develop a drug. And the average rare disease market's only $200 million. So of course, there's a massive mismatch between what was currently the current infrastructure built for making medicines and the needs of these communities. And I won't go through the litany of complaints here, but if you look at some of the fine print, this is not that surprising why pharma is unable to scale down. They just simply are too big to capture this opportunity, like a grizzly bear trying to snatch a firefly from the sky. Oops. Did I skip a slide here? Nope. Okay, so now I want to introduce you to Maggie. She is a medical pioneer. This is a picture taken on January 29th, 2020, right as the world was going to turn to shit. Maggie's world was actually going to turn in a different direction. This is her receiving her first dose of a drug called a Perlstein. Don't need to get into the details of the biology, but working with Maggie's family, as I told you, we discovered that this drug was a repurposing opportunity. Maggie's sitting in the lap of my collaborator, Eva Morava, who is the clinician running the phase 3 study I told you. The woman over on Maggie's left is her mom, Holly. And I want to show you, because seeing is believing, what we discovered together. This is going to be a montage of Maggie's baseline before she started taking the drug, and then you'll see what happens once she starts taking the drug. So this is May 2019. This is about 7 months before she started taking the drug. You can see this is her baseline. We're going to switch scenes in a second here to the Mayo Clinic. I don't know if anyone has had the luxury of visiting the Mayo Clinic, but this is the hotel that's across the street from the main hospital. This is a hallway convenient for essentially doing a de facto 6-minute walk test. And you can see Maggie has really difficult time maintaining a straight line. Maybe pay close attention to her feet. And she'll try, because she is very persistent. She's going to make her way down gradually to the end of the hallway. And I should say, we discovered this drug using very simple, what we call patient avatars, yeast and worm models, which are super inexpensive. And this process led to discovery of a Japanese drug that was developed 30 years ago for the treatment of diabetic neuropathy in adults, and we were able to find out that this drug works for these kids with a pediatric disease. Okay, raise your hand if you notice a difference. Great, can I take a picture of this and send to FDA so that, okay. Okay, she's executing a really nice left turn into the elevator, a little pirouette at the end here, settle herself in, and here we have a nice straightaway shot. So this is 7 months on the drug that we found together. And I think what's really cool about this story is that Maggie's not alone here. She's got a lot of friends. There's 30 million people in America alone who have a rare disease, and the vast majority of them are kids. And a very unfortunate large percentage of them will not make it to see their 5th birthday. So we'll continue here. We'll skip ahead a little bit to a few months after this, and you can see that she's sort of consolidating her gains. This is by no means a cure. I wish it was, but this is a solid base hit. And compared to where kids like her are, where they have no treatment options, this is a great new baseline to be at. Here's another scene from the Mayo Clinic. Unfortunately, she had to spend a lot of time here. This is also maybe giving you a glimpse into the life of what it's like to have a family with a rare disease. You're going a lot of times to go to medical centers for visits with specialists. Okay, here she goes. She's getting a little bit stronger. We have next shot here will be an outdoor scene, and I promise the last segment will be worth the wait. And I'll tell you a little bit about Maggie's mom, Holly. She has no professional scientific training at all. In fact, when Maggie was born, the doctors told her, oh, she's got spinal muscular atrophy. And Holly said to herself, oh, no, I don't think so. And went home and did some homework. Here's the coup de grace. So this is Maggie now taking steps with some support from a home aide, but she's able now without a walker to strut across, do a little catwalk across her living room. Okay, so I hope this demonstrates that this is the power of N of 1. This is the power of actually just simple video capture to be able to tell a story about what a medicine might be doing. Okay, because one good turn deserves another, and this is also a feature of the rare disease space, parents talk to each other. They're all in Facebook groups together. They're all on WhatsApp. They're all constantly communicating. So as Maggie was going through her N of 1 journey, Holly was blogging about it in real time. And other parents were looking at this and saying, I want to get me some of this. And so this guy, this little boy happens to be named Ethan too, his father's a neuroscientist, and he was reading the blog and said, I think I can try this with my kid. And so he did. And these are little Ethan's first independent steps. That's 3 months on the drug. Here's a month later, he adds a step, just to make it interesting. And then to show you the durability of the effect, 2 years on a power stat. You notice he's also gone through quite a growth spurt. He's got a little helmet there for protection. Steps aren't perfect, but compared to where he started, I think this is a good place to be. And we're not done yet. This is not a cure, but this is a great foundational start. So Maggie's Pearl is what I like to call a family-driven biotech. You could also frame it as a community-driven biotech. And again, everything we've done here is built on trad bio rails, but you can imagine moving this over into a Web3 regime. So Perlara starts out as the nucleus of this relationship. Maggie's Pearl was set up as an LLC. Could have been set up as a DAO, but we happened to do things, again, kind of the old-fashioned way. And then we brought in a stakeholder like Mayo Clinic, and then we created this joint venture called Maggie's Pearl. So I think this is the formula that we've worked out at Perlara, and this is the formula that we want to scale. And I think, honestly, Web3 is probably the only way to make this scale, especially if from the point of view, I think, of economic fairness, where these families are sacrificing so much. They're giving their data, they're giving their money, and then they're usually just expected to sit down and wait for a medicine to show up. I don't think so. That doesn't make sense to me. So I'd love a world where we could have done all of this on chain, and as we progress through the life cycle of drug development, you can almost think about a value-added royalty, like an inverse of a value-added tax. So if your data or your cell line gets incorporated into a data corpus, and that ultimately leads to a commercial product, then there should be a waterfall that comes back to those originators who contributed the data so that they can also be remunerated and rewarded for their outputs. So we went from N of 2 studies, decentralized, just sort of bottom-up coordinated by families. Really, WhatsApp was the communication tool for coordinating this clinical trial. And now we have a pivotal phase 3 study with 38 patients that will have data readouts later this year. So we've done it. We haven't gotten it approved yet, but we've gotten this far, which I think is pretty good. And what this tells me is that conditions are ripe for rare. And so looking under the hood here, what did we actually accomplish? We didn't just do lean drug development, we did ultra lean drug development. $5 million, 3 years to go from 0 to this phase 3 study. We incorporated zero-based budgeting, small team. We were remote first. There's never an office, never an HR. The company is a mailbox in Sturgis, Michigan, which if you know America, you don't think of Sturgis, Michigan as a hotbed of biotech activity. But using this approach, I think we're able to show that you can run ultra lean, ultra fast, and be ultra persistent, and this might be the new way to do drug discovery for rare diseases. So I want to leave you with this Dali-inspired image. So you can imagine each one of these little bricks as one of those 10,000 rare diseases, one of the 10,000. And by itself, not very significant. But if you can figure out an approach to build where you can stack them, then all of a sudden you can create a monstrous structure. And I'll leave you with this. We have a monumental mission, but there are monumental returns. The market cap of the top 10 biopharma companies is $2 trillion. And did you know that the rare disease opportunity is also $2 trillion? That's that 200 million rare disease market average times 10,000 rare diseases. As I said, pharma is like a grizzly bear trying to snatch a firefly from the air. It's not possible. So who's going to capture this $2 trillion of value? Hopefully, everything we've done can be moved to a Web3 regime, and maybe all of this can be done on-chain. So with that, thank you for your attention, and I'm really excited for the rest of this conference.
Sorry, excuse me, I had to move that. We're having our first panel, so I wanted to open up the couch for you guys. So our first panel is about the Molecule Nucleate partnership. So earlier this year, Molecule and Nucleate partnered up and had a number of their community join Molecule to help us on our project sourcing journey. It's been a wonderful partnership. I work quite closely with it, and the sort of being able to coach new young academics into decentralized science has been such an eye-opening experience for me. So, moderating our biotech panel is our biotech head of operations manager's technical title, Logan Bishop Curry. Logan has an MSc in biomedical sciences and an MBA from the University of Amsterdam. She is also one of the punniest people I've ever met. So hopefully you'll get a pun or two during this panel. And then in the panel we have Su Yen, who is a postdoc and very community orientated, and I think has been, come, jump on stage, come on guys, come. Fabio, neuroscience, very, very great analytical technical skills. We've got Kiho at the back there, who has actually just launched his own startup, Gut Mood. And then lastly, we have Aiden, who has a passion for intellectual property, which is rare to come across and very treasured when we do find it. So yeah, thanks so much, guys.
Yes? Cool. Thank you so much, Ella, for the warm welcome, as always. I'm excited to be here. This is my first DeSci.Berlin, and I'm joined today by 4 out of the 9 fellows that we have recently onboarded at Molecule. So I have Aiden, Kishore, Su Yen, and Fabio here with me today. 2 more are in the crowd, and 3 more couldn't join, but they have massive FOMO, so that's always a good sign. And for those of you who don't know, Nucleate is a student-led organization that represents the largest global community of bio-innovators. So when we first learned about Nucleate and the organization and kind of what they are trying to accomplish, and realized their value-aligned mission of kind of training the next generation of entrepreneurs and really going about scientific research from a commercial angle and trying to kind of disrupt the system by teaching people from an early stage that maybe take risks and do something different. We knew that would be the perfect partner for helping us launch our new product Catalyst this year. So over the past few months, our fellows have decided to take the leap of faith with us. For you. Thank you. Here all day. So they ventured into the realm of DeSci. They're scientists by training, And their role over the next 6 months working with Molecule will be to support other researchers in their quest to advance science through community-led funding and support. So we've been working hard to educate them on the various aspects and topics required for a foundational level of understanding to work in the space. And they're here today to share their experience and learnings with you. So first things first, obviously, I'm very curious. What was your first impression of DeSci before you learned about Molecule and got more involved? So I'm going to hear from all 4 of them on this question.
So go first.
Aiden, go ahead.
Yeah. So hi everyone. So my first impression was that DeSci is absolutely disruptive. And coming from CRISPR background, so I'm doing a PhD in CRISPR at King's College London. So we need a lot of resources, and that's why I was really attracted to this space. I think there was lots of opportunities for DeSci to get into, gene editing sort of ecosystem. So that's how I found it, I would say. And what is disruptive in nature is attractive. So I was attracted to it, and yeah.
Thank you. Fabio, what about you?
So I would say I'm not a cynic at heart, so I was quite interested in it. And when I first heard about it, knowing nothing about DeSci to begin with. And yeah, I took more of an interest rather than looking at it from a skeptical point of view. And I think, yeah, when I speak to people now knowing about DeSci, sometimes they can come back with more skepticism than I would say I had in the beginning, because yeah, maybe I think I'm quite a community-driven person in general, and so then having this community-led science really speaks to me, and I think there's a big role there for the community to play in terms of gathering data, as we've seen today, and then using this to further science and answer the questions that science poses.
Thank you. Suyan, what about you?
Yes, so for me, I also didn't know anything about DeSci before actually knowing about Molecule. So after I started reading about Molecule's mission and about this decentralization aspect, I found myself, well, I'm a victim of traditional science. I have been working in labs for over 12 years, and decentralized science is actually what we need. So I was sold on day one after reading about DeSci and then getting more involved. And I think this is, as Tyler mentioned, this is the future. Me as a scientist, me as someone that's doing currently lab work day to day, I can see how DeSci will be the answer for science in a few years.
Awesome, thank you. All right, Kishore.
Yeah, so for me, when I first looked into Molecule, I thought it might be a crowdfunding platform. There are some projects listed, and I think they would fund with bringing crypto people together because it's on crypto and blockchain, because I had no prior knowledge of how these things work. But the journey through the fellowship was interesting and an exhilarating journey, which gave me a lot of premise on how these things work. And also, like, being someone, see the problems and the pain points of the traditional science being in that. DeSci came as a rescue. I see it as a movement rather than a new idea. I see it as a movement. That's how I go with it. Yep.
Awesome. Thank you so much for sharing kind of your journey through skepticism into the other side and breaking free of your victim of traditional science kind of shackles. So for the next question, I'm going to ask Aiden and Fabio. I'm going to single you both out. I'd like you to touch more upon what for you has been the most surprising thing that you've learned about DeSci. So obviously you came into the space, we talk about it being a movement. Obviously there's some crypto involved, maybe something new for you, but can you tell me a little bit more about what maybe from like the ecosystem or mentality or kind of, I don't know, drive, passion, or some of the challenges that you encountered that for you were surprising and kind of maybe unexpected when you first started?
Sure. So I think for me was the concept of science without borders, and that's very, very powerful. If you've got an organization which is community-driven, then that's such a powerful thing to have in science. You can do research from Taipei all the way to New York without any disruption from these centralized organizations. So I found that very surprising. Of course, there is a use of IP NFTs and NFTs which facilitates that. So for me, that really stood out, and I was surprised by the efficiency, the knowledge exchange that is done in the in the DAOs, and you don't know probably the community, but you can exchange very valuable knowledge. So for me, that stood out as a person, and yeah.
Yeah, so I would say, I think one of the surprising things for me, being in academia and knowing, I've been in academia for a while, and knowing, yeah, you think you know science and the systems, and then understanding there's this whole subculture kind of beneath it that, I mean, DeSci is in its infancy, but still there's a lot of people, there's a lot of DAOs, there's money floating around, and to realize that, yeah, there's quite a lot of untapped potential, I would say, and a lot of room for DeSci to grow. And so this was, for me, one of the most surprising things. And as I'm a neuroscientist, I had the opportunity to tap into Cerebrum DAO and participate in some of their meetings. And you can you see a lot of people coming together with a common goal, and it's quite motivating, and with this focus and everyone sharing a similar attribute. For me, the surprising thing is that, maybe it's a bit optimistic, but you don't really see how it wouldn't lead to some form of success, because there's so many people who are driven towards the same goal. That I think naturally something positive and something good will come out of it.
I love the optimism, Fabio. Thank you so much. Okay, for my next question, I'm singling out my other two. So for you guys, the question that you're getting is, what are the biggest strengths and weaknesses about DeSci when it comes to its ability to address challenges in translational research? Because we have Fabio here as the optimist, and obviously we all believe that we're here doing something good and that DeSci has the power to move things forward, but there are strengths and weaknesses everywhere. So from your perspective, getting involved, what was something that you thought was oh, this is amazing, this is going to be a huge success, and then maybe once you learned about it a little bit more, you're like, this is maybe actually something that I'm going to need to tackle and overcome in order to be able to reach my success?
I'll keep up first with the optimism.
Always.
I think one of the strengths is that it's really relatable as a researcher to try to understand how decentralized science will change the way of doing science. So, having funding opportunities outside these centralized entities worldwide, it's really appealing for us. The fact that you can reproduce, just share the knowledge, it's also this open base access, it's also really appealing as a researcher and as a scientist, and I think DeSci provides all of that. And one of the things when I started learning more about DeSci and the DAOs and everything, and I think I brought it up with just in the conversations with you on our weekly updates, is the whole idea is amazing, everything looks great, but the fact that we still haven't seen, even from the DAOs, one company that has gone all the way through, a project that has gone from funded to actually become something. That's where, if you're trying to talk to people about this, one of the first questions that I get usually, not maybe talking to scientists because they always focus on the science part and the funding, but just talking to regular people is, okay, so where is, if I were to put my money into this, where's the success story? And I'm so that me trying to explain to them, we're working on it, it's happening, it's currently this is the moment, this is where things are happening. But, I also understand that people want to see that success story. People want to see that something has come out of it. And I think the challenge right now is to get that hype, get people hyped up onto what's happening, and we're currently on it. So maybe we don't see that one project or company right away convert it into something bigger than just being a project funded, but we're on it, and I think the beauty of it is like you can be part of that. And so to me, whenever I try to also now, and the other challenge will be trying to explaining the scientists, because yes, you can first start talking to them relating to, okay, these are, this is why we need decentralized science, but then when you start to get a little bit more technical and start talking about blockchain and all of this and Web3, that's when you lose them. And I was that person. I mean, I had no idea. You told me about crypto before. My only association was crypto, Bitcoin, nothing else. Had no idea. Now I know more. But then, so also how do you put that into words of a scientist, but also not trying to, make them afraid or scared that this is something completely new. I mean, sometimes there is some sort of resilience of us as a scientist to kind of be in our heads and in our bubble. So I think that how do you educate, how do you get into the scientist's mind, how do you break those barriers, how you break that bubble of the scientist, I think is one of the biggest challenges right now. And things like what Molecule is doing with Nucleate, these type of partnerships are clearly on the way of educating people. I mean, right now we're just talking to so many young scientists and trying to also educate them into what DeSci means.
Thank you so much, Suyin.
Yeah. So Suyin talked about the supply side of the DeSci, which is the scientists providing all these scientific projects and all. And there is this demand side, which is basically the community which wants to interact with science, right? So DeSci is basically bridging the gap between science and the people, how they could interact with science much more closer and participate in this. And looking at it, the two crucial factors that Suyin highlighted on the supply side, one being the steep knowledge curve that you need to get onboarded into DeSci. And this is daunting for scientists because so we are in a bubble, as Suyin was saying. It's hard to break it, so you need a certain threshold potential to overcome this, right? So that is one challenge that I see. And the second challenge being the success stories, that what we are showing to the new oncomers, like what we have made here already, yeah? So that is one thing. And it is also as important as to look into the demand side, because it will not be truly decentralized unless we bring in people from different communities, different walks, yeah. If I look at any DAO in a Discord server now, as of now, it is either, it's predominantly either crypto Web3 or scientists who has some projects within the DAO. So you can differentiate this, yeah. So what I think is when we bring people like general audience who doesn't have any knowledge of science or crypto, but is keenly interested on what is happening in science, wants to get involved. If we find a way to, onboard such audience, then I think it'll be truly democratized, and I think there is where we will see the true decentralization of science happening. And what do we need for that is a huge outreach on how this is important and how you can get involved, and show them. So I've been pitching DeSci to anyone and everyone I meet. Yeah, so that's been very contagious after this fellowship. I've been even at parties, I'm being pitching DAOs and stuff. Yesterday, I randomly met a guy in a park who makes psychedelic trance music, and I was pitching PsyDAO to him. Yeah. So this is being super contagious, and he got super excited. He wanted to know more about it. I think people are interested. It's the way you present it to them, how interesting it can be to their personal life, like how do they see it intersect with their life? I think these are the few challenges that I would think are necessary to be fixed to scale DeSci much bigger than Discord servers. Yeah. So yeah, that's what I think. And one more thing is also like with the previous pitch on rare disease with Perala. So this could be something, when you bring on board such people from diverse walks, it is easy to design your studies for scientists. A scientist could know what exactly is my end user expecting from this research. Is it relevant to them to investigate about like different genes, or is it relevant to him to investigate about certain translation value that he has, which could help the end user, yeah? So this sort of connection, bringing users who are the patients or be the general citizens closer to science is what I see interesting and curious to see, because it's a pretty early at this stage. I want to see how it grows, and happy to be a part of it. Yeah, thank you.
Thanks, Kishore. It's good to hear that you have the DeSci sickness and that you are very contagious. Glad to hear that you're having such good times at parties, spreading the DeSci word. So, a question back to the rest of you as well. So obviously we talked about, your experience moving into DeSci, challenges, opportunities, things that you found exciting. When you go out and you talk to scientists, or you're trying to, spread the word, like we said, outreach is so important, and this kind of idea of cross-pollination of knowledge, right, from academia to industry, but also bringing patients in, or just, kind of regular people who are interested in science. What do you think, from your perspective, is kind of necessary to bring in the next wave of people, maybe not only scientists, but, your friends and family? So from your perspective, what would make this, or what would make for an enticing argument to bring them in?
So I think that the patient population is a super interesting area to target, because they naturally have a personal investment within a DAO or a project researching maybe some disease they're suffering from. I don't know exactly how you would go about targeting this population on a whole level, because you would need to go to hospitals around the world, and there's a lot to do. So I don't know exactly how you do it, but I really think that getting people who will be inherently interested and will want to participate in it in the beginning is the way to go, personally.
Go for it, Aiden.
So I work on a rare disease, epidermolysis bullosa, which is inherited rare skin disease. And often I attend these like charity events, and I think making people feel that they make a difference, that's something that DeSci can do. Knowing that your decision can sort of make a difference and then expedite the translational research. So that's such a huge thing in DeSci, and I think DeSci has the power to do that. So for me, that serotonin shot in the from the contributors definitely make a difference.
Yeah, absolutely. Thank you.
I think it's about getting to everyone in the community, not just patients, not just, as Ethan was mentioning, I bet you know someone with a rare disease. I bet you know someone that has cancer. You know someone that is going through something. So diseases are always there. And I think that's what's also relatable to everyone, that everyone must have a story. Everyone knows that someone. And I think DeSci is about the community. It's about actually we taking control, or like some sort of power onto what we can do with the platforms that are out there, and with the potential projects that can help people. And one of the things that we're doing as Molecule Fellows, and this is a little bit promotion from us.
Trained you well, thank you.
Yeah. So Fabio and I, along with Lucas, we are leading we're writing a book on DeSci. So we will be probably reaching out to some of you to help us with this DeSci book. So this book, it's aimed for everyone. So even if my little brother, cousin, my mom wants to read about what DeSci is, but everything that entails on DeSci, blockchain and everything, but in a way that everyone can understand it. This is not aimed just for scientists, this is just not aimed for the blockchain Web3 people. This is aimed for everyone with a language that everyone can understand and easily get what DeSci is trying to actually accomplish. So things like this resources where people can actually understand how DeSci can help, I think are really crucial for what's coming next.
Absolutely, make it a little bit more kind of
If you're
practical.
interested in writing with us, let us know.
Yeah, I think this book could be a crucial step in reaching out to mass audience. And yeah, while I was thinking about scaling up the community, something came to my mind was you're trying to onboard audience, people from different walks. And how do you make sure that the goal of the community is preserved? Let's say people, you need to make quick decisions, of course a community consensus-based decision, but how do you make sure that it is not run down by people who are not working towards the cause that the community wants to work towards? Like, so these steps are important to preserve the interest of people we onboard to this community. So I think we might also like put a tiny bit focus on that. And yeah, I guess I'm looking forward for the book. And to me, like when I pitch DeSci to people, it's case-by-case basis. I'll try different things, and whatever they pick seems interesting, I would build upon that. Yeah.
Awesome, thank you. I think from our perspective, obviously having brought you into the ecosystem, I mean, we've been doing it on a little bit of a cohort basis. So we started with Fabio, Suyan, and Kishore as part of our first cohort, and then brought in Aiden and Sakina in our second one. And now for our third cohort, we have Vincent, Karlsson, Amin, and oh my God, I'm gonna blank on my last fellow's name. David, I'm so sorry, David. Shout out to David. But it's been really cool for us to also watch like your learning journey. So from the first lecture or module, when we bring you in and we say, okay, here's what Molecule's trying to achieve, here's DeSci, here are 11 different modules with different topics that we're gonna cram into your brains in the next 6 weeks, get ready. We kind of watch you go from, what is this? I have no clue, never heard of it before, it sounds crazy, to like, sitting up here pitching a DeSci book and being the life of the party, talking about DAOs. So from our perspective, it's been really cool to have you get involved, and your enthusiasm and dedication is definitely infectious to kind of stick with this contagion narrative. And we're just really excited to kind of have you grow and succeed in the ecosystem. And maybe, I don't know, this could be like an interview question of like, where do you see yourself in the next 5 years? But just in the next 6 months after you kind of graduate from our program, do you guys have an idea of kind of where you would see yourself fitting into the ecosystem long term and kind of staying and getting involved?
Okay, I'll go first. So yeah, like I said, I kind of have been in contact with Cerebrum DAO, people from there, and so when I would like to maintain that, and it helps, I'll think for my PhD, and then also being in contact with Cerebrum DAO, there's kind of like a symbiotic relationship there. So I would still like to be present in it, to help as I can, and then help it grow, because like I said, optimistic. So I see potential in DeSci as a whole, and specifically within certain elements of it, I really see promise there. And it's always nice to feel a part of something.
Nice.
So yeah, of course, I would like to stay in the ecosystem, and because I think there is a huge need in academia. So bridging this gap of DAO, decentralized concept, to sort of academia and institutions is definitely something I'm going to focus on. Knowing that my PI spending, as Tyler I think mentioned, 80% of her time applying for funding. We also got some interest from the industry, but the whole centralized part of things makes such a huge hurdle to how can we proceed with our projects. So I think definitely I'm going to stay, hoping that one day we can bring the whole CRISPR DAO or something like that into institution back in London. So really looking forward to that.
CRISPR DAO core member right here, if anybody's interested.
I think I see myself as an advocate for DeSci, whatever that means. And one of the things that I'm trying to get involved now is with BioDAO. I see Morgan there. And trying to, I think I really can use my whole training as a scientist to contribute into that, reviewing projects and everything from the different DAOs. I'm not just a synthetic biologist, but have training in molecular bio and many other things. So I think I can use what I have learned in academia to something better and greater, and that better and greater to me is DeSci. So I see myself involved with different DAOs, hopefully soon be out of academia, and kind of like transition to something more translatable, I will say.
Nice, thank you.
Yeah, you know that I'm all about gut health, so even our startup is focused on gut health. So the ultimate thing for me in DeSci would be creating a gut health DAO, helping and being part of this DAO. And yeah, that's where I see myself, like after I graduate out of this, I want to put myself into this and create this gut health DAO. If people are interested in gut health related topics, yeah, we should catch up for this DAO. Yeah.
Awesome, thank you. I just want to say as well, thank you all for joining your first DeSci event, going through a panel discussion and talking about your experience. And there are a few other Nucleate members in the room with us today. Some are also giving more talks as well. But yeah, the collaboration so far has been an absolute pleasure. Nucleate's been amazing to work with, and we really love what you're doing, and we're just grateful that we are kind of building everything in the same direction and having a great time doing it. So thank you.
Cool, thank you so much, guys. That was so lovely. Okay, everyone, we've got a 15-minute break, snacks, whatever you need to do. And then also just a reminder, when you come back, please try and fill up the front seats before we go to the back. Thank you so much. Oh, also, guys, second announcement. starting. We're going to have 3 talks. One of them's a panel, and then we're going to all break for lunch, which is always a real highlight of a conference. Okay, so our next speaker is Maryna. Maryna works with DeSci.Berlin. DeSci.Berlin has just closed a $1 million raise, and they are the latest BioDAO to join BioXYZ. So yeah, we're really, really excited about what they're going to do over the next couple of months. Maryna is a psychiatrist and a neuroscientist. She spent 10 years working on drug target identification and biomarkers, so is uniquely experienced with the issues of translational science. And yeah, she's a steward of DeSci.Berlin. So yeah, cool. Thank you so much, Maryna.
Thank you. Thank you, everyone. So we were actually aiming to bring a researcher with whom we're working at the DeSci.Berlin DAO, but last minute there were some changes, passport issues, and basically Anne from the UK could not join us. So let me guide you through my personal translational journey that I had in the academia. Before I joined DeSci.Berlin DAO, I've had quite a lot of ups and downs there. Before I start, I wanted to ask how many of you did PhDs in Germany? A couple, good. Then maybe I tell something new to the rest of the cohort. Yeah, so basically I started as a medical doctor. I was studying in Ukraine and started my journey as a psychiatrist treating dementia patients. And like after over, 8 to 10 years of education, I realized that I cannot help my patients. So I had to invest my brain somewhere better. And back then I was thinking, okay, that's probably research. Let me go and find new drugs for Alzheimer's. That brought me to Austria, to the Medical University of Vienna, where I worked on drug target identification. And then after some supervision issues, so that was my first PhD attempt, I decided to go for another PhD, and then I joined Max Planck Institute in Leipzig, where I worked on biomarkers and neuroimaging for depression and dementia. So basically what I was surprised in the beginning, I was told by one of my supervisors that you are going to discover the drug for Alzheimer's and you are going to be rich. And I'm like, okay, really? Let's see. We screened for drugs, but we actually had very little understanding of what's going to happen if we even find something. So there was never really an understanding of what is the whole process, what's going on, and what are the expectations to be. So back then, basically almost none of the PhD programs were translational, and majority of them are still not. So academics are taught to basically do science and, wait for someone else to translate their findings. So there was no translational training. Very often what I observed in Max Planck, there was very little connection to clinics and patients. So we are basically discovering some solutions for problems which might not even exist. Yeah, and what I also heard very often in academia, although that didn't touch me directly, very often PhD students are not able to select their topics at all. They just come and work on the topics on professors, basically developing the ideas of someone else. So this young generation, which has an option to bring some new blood, actually cannot really develop there. In my case, I had an option, but I have to say I was not knowledgeable enough to spend enough time to identify a very good topic. Yeah. So after the PhD, I was scouted for the entrepreneurship program, where I basically entered another world, which was the Entrepreneur First VC program, bringing 50 people from different backgrounds in one room and trying to create startups. What was very different from traditional academia is that they actually forced us to talk to patients and to clinicians that we have never done before, and that was very, very intense. That's something which is better in the traditional academia, but probably most of you know that in the VC world, they are just expecting to disrupt everything, build unicorns, you have to go fast. They were asking how can we speed up clinical trials, and that was another topic there. Very different world. Unfortunately, very few biotech outcomes from our cohort. Our Berlin cohort was meant to be medtech and biotech focused. Very few outcomes followed. And one of the reasons was that the investor network and all the training that they were suggesting was actually not medtech focused. It was just a general advice, which doesn't always work in the biotech and medicine. Yeah. So after this program, we continued developing our startup idea. The program actually wanted me to take my PhD findings and translate them into the product, which should have been the treatment response prediction in depression. And one of the interesting things which occurred very often, we had to talk to doctors and collect letters of intent. And all of the doctors told me, oh, really, you want to develop this tool? Just come to me when you develop it. So we listed. University A said, come to me when you develop it. University B said, come to me. And kind of some wrote the letters of intent. And those were only the people who were working specifically in this topic who actually wanted to co-develop something. So it's very important to find key opinion leaders who are actually interested in this. So we did not go for the VC funding. Actually, my team was not funded. But we decided to continue and worked until the COVID on funding that project with the treatment response prediction in depression. And the first thing which traditional academic community suggested was applying for exist funding. Does anyone know about the exist funds in Germany? Okay, a couple as well. That's better, even more. So this is basically one of the ministry fundings. And I think if if German researchers come to DAOs to ask for funding, this will be one of the first they might have tried already. There are two programs. One is designed for smaller teams, and they provide funding for 1 year in a stipend. And one is more competitive. They provide funding for 3 years for so-called research transfer, and it's very competitive, but also much higher funding. Yeah, we wrote an application to the Forschungstransfer. Not Forschungstransfer, the stipend, and one of the challenges for me was, because I'm not German speaking, we had to write it in German. So we wrote it in English. We came to the technology transfer office, and we had to rewrite it from scratch. Basically, because the expectations are very clear for technology transfer offices. And like you just have to be in the network in order to understand how to apply there. We wrote the application, sent it to preliminary assessment, then have shown it to another professor. He told, no, it's too early, like go back. So we didn't even submit that one. Yeah. Basically, from those teams who got funding, and I know they continued, basically they are getting stipends, but they are still working mostly on their own. They're basically not getting much support from the program themselves. Then there was another one. Another TTO told me, you go for Go Bio program. That's the one that fits you better. So we wrote again an application in English, again rewrote it in German, applied and waited, and 6 months have passed, and we've got rejected. So another attempt, Go Bio is focused on the developing biotechnologies. To be honest, what I didn't know that I can ask for feedback, and I didn't ask, and I didn't get it early on, although I could have. So another attempt, another failed application. What is interesting and what a lot of German startups do is applying for local funding. So those of you who are in Berlin, they probably applied for Gründerbonus. There is, in my city, there is the Sächsische Aufbaubank. They have a lot of programs. You often have to know people to know that those programs exist. You also have to know people at TTOs who will help you to write the application, because those are, again, very Germany specific. But there are also hurdles, and several times. So once we got funded in collaboration with the company, and they basically funded only 80%. So for the company it was all right, but for the academic partners, basically there were months and months of discussions. Where do we get another 40,000 euros to co-fund the project? And for one of the programs where I aimed to apply, basically this case where they did not fund 100%, stopped my institute. So basically they told me not to apply for it because of this in this case that was 10,000 K. Yeah, I had some experience with TTOs, and I think that in German universities they have quite some power. So there are small networks. The number of startups is usually also small, but they are very knowledgeable about existing programs. If you find the right person for you, they are usually very helpful. They are helping to rewrite those grants and guide you through all the funding. What is a little bit bad, I think, for translation is that there is an opinion that you have to incubate your project in university as long as possible. So sometimes those projects are living as university startups for 6, 8, 10 years. And in the end, no investor wants to invest in them anymore. Yeah. And there is a recent trend in Germany as well, which is creating in-house incubation programs. So German academic societies, research societies, were heavily criticized by the public that they are investing a lot of money in basic research, but nothing comes out. So there is this pressure, and under the pressure, they started to move faster. The Fraunhofer is traditionally a translational research society. They have created an incubation programs already some time ago. And Max Planck, where I was doing my research all these years, have created the Maximize program, which is kind of a copy of Fraunhofer. And there they fund you for the first 6 months with 50K grant, and for the next year with around 200K grant. Yeah, I think what all researchers who want to do their translational science experience is that there are certain deadlines, I don't know, once or twice a year, depending on the programs, and basically you apply and wait, apply and wait, and occasionally you get funded. So our project was funded by Maximize. We went through the first phase, received some comments. The jury was not from our field. They gave some comments in the first phase, and in the end, they came with completely different questions. So the project was not funded, and we didn't go to the second phase. What I think is really missing in all these programs is that they give you basic, first of all, the jury is not coming from your field, so it's very general. Then they give you basic entrepreneurship training, but nobody is actually connecting you to the network that you actually need as a researcher, and this is what DeSci can come with. Yeah, so we are independent as scientists. We are spending most of the time applying, and we have to somehow also progress on our projects along those applications. So it's quite challenging. Okay, so one slide is missing. Nevertheless, I wanted to also let me go back a bit. Oh, okay. Yeah. Before I go to some suggestions that like what DeSci could do better, I also wanted to speak a little bit about the talent leakage from academia. So it's not only projects, but also the talents. Our PhD network in Max Planck Society has conducted a survey which showed that it's not that the best people are staying in academia. It's always a combination of, I don't know, a good lab, successful project, so on. But sometimes people who just have some social duties, they actually decide to leave. And at the same time, industry is paying better, offers social security, better work-life balance. So lots of people are actually at a high stress, and they rarely feel supported by those funding institutions. And with this, I just want to go to the final slide, and I was thinking what we as DeSci could do better. So first, I think it corresponds a lot to what Nucleate was talking about, is could we maybe reinvent the PhD programs? Could we, from the very beginning, focus on translation and on trying to understand what is actually needed and how it can be developed for the clinics, for the patients, or for any other applications that you're working on? Second, which was there were ups and downs in this space about the expert network who are reviewing projects and who are also helping to find the right solution. Those we are currently connecting through the Cerebrum DAO in our case, but many others through your own DAOs. And something that is really missing in this academic funding, basically that so what we are doing now, we are aiming to provide feedback like by default after the application. And also, even if we do not fund the project at this point, basically we would like to stay in contact with researchers, help them to co-develop their ideas and maybe reapply in the future. All right. And I think that one of the messages that we discussed with Anne before we realized that she couldn't join, she told that it never takes one person to develop a successful project, neither in science nor in other areas. So in her recent observations, there were always the teams of three, she called them triumvirates, that actually combined different expertise to push one project to become successful. And I think that DeSci has actually the power exactly in this space where we are inviting people with very different expertise and helping basically to co-develop projects that would not be developed otherwise. Thank you.
Amazing, thank you so much. I think there's such a misconception that scientists spend their time doing science. They have to spend a lot of time doing this real drudgery of admin. And I think what I really love about decentralized science is this kind of focus on getting scientists back to doing what they should be doing and what they love doing, which is the science. So yeah, thank you so much. We have a couple of minutes, I think, before our panel. Not long, I think 3 minutes. So I wanted to take the opportunity to tell you a little bit about the space that we're in. So you're currently sitting in the Molecule offices. Normally there are desks where you are, but we moved in, I think, October last year. I'm getting a nod from Beata, that's correct. But we are in the old St. Agnes Church. So this building, it's a brutalist building. It's really well known in Berlin, and it's a real feat of architecture. The building is mainly the König Gallery, which is just, if you go out and around there, there's the entrance. If you have time, I really recommend checking it out. The art is amazing, and the architecture is mind-blowing. So it's been quite cool, I think, coming to the space every day. You stay very inspired. We've got amazing art on the walls as well that's on loan from the König Gallery. So, I mean, just really fantastic. The DeSci orb up there is, I mean, it illuminates our way. So yeah, have a look around. Oh, I must also remind you that there's a coffee shop. If you're on your way to the Koenig Gallery and you feel the need for a snack or a coffee, there's a coffee shop behind us, and you guys have got 50% off as DeSci participants. So yeah, go and use it. I hope you enjoy it. Cool. Do we have our Chris Leiter? Is he here? Okay. Cool. So thank you. Go fetch people. I'm trying to think what else I can tell you about. So we have 2 days of proceedings, well, 1.5 days technically, and tomorrow there is a beach bar after party. I, for one, did not know that there were beaches in Berlin, but there is. So we're having a beach bar after party from about 1 p.m. onwards, and so I'd like to see you all there. But yeah, okay, cool. This is Chris Leiter. He'll be moderating our panel, and he has asked if he can introduce everyone, so I'm actually going to hand it off to him now. Cool.
Hello, everyone. So I think we're like this, second to last panel before lunch, right? Is that right? I don't know. Anyways, so we'll try to make this really exciting because we all are going to do the investor panel here. I'll sit down. So we're going to talk about investing in DeSci and thinking about it from a token, liquid token point of view, BioDAOs, but also just the wider macro picture. We've all had various investments from our firms in the DeSci ecosystem. So I'm going to first let the panel introduce themselves and kind of maybe just give a little bit of overview, one by one, kind of the investments you've made so far. And then we'll get into some topics. Importantly, we're going to make probably like 10 minutes or so for Q&A. So have some questions for us would be great. My name is Chris Leiter. I'm the founder of Atria Ventures. We're a pre-seed fund focusing on infrastructure technologies in the life sciences. And we focus primarily investing at founders from inception stage all the way into seed. We invest globally, based in San Francisco, and been a great partner to Molecule from pretty much almost the beginning, Paul. So, Nima.
Hi, everyone. I think it's on, right? I'm Nima from Sinka Ventures. We operate actually as an investment DAO, or investment collective, so not technically VC. And we're also investors in Molecule, not really directly investing in IP NFTs, but we have a number of investments in other venture DAOs, like Beaker DAO, for example, and projects operating at the intersection of crypto and AI and bio, like LabDAO. My own background is in cognitive science and robotics. Somehow that got me into crypto, and now I'm full-time focused on Sinka Ventures.
Awesome. Rapolis.
Hey, Rapolis. I'm with Z Prime Capital. So Z Prime is a crypto-focused venture fund. We started in 2018. We run free funds. We focus on pre-seed and seed stages. So really sort of category agnostic. And we discovered DeSci through Molecule. So we invested there, I think in 21. And then we participated in some of the BioDAOs, namely HairDAO, Cryo, VitaDAO, and Beaker DAO as well. So yeah, that's us.
Alex.
Cool, good to be here again. I think this is the third conference where I'm sitting on some kind of a panel. So thanks for the invitation and organizing it. Yeah, my name is Alex. I started Inflection in 2019. We're a fund also focused on early stages, pre-seed and seed, with a core thesis around sovereign computation, spanning different areas around the scale of compute networks, resilience, as well as free flow of data. We've been involved in Molecule since 2019, I believe. Late 19 or very early 20. Did one other investment into LabDAO in 2022. Those are the only two investments we've made in the space, but we followed it very closely, and we also take very concentrated positions in our portfolio, doing about 4 to 6 investments a year. Yeah, great to be here. Thanks
awesome. Thanks so much. So I think as investors here in the DeSci ecosystem, one of the key things that investing in DeSci is a little bit different than other crypto projects, because we're all kind of crypto investors up here versus biotech investors. how have you guys thinking about developing your thesis in the space, but also diligencing projects? How have you gone about doing that, and what do you look for when thinking about investing in a DeSci project? I don't know who wants to go first, but.
Yeah, so for us, I think DeSci is like one of the most ambitious categories within crypto. It's certainly like maybe not as prone to the copying of ideas as we kind of see in like other crypto verticals, and so it kind of takes more of a original thought to make create an impact. So I think this is what attracts us. I think our core thesis around DeSci is that we think that the funding of science can be sort of changed instead of that being top down. We can make it like bottom up, where the best ideas win and the access to capital is easier. And so we always start with this sort of Victorian era scientist, who's like sort of self-funded or like independent researcher and doesn't depend on like the top-down governmental structures to fund the research. And we kind of want to bring more of that spirit to science, and I think DeSci is kind of good at that. And in terms of how we pick teams or projects, we think actually that like some of the, like even within the DAOs that focus on different categories, there's big differences. Like some of them are more fun, like some of those problem areas are more funded than the others, and so we kind of try to focus on ones that are like more, let's say, controversial, like not as funded. For example, like cryo is one good example of that. So we kind of try to lean into that, the longer tail, I guess.
So you're kind of looking at technologies or pieces of science that are a little bit more out there and maybe haven't been funded by traditional science or science-based investors. Yeah. Cool. Awesome.
Yeah, I'd certainly echo that. Looking out for primarily powerful ideas that can have a deep-rooted impact on the way things are done in science and research, in drug development particularly, is basically rule number one. And then the other piece, I think, would be just watching out for teams early on that have a proven track record of resilience, that worked on a tough problem space for a while and are willing to go through the ups and downs of creating a company and pushing against the current. I think in these areas here, also a couple of years ago, this vibe here and the ecosystem around decentralized science feels a bit like the very early crypto ecosystem in 2015 or so. So that's usually where the most interesting ideas emerge from. So those are the two primary criteria. Usually in terms of traction or so in pre-seed seed, there isn't too much you can look at. But yeah, curious to see how you would also see this taking more of a biotech lens than a crypto coordination lens.
Do you want to go first?
I'll jump it out.
Okay. So we published we published our investment thesis a couple of years ago around internet native organizations, and I think one of the areas that principles of decentralized governance and community empowerment is being applied is in DeSci. That's also our primary filter for due diligence. We see which communities have more momentum, so instead of just like one mad scientist trying to patent stuff, it's really like hopefully a couple of hundred community members already actively exploring the space. So that's one, the filter of community empowerment. And the other one is around like what are areas that are almost unfundable? You know, there's this joke that like entrepreneurs need to be unemployable, unhireable. So what are these areas? I think we heard Balazs earlier today talk about PsyDAO. That's an area that's really exciting, or anything that just doesn't make financial sense for traditional pharma, kind of like TradFi, but pharma. So I think these two are our primary filters. We're not really excited about, I don't want to say generally IP NFTs, but like the approach of using these BioDAOs as just like early stage incubators to then sell into pharma. Ideally, what they're working on, the IP, is either in the commons or it can be sustained through later stages without having to go through the same clinical trial path.
So that's a great segue to my answer, because I take a quite opposite view, actually, out of that, which is I think there's ultimately both truths have to kind of take hold for DeSci to be, I think, successful. You need to have those who are attacking and starting new DAOs and new projects that are underfunded or overlooked by pharma and the traditional investors, and that have to stand on their own. But at the end of the day, this is an investor panel. We know there needs to be liquidity in the system. We know there needs to be investment in the system. And the one thing further stack up to funding these investments are trials. Trials are incredibly expensive. And I think just to remind this room, and Tyler mentioned some of this stuff up front, but it's $1 billion on average and 10 years to get a drug to market. And let's just face it, that liquidity does not exist in DeSci today. Now, should it in the next 5 to 10 years? Absolutely, right? But to make the opposite of your point here, which is we will need to partner with pharma, and we shouldn't be afraid to partner with pharma. And we should be looking at those projects that will have follow-on funding from traditional biotech investments and investors, but also bringing in and educating the Novartis, the Pfizer, the Bayers, the Modernas of the world, because ultimately they need to come to where we are, just like we'll have to access those pools of capital. So, as a more traditional bio investor, that's I think we have to, straddle both of those truths in one sense. But I'm sure we will see how this plays out.
I just wanted to paint the picture that you described. Can you imagine if Uniswap was supposed to go to NASDAQ? Like that just...
I completely see the point here, but the issue is that at the end of the day, we have to be able to run these trials. Now, there's a lot of interesting projects like in Honduras, the Vitalia city. There's ways to experiment around clinical trials that may happen, but to do that at scale, to bring these drugs to market, that still is going to require an immense amount of capital. Now, I think the key thing that we need to hone in on here as an investment panel is like, where are the areas that we can be able to invest in that can stand on their own two feet and can bring drugs to market? And so what I actually look at and what I'm really interested in are these huge unmet needs like AthenaDAO's doing, which is pharma has not run a clinical trial in hair loss for like 2 decades, like at scale. And look at the success AthenaDAO's having, and it's such a huge issue. So I think that's a great example where there are a huge unmet consumer need, and the trials can be done essentially OTC. Or, you don't need to run a 10-year, to phase 3 clinical trial for a consumer product. So there's things like where there's like natural products involved, and solving a scientific need or a medical need is an interesting overlay, and we've been seeing that so far here in terms of what the DeSci ecosystem is. Anyways, I've talked for a while here, but maybe the kind of next thing I'd like to talk about, and I was just mentioning, is like the liquidity kind of issues that not issues, but we need to be mindful of bringing in other types of investors, other pools of capital into DeSci. I'm curious of how do you see the long-term investment thesis driving here that we're going to allow more liquid tokens, being able to invest in new types of projects like bio being launched. I'm just curious, from the panel, addressing that kind of liquidity and how do we promote that inside the DeSci ecosystem?
Yeah, I think that's a very, very critical question, because that's really a starting point for the whole ecosystem. If we can't get very early stage funding right, there's not much potential for growth. And we actually have a couple of other industries we could look at and draw analogies from. So primarily, I'd say even like private venture markets have been very closed for the last few decades until platforms like AngelList and others came up, broadening access to a larger pool of investors, often still accredited and boxed into the regulatory framework, but still it's a starting point, and I think that's something we'd need for this ecosystem as well. And for that, we'd probably need to get distribution right. It's a very complex environment, not very well suited for retail in general, but starting with patients and very value and interest aligned groups might be a starting point. And then probably also have high selection criteria for quality. That's this big struggle. How permissionless do you want to start, or should this be like pre-selected and have a somewhat of a high quality filter applied to it? I'm sure the molecule team could talk a whole evening about this. But yeah, I feel that's where we need to start, and would be curious to see what your impressions are.
So basically, because you bring to what you're saying is like, how do we get retail involved? Is this kind of what you're saying? Retail investors, getting them involved. Is that
in
kind of
the
your
very
point?
earliest stages? Yeah, I think that the late stage is clear. That's also didn't change much in venture. You got all the big multi-stage firms and PE funds and so on, and then pre-IPO rounds, investment banks in the very
all the big asset managers doing pre-IPO.
That didn't change too much, but the early stages changed a lot, and I'd argue this might look similarly in this space too.
Well, I don't want to preview Benji's presentation on Catalyst, but I think we'll talk about that. But yeah.
Yeah, I think ultimately, the capital on chain finds the place where it needs to be, and I think like DeSci as a category is still very early, and only recently we're starting to see some kind of like more mature signs of like success, that there's something there, and I think people will naturally notice it over time. And I think in terms of like how to get retail sort of more involved, like if retail capital is important, then I think it's just kind of, bringing maybe that early stage research even earlier, and, tokenizing and putting it on chain, and, letting people to kind of express their views on these assets, because like ultimately that's what retail likes to do, right? So, and I think, if we can have, Pfizer, play with governance, with the tokens that they've bought, then I don't really think that kind of like bar is really too high for, the retail people as well. And yeah, I think it's ultimately just, kind of about the actual progress made in the real world, and then like communicating that to kind of market participants. And I think, markets are like the best arbiter actually for this kind of stuff.
Thank you. I have more like an inquiry or question. One is perhaps for our audience and during Q&A.
And we're going to take audience questions in a second, so which is great.
Yeah. I'll try to be the audience now. One is, at the moment, at least from my vantage point, it looks like IP NFTs or IP tokens, they're a bit too similar to security tokens, which there is kind of an existing niche small market in crypto for. So that's one of the challenges. How do we create alternate governance and kind of financial tokenized infra that doesn't too obviously look like this is a pre-seed stage pharma company that is just tokenized, or their IP is tokenized. So I guess that's a challenge that needs to be figured out. I don't have an answer for it, but I think our friends from Molecule, they have some mechanisms. The other one is, I think it's difficult to expect from the average retail investor who's not a scientist in that specific niche to have any fucking clue about like this molecule or that one, which one they should invest in. So that's why I think it does make sense that we have DAOs like VitaDAO. They act as kind of 2, 3, 4 layers of abstraction between the kind of underground studies and research and something that the community can relate to and have a say about. So like it just makes sense for HerDAO to have people who need their treatments as governance participants, but probably those people are not qualified to be on the selection committee of like what gets funded. So these are 2 observations or inquiries I just want to put out there in case someone from the audience later wants to contribute to.
Appreciate it, thank you. I'd love to open up to the audience for some questions here to our investor panel. I don't know if we have mics, but we can maybe just shout or something. So why don't we can always do that. And I'll try to repeat the question back for our online audience. Who wants to ask a question? Anybody here? No? Oh, we have
Benji,
somebody.
you have to be on
I
the
can't
other
see you,
side of the
sorry.
room.
Okay. And can you just say your name and where you're from? Oh,
my name
right,
is Benji. I'm from San Diego, California.
I think I know who you are. Okay, I couldn't see it.
It's so nice to meet you. You guys are all so smart.
Great to meet you, Benji.
Yeah. No, I really appreciate the conversation. It just has me thinking. So, you know, there's kind of like this kind of 2x2 square like matrix that we're looking at in DeSci. On one hand is like, you know, we call them retail, just individual capital contributors. The other is like more traditional institutional investors. And then you look at like what types of opportunities DeSci has to offer. And, you know, one of them is individual research projects. And the other is, you know, these kind of tokenized research areas like AthenaDAO, for example. Is there ever a world in which we can move into the case where we have individual people funding individual projects, or are we forever kind of you know, limited to the case where we have more institutional funders going into these more diversified tokenized entities, whatever you want to call them, DAOs?
I will not mention the name of this friend. She actually is gone. She's not with us any longer. But it was a very lovely person in crypto who was doing non-DAO, non-crypto citizen science research. And she was very active in the governance of that project and also fundraising the whole life cycle for a really rare disease. So I think in cases like this, it definitely makes sense to have people who are either close to such patients or directly impacted or have like, let's say, genetic hereditary tendency to potentially have the same disease. It makes sense to have them involved, but I'm just struggling to see like the average degen who's flipping like NFTs to, like, I think that's gonna be problematic because then it looks really like people just speculating on memes. So it would be great to have retail involved to the extent that they can actually contribute something. When it comes to the financialized layer, I think it has to be like a few layers of abstraction. Tyler has I guess, a response to this. You get the mic? We're getting the mic to Tyler.
How do you guys think about, so I mean, Nima, to your point, I think one of the most interesting kind of use cases, it's really more of a matchmaking problem than anything else. Like, there are projects that a specific community would be very interested in seeing funded and translated. And to the IP-NFT, IPT question, you know, I think this rare disease case that you brought up, for example, is amongst the most interesting. It's also probably where my main interest in the space comes. So wanting to have, you know, there are assets that probably wouldn't be picked up by pharmaceutical companies, for example, where there's a strong clinical need, and there's probably enough people in the world, if you could bring them together with enough capital to actually get that through the translational gap. And I think to Chris's point, you know, at some point, these assets are actually going to need to go through a probably much more expensive process than they would be able to, maybe even with those participants. So I don't think it precludes, for example, pharmaceutical companies from participating, but it's really around the translational gap. I think the thing that complicates that and that the space hasn't figured out yet is the fact that you have people who are fundamentally interested, some group of people who are fundamentally interested in seeing this asset come to life, and then some other group of people that are interested in speculating on it. And the current tokenomics and kind of design of the space is really around governance instruments, so to enable decision making. And I wonder, for me, the biggest open question that I think the space has to wrestle with and figure out is to what extent those two things, governance and speculation, are ultimately intertwined in the same vehicle and the same function. And I think this is kind of a challenge that there's not enough discussion around. It's like, obviously, you know, in capital markets, you see this also with equities, but I think, and so there is an analogy there, but referring to like to your point around like degens and the way and this type of capital, I think it's people with very different time preferences, very different behaviors, kind of in a structure with people who are trying to achieve a very specific goal. How do you guys think about that, not only in the context of DeSci, but in the broader crypto space in general?
I'm going to like take one part of your question there and try to expand from there, which is like, you mentioned something, you know, speculation and marrying that with governance, right? I mean, this happens today. in the public markets, right? You know, if you look at the XBI, which is the index for you know, public biotechs, you know, there's a biotech that opens, you know, their phase 2 or phase 3, it's a negative clinical trial, their stock just drops like the next day, right? Like this is very typical. I think what you're saying and what the challenge is like, you know, that speculation is a market activity, and by the way, that is a healthy activity. That is what we're doing here in DeSci, and certainly with what Molecule, the infrastructure you guys are building, is actually bringing that at the very, very, very earliest stage of scientific development. There's a huge amount of risk in that, but the huge amount of reward is you're actually being able to see early stage results, potentially earlier, but secondly, you're able to bring in more diversified groups, so patients can get involved. You can bring in retail potentially, or you bring in, you know, professional investors. It's just going to be this tricky dynamic. One thing that what Nima was saying that kind of is linked to your question that I thought of is like, is it interesting where you actually are able to fund a lot of these small projects at the earlier stage, and then you can have a basket around certain rare diseases or certain therapeutic areas, and you can start to see funding across, you know, not just tens, but hundreds and thousands of these small projects. And then you can develop actually speculative mechanisms that are baskets of these, right? And you can have index funds from a crypto perspective. That seems really interesting. So it comes back to a fundamental point that I think everyone in this room's talked about, which is just scaling. How do we scale? How do we onboard? How do we get more scientists, you know, onto the ecosystem? That's ultimately the demand supply slide that we need to have to think about. I know I'm taking your question in a different direction, but that's the ultimate issue here.
I think it's a great point, and I think it's, you know, the difference with a company or an equity is that in many cases you have like a full team, you know, that's you have people that are, the people who are speculating are not the ones who are responsible for making decisions about how the company is moving forward in some cases. And I think this is a problem that DeSci faces. It's like, I think there needs to be more maturity and more sophistication with the actual research management asset and what is expected from the actual participants who are pushing these things forward from a governance perspective.
Okay, so the Molecule board meeting part of the panel is over. Really quick comment, and then let's have a non-molecule question back there after.
One quick comment on that is applicable to what we see in DeSci, but also beyond. I don't think we have to reinvent the wheel. There's a lot of things already working relatively well in shareholder-driven companies. So usually governance comes with ownership. What the big opportunity here is mainly to distribute ownership more broadly and create more of a stakeholder than a shareholder-based economy, and that can be done programmatically and automated in a way. So that's the most powerful tool, and from there we can hopefully make the economic mechanisms more sustainable and more aligned with the actual consumers of the product, and that's patients. Yeah.
Yeah, hi guys. What do you think about vertical investments versus horizontal investments? Vertical will be into one single project, right? Bring in the whole billion, right? Go through. And horizontal will be you're building out actually a research stack, something that allows people to more capital efficiently to research. Because is it even possible to bring in that amount of capital for all these projects without increasing capital efficiency first?
I have not much to say on this, just giving you the microphone.
Okay, I have a few comments that I can make, but so maybe reinterpreting your question and let me know if am I correct about this, is basically like, how do you think about investing in one scientific project or one DAO or one therapeutic area versus the technology that enables all of these therapeutic areas or scientific projects to rise up? Is that what you're saying?
Exactly. Now, basically, what do you prefer on, and is it even possible, right?
Yeah. So, I mean, candidly, like, this is something I've been looking for as an investor in this space. You know, there hasn't been a lot of infrastructure in this outside of the Molecule, you know, ecosystem in terms of how do we think about, okay, we're thinking about financing. That's the base layer. That's what we're doing here. You know, Nicholas at LabDAO will be opening the conference tomorrow. LabDAO is solving another layer in the stack, and that's kind of very early stage chemistry work. That's preclinical work to help some of these BioDAOs and projects get into the clinic. but there is so much more that needs to be built. So, thinking about Prospera and Vitalia and what they're doing around how do we have more, open clinical trials is really interesting. But these are all very, very small point solutions at the moment. These are not what I would consider horizontal platform technologies that are going to enable everything to kind of rise up. And so that is something I am looking for in the space, and is really expensive to build, because the return on investment on that, it's not like a crypto token where you can actually launch a token and there might be liquidity come in. It's more of like a traditional venture backable, venture scaling type of, at least in my view, and there might be some disagreements on the panel, so I will pass them over to them. And we have to end in about a minute, so we'll be quick.
The end. But there is an old concept called search funds. I think there's an opportunity right now to, so let's say you have an interest area and you raise funding before there are even companies, and you go and, it's almost like an SPV, but like more generalized. So now I think there's an opportunity to combine that with building LLMs for that specific search fund. So you could raise funding, for example, to create a somewhat generalized LLM or a family of machine learning models that then help you have much more, let's say 20x efficiency in finding molecules for that specific space.
Yeah, there was more comment on how to extend the capital base around the previous question, and just read a recent quote from Balazs, it might be a few years old, where he's saying it was much easier to create Bitcoin than to reform the Fed, and we might actually face a similar situation here, where we have a hyper over-regulated environment and might need to think completely outside the box, ignoring the established structures. But as you say, this will have very small scale early on, might be more of a multi-decade project.
I would just add that I think DeSci is still like at a phase where like it needs both horizontal and vertical investments, and I think like as investors typically, investors typically like want to invest like in, in the safe bets like picks and shovels and that kind of thing, which sort of implies infrastructure. And we see that like the rest of crypto, kind of other verticals have suffered a lot from this, where there's like too much, investment in infrastructure and like not enough in applications. And, hopefully like DeSci can draw the correct lessons from there as well.
Awesome. We actually just have one more comment here, and then we'll wrap up. Yeah. Beata gave me permission to extend it a little bit.
Okay, thank you. Sorry for last comment. I just wanted to make a comment about the first question of NFTs not being considered security as a danger. I am a lawyer. I wanted to say that in this area there is a lot of regulatory issues, because only in the European Union we have GDPR for privacy, the Data Act, which will come into force next year, a forthcoming regulation about medical data. So whenever you take data or IP and you put into NFTs, there are really a big level of regulatory issues that has to be resolved before creating a product like this. Just a very quick comment.
Yeah, I mean, you're 100% right. And so, I think touching base, and also, I mean, a lot of these regulations change a fair bit. So it's always important to keep touching base, which I think we all do. Awesome, okay. I'm gonna run up the aisle. I don't know why that makes you feel like I'm at a concert. Thank you so much, guys. Cool, okay, we've got one more chat and then, or discussion, talk, whatever. Can I hand that over to you? Thank you. And then we're going to break for lunch. So we have Julia Zhao from Nucleate presenting, and I'm actually just going to read her bio verbatim because I just thought it was so great. So Julia is the Global Director of Activator Operations at Nucleate. She's responsible for nurturing biotech innovations and supporting scientist entrepreneurs over 30 global regions. Julia has an intimate understanding of these challenges within translational medicine, given her training at Memorial Sloan Kettering Cancer Center, Mount Sinai School of Medicine, and Johns Hopkins University. Committed to bridging this gap, her experience in healthcare consulting and venture capital allows her to cultivate investments in life science innovation and strengthen global alliances. Awesome. Thank you so much.
Hello. Hey. Hi, everyone. Nice to meet you. I'm really honored to be here. Thank you for inviting me. And I do realize I'm the last thing between you and lunch. So I'll definitely keep it concise and energize you with some of the exciting stuff we're doing at Nucleate. And I'll be around for the next 2 days, and come find me if you want to talk more about Nucleate and how to be involved. So today I'll share with you a little bit about what Nucleate does, our flagship program activator, and spotlight some of our efforts in Europe, and finally invite you guys to our global summit that's happening in August at Santa Cruz in USA. Quickly, thanks for Molecule, and I think we share our biggest mission together, that Nucleate, our #1 mission is to empower the next generation of biotech leaders by empowering and educating today's trainees. We are 501c3 nonprofit. We're free and open to all. We are led by trainee and for trainee. And as a lot of trainees in the cohort or in the audience would feel, as your training goes on, as your topic narrows down, you dive deeper into your topic, it could feel like your community is shrinking. And at Nucleate, we're trying to provide the opposite. We're connecting all the scientists across the globe, and this is where new innovation starts, when you meet people that are different than you. Could be working on similar things with you. So a lot of the times, as global director, I'm learning a lot from our leaders across the globe to understand their ecosystem and how to strategize our efforts in the areas. And we're constantly promoting a lot of our emerging and associate chapters. So right now we have more than 1,000 active student leaders in over 30 regions and in over 200 institutions. And we understand everything starts with good culture and community. So at Nucleate, similar with mission of DeSci community, that we believe biotech education should be open access to all and not to a privileged few. So at Nucleate, we identify, educate, and develop talents by fostering innovations and spark new intellectual communities. It started off in Boston for the first 3 years, our flagship Nucleate Activator program, but it soon developed way beyond that. The #1 testimonial we hear from many people when I meet them is, I wish Nucleate existed when I was in school. So Nucleate, right now, we're aiming to be world's largest educational organization for functional and impact-driven life science career development program. And as you can see, our leadership team carries diverse degrees, and we also support them to achieve diverse career paths that they normally couldn't get through their academic trainings. And here's a big shout out to our leadership alumni. They are everywhere in the society, and I need to update this slide. Our leadership will end up in Molecule Fellowships and continue on to contribute to DeSci community. And right now is a good time for me to introduce you to our flagship activator program. At Nucleate, we're really trying to support all sorts of innovations for human and planetary health, and starts from therapeutics, diagnostic tools, to food, agriculture, chemical, energy, consumer products. Anything that brings a solution to patients closer or to consumer closer. And for our activator program, we facilitate company formations in the life science through a very structured matching process and curriculum. To give you a brief overview of the program is, at the very beginning, I'm trying to use this pointer. It's not moving. Okay, start from 0. We have leadership on the ground in the institution, sourcing technology from their peers. And we actually spend quite a good amount of time in team formation. So throughout 3 months' time, we introduce scientists to clinicians, to business-minded students, to other scientists, together, and with engineers as well. So together, they're figuring out solutions of a critical problems in the end. And for the next 3 months, we connect them to mentors, experts, tailored experts workshops, and other founders, industry leaders, investors, so they can build their projects together, going through topics very crucial in building companies together, such as what's your competitive landscape, what is your science and market risk, how to fundraise, what's IP regulatory strategy in your area. And at the end, we celebrate everybody's achievements in number 5 at Pitch Showcase and Demo Days. And this year we have close to 21 demo days across the globe. And finally, in August, we celebrate everybody's achievement by bringing everyone together with our alumni at a global summit. So our 2024 cohort is largest to date. This year we're supporting close to 160 teams and representing 120 institutions worldwide. And this is a little showcase that we're representing very diverse geography, and shout out to what Tyler mentioned at the very beginning, that one of the first steps for decentralizing is to be geographical agnostic. So at Nucleate, we provided an opportunity that even if you don't exist in our current ecosystem, we want to provide a virtual opportunity to you. So here is a showcase of our global virtual program that captures innovations from across the globe that we don't have a presence yet. And finally, our activator teams are eligible for many of the prizes sponsored by our corporate partners and VC partners. They're available to compete for 2 million uncapped safe with Pillar and Blue Yards, and also 2 additional challenges for all non-dilutive grants with Alnylam and Eli Lilly. And our alumni are going to places. For 6 years at Nucleate around, our alumni team has raised close to 368 million. And it's really lovely to see our alumni companies at conferences, continues to see them succeed and bringing the treatment closer to patients one day. And here are some of the testimonials. It's really lovely to hear that a lot of the teams or co-founders would have never met if not through Nucleate. And also, they would never met their mentors or advisors if not through our program. And thank you, Ben, for saying that he would recommend a program to everybody he knows. He believed this is one of the best accelerator programs. And here I want to give shout out to our corporate sponsors, our venture partners, our philanthropic partners, and Molecule for working with us this year to bring the opportunities to scientists, to give them power to decentralize and to promote innovations. And here I want to highlight a little bit of our efforts in Europe. So right now we have 4 core chapters in Europe: UK, Germany, Switzerland, and Denmark. As you see, we have 3 associate chapters. We're promoting Netherlands next month, very soon. So we're about to have 4 associate chapters and 1 university partnership in France. And the development of Nucleate Germany is extremely exciting. We have over 40 leaders in Germany. And this year, inaugural year of Activator, we're supporting 8 teams across various institutions from Germany. And we spend 3 strong biotech hubs in Germany as well, from Heidelberg to Munich and to Berlin. And want to give out shout out to our Germany leadership as well. They're extremely talented master PhD students. And Su Yan over here is part of the fellowship program. They are the faces of Nucleate Germany, and they represent today's trainee leading tomorrow's biotech. And finally, I want to bring your attention to Global Summit. Last year, our summit is at San Diego. We were able to bring over 500 people to San Diego across 3 days of summit events. We sparked many innovations, collaborations between Nucleate leaders, startups, alumni, thought leaders, sponsors, and general enthusiasts in the community. We're able to bring people from over 14 countries and 6 close to 60 cities to our summit to spark innovation and communications. And thank you to our summit sponsors from last year. We're looking forward to more engagement this year and calling for the community to join us either as speakers, sponsors, or providing the opportunity for a team to attend, providing an opportunity for scientists to attend our summit. So please reach out if you want to be speaking at our summit or supporting a team to attend the summit in San Francisco this year, Santa Cruz this year. And lastly, this is a QR code. If you scan, there's a link tree to all of the links that you could possibly want from Nucleate. So joining our global newsletter, our website, it's out there, how to involve as mentor, experts, how to sign up as a team, anything you want to be involved in Nucleate, scan this QR code. And I'm looking forward to meet everybody in the next 2 days. Thank you, guys. Yes. Yes. June 14th in Berlin. Absolutely. Thank you. Good shout out. So if you scan this link tree, there's a demo day tour registration. And in there, you could find the Luma link to the Berlin registration as well. Hope to see you there, June 14th in Berlin. Thank you.
Awesome. Thank you so much. Yeah, as you guys are going to learn, our partnership with Nucleate, really exciting. We also are actually having an activator team pitch contest tomorrow. It's going to be our last session of the day. So that's going to be really exciting. I hope you guys join. And it's also going to be a competition. You guys are going to have to vote on your winner, and then they get a prize. So yeah, come ready. Lunchtime. I'll see you guys all in an hour. Have fun. There's a lot. But Benji was working for a VC firm, and Chris Leiter, who did our investor panel, sent Benji over a deck being like, hey, would you guys like to invest in this thing called Molecule? And Benji got up and left his job and came to Molecule. That's how much he responded to that deck. I don't know, it must have been an amazing deck. But yeah, I mean, if it speaks to how sort of mission and value aligned people can be in this space, I think it's a pretty amazing thing. But yeah, so Benji's going to be making a big announcement from Molecule's side. So yeah, I'm going to let him get into it.
Thanks, Ella. Test. Thank you all so very much. It's so great to be here. I'm Benji. I've been with Molecule for about 1.5 years since I left that awesome VC fund, and they let me come and join what is now the coolest team ever at Molecule, and I'm really excited to give you a sneak peek of what we've been working on and why we're working on it. Did Balazs steal the pointer again?
Yeah.
Thank you so much. That was amazing. Cool. So, like many other people in DeSci, my parents often ask me, so what do you do again? And honestly, I have a pretty tough time answering them sometimes. It's super easy for us to get caught up in the tech we're building and how exciting it is, and you bridge from Ethereum to Base, and you do all these things, and they're like, what are you talking about? So if you guys don't mind helping me out, I would love to ask from the crowd, if you're okay with it, what is the biggest challenge to overcome in scientific research? If you guys want to raise your hand, it's one word. What is the most important thing? Thanks, Paul. That's my boss. Incentives. Cool. So yeah, I mean, Charlie Munger, one of the great minds of our time, vice chairman at Berkshire Hathaway, said, if you show me the incentive, I'll show you the outcome. Dee Hawk, who's the founder of Visa, said, if you can design the right incentives, you don't have to worry about anything else. So I thought starting this talk would be important to kind of analyze what are the incentives in the two fields that we're straddling, which are research and crypto. And if you look at each one, each bullet is supposed to kind of correspond across each kind of target market. But in research, the goal is to achieve intellectual freedom. You want job security, you want tenure. It's really to be able to study whatever you want, right? And in crypto, the goal is to kind of achieve financial freedom. In research, you want to receive citations and recognition from other prominent scientists in your field. In crypto, you want to receive tokens, points, and influence. Publishing is important across both. In research, it's in prestigious journals, and in crypto, it's on Twitter, right? In research, you want to achieve long-term funding, and in crypto, you want short-term gains. In research, you're looking to publish only positive data and findings after you make a big discovery. And in crypto, you want to publish memes and capture mind share all of the time. And in research, you want to pursue knowledge and respect. And in crypto, you want to pursue gains and respect. So I think it shouldn't be a surprise that neither of these fields are kind of aligning with solving real world problems because the incentives aren't aligned to doing so. Right? So I think the main question here that Molecule is trying to solve is where is the incentive to contribute to human progress in either crypto or in research? Cool, so if you kind of boil it all down, what we're trying to accomplish, our mission, is to realign incentives in science and crypto toward accelerating human progress. All the products that we build, whether it's Catalyst or any of the other primitives, is to solve this problem. So yeah, for the past 5 years, since 2019, Molecule's been kind of trying to answer this question. We have a funder who contributes funding to the researcher who develops IP. That IP is granted to some sponsor who gets IP rights, but the question is, what can we give back to the original funder, right? And this has been super important for us to analyze what are the key requirements of that thing that we give back to the funder in exchange for research funding that represents human progress so that we can keep the incentives aligned with generating it, is legal, doesn't get us or anybody into trouble. And 3 is compelling to fund, so people are excited about funding. but also allows the researcher to do what they need to do, change the world, and protect their IP. So the first experiment run by Molecule was in 2019. It was an initial iteration of Catalyst, and it went for much more of an open science approach. There was no IP associated with it. It was really more philanthropic, with the hope that at one point in the future there would be IP rights associated with it. They used bonding curves to purchase the tokens, and they were purely kind of symbolic. And although it wasn't successful in a financial sense, the real finding here, there's lessons with any experiment, right? There is no negative data. The real finding was that this kind of open science narrative was insufficient to generate excitement about funding research. So several other experiments followed. In 2021, Molecule looked at trying to launch a DAO that is kind of this diversified portfolio of potential IP. And that did seem to be like a compelling value proposition to funders. And VitaDAO has been a raging success. And so trying to capitalize on that finding, Molecule launched BioXYZ and has tried to scale that finding of having funders put money into a DAO that can then go and generate IP as kind of an aggregate. And so in 2023, we took a slightly different approach, where we tried to say, rather than tokenize a research area, we're going to try to tokenize an individual project. And this project has been VitaFast, the project at University of Newcastle. And it was also kind of this validation of this new value proposition to funders, which is direct IP rights in an individual project, not just a DAO looking at generating a massive IP portfolio across a research area. So where we are now is trying to scale the finding that we had in 2023, which is that this is a pretty interesting value proposition to provide to science patrons, which is funding individual research projects. So what's interesting about scaling this last model is that it has not been a demand issue. It hasn't been, we have all these great projects and we're just looking for as many people, and we're looking for more people to come and fund them. It's actually been a supply issue. We thought we created these magical intellectual property liquid tokens that a ton of people would be super excited about, but only one instance of an IP token has launched to the market yet. So our goal right now is to scale as much as possible and measure success by the amount of on-chain IP value. And so begs the question, how might we increase this on-chain IP value? And we think that there are a few opportunities. So number one is in bringing liquidity to projects that are funded. So as the BioDAOs have started to deploy capital into research projects, what they find, kind of what we always knew, is that these projects were relatively illiquid, right? I mean, you sit on a piece of IP for maybe 10 or 12 years before you could ever think about selling it to somebody else. And so where we see a huge opportunity is in providing early stage liquidity, potentially as soon as a project is funded. Another is in incentivizing contributions to projects via tokens. So if we can tokenize individual projects, we now have a substrate for incentive to get people to actually contribute to those projects. And the third and last kind of big opportunity we see is in creating legal clarity. So a big part of what we're trying to create is legal infrastructure. And not everybody is a lawyer, but it's still important that everybody understands the rights that they have and the risks that we're taking. And so it's kind of these three places we're trying to focus our efforts on and opportunities we're trying to capitalize on. So in the name of solving kind of these problems and capitalizing on these opportunities, we are announcing to the world the product that we've been building for the past few months called Catalyst. Woo. So we are trying to build the front door to DeSci. In the beta release, we are focused primarily on funding, but the goal is simple. Find projects, support them, fund them, and co-govern the IP and treasury along with other co-funders and contributors. Catalyst has already gone through several iterations with kind of a theme of simplifying the whole system. We've gotten a ton of feedback from a ton of people in the community, for which we're super grateful. A lot of people in this room, a lot of people on the live stream have helped us kind of hone in on our value proposition. But what we really hope to communicate here is an ethos of accessibility, right? We don't just want the people that understand complex DeFi protocols to be able to participate in DeSci. We want anybody, even scientists who are onboarding into Web3 for the first time to be able to come in, contribute to projects, and basically have a share of the governance in whatever is developed by the researcher. So yeah, I mean, our goal is to onboard the next 1,000 scientists into DeSci, and we think that will come from building products that are more familiar and more similar, simple than products that are more foreign and more complex. Cool. So really, at the end of the day, where all of this bottoms out is, number one, the legal rights that are granted to the token holders, and number two is the quality of the research, right? And so it's really our job here, and what we're trying to accomplish with Catalyst is to be pushing the boundary on both of those items. And so one thing that's important to analyze is, what are the rights that IP tokens give you? You contribute money to this project, what are you getting back? And like I said, our goal is to give something that's legal, that's compelling, and also that contributes to human progress. And so just looking into the rights IP tokens give you, number one is governance. So IP token holders have the right to participate in the governance of proposed licenses and use the proceeds from the IP. So basically, any sort of important decision about the treasury as it pertains to the IP or the money associated with a project, IPT token holders have the right to govern. Number two is a duty of care, basically saying that anybody who holds the token is beholden to the membership agreement. Number three is confidentiality, which should make sense. Number four is access to the intellectual property. So we want to create more of an entry point to the data and the research itself from people who hold the tokens, and enable people to contribute. So by holding a token, you have a right to access of the intellectual property. And the last one is something that we've been basically going back and forth with a ton of external legal counsel and gotten a ton of advice on, but it's royalties. So this is really what a lot of people kind of ask us about, and where these tokens really bottom out, which is, if the IP is sold, what do the token holders get? And so important to answer this question very, very precisely and say that the IPT token holders can vote in royalties or adopt an amended membership agreement with the consent of the IP owner. So though IPT tokens themselves don't have royalty rights, they are able to amend their own adhesion contract in order to change the membership agreement in the future. So this is a super important value proposition that we hope resonates with people that are excited about funding research. Oh yeah, sorry. Cool, so we'll have a ton of announcements coming up over the next few weeks. Please sign up if this is even remotely interesting to you, because there will be a ton of ways to get involved, and this will only be successful if we get the full firepower of the DeSci ecosystem behind it. So thank you so much, and yeah, looking forward to launching this thing with you guys.
Well done, Benji. Thank you so much. Yeah, I was going to say, important QR code for those who are live and streaming as well. Try and get a shot of it. Yeah, we'd love to bring you along on the Catalyst journey. Okay, so also next up, we are having a panel. Which, are they here? Do we? Oh. Sorry, I didn't realize we had 5 minutes. Benji, into the hot seat.
Capabilities of the token creator, so the scientist, is there to modulate how much power token holders have in the decisions? Is that a fixed thing that cannot change?
I think it's just a tokenomics engineering question. So, at the end of the day, it's an agreement between the researcher, the sponsor, and the funders. And so ultimately, they have the final say and must come to an agreement on what the tokenomics should be. So I think that's the right question. But it's the answer is that it's open to whatever everybody agrees upon, the same way you would in a company, right? The same way that the founder of a company has to negotiate for a certain percentage of equity. In an analogous sense here, you would negotiate a certain percentage of the IP tokens as governance rights.
Hello, hello. Ah, yeah, that works. So this means there is a default set of templates for smart contracts that each of those like fundraisers will be able to use, but also modify individually. Like, or how is when you say like it's dependent on the agreement, the tokenomics of this particular fundraise? Yeah, what's that?
Yeah, so the agreements themselves are quite templatized. We want a huge piece that we know we have to solve there is just making template agreements. If you think about one of the biggest innovations of Y Combinator, it's the safe. There isn't really like a super difficult process to coming to a legal agreement. So that itself is, I don't want to say fixed, but templatized on our side. That IPT membership agreement is the brainchild of like the legal team at Molecule, and we've had it validated by external counsel. And really, it's about how many tokens do you give which member, right? So if the researcher wants ultimate control over their projects, then they just make sure they retain 50.1% of the tokens and are able to control where the research goes at the end of the day and only take the community's opinion as a suggestion, right? But people might not be willing to fund that if they don't have ultimate say, and it all bottoms out at one person's decision making. So this is what I mean by like it's a tokenomics question. It's less about the smart contracts and the legal contracts, more about who gets what.
I think maybe just to respond to that directly, I think you could. For what it's worth, I think you could, the agreements that are attached to the IPTs or IPNFTs are also, like, there is a standard, but for example, if a researcher wanted to limit the governance decisions to certain, let's say, topics, or if there were certain things that they wanted to retain control over, there's no reason that you also couldn't put that into the membership agreement. It's just, I think we're also trying to advocate for something that is more standardized, but in the end, like, these are flexible technical frameworks and legal frameworks that could be adopted to various use cases, right?
Does the university or the TTO play the role at some point? This is one of the bottlenecks in the funding process, I guess?
Absolutely. So yeah, no, I think it's also a value that we hope to provide as well as Molecule, is kind of accelerate the conversations with the TTO, find agreements early, but ultimately, I mean, that is the source of the IP, right? The IP bottoms out at that agreement between the sponsor and the university, TTO, and that's where a significant portion of the value split comes. But if the question is like, do they hold tokens? I mean, I don't think they need to.
Any more questions? Okay, cool. I'm sure every single one of you will go on to use Catalyst. Thank you so much.
Let's hope so.
Okay, cool. Give me that. Next up, we have a BioDAO panel. So the BioDAO panel is going to be moderated by James Sinka, who works with BioXYZ. He also co-founded OrangeDAO. He also was the MC of last year's DeSci.Berlin, so my mortal sworn enemy. And then from the DAOs, we're going to have Lawrence from VitaDAO joining us, Ines from AthenaDAO. So VitaDAO does longevity, for those of you who don't know. AthenaDAO deals with women's health. PsyDAO, Balazs, who was on stage in the beginning, he's going to come join us for PsyDAO. We've got Morgan from ValleyDAO. ValleyDAO does synthetic biology. Mark from CerebrumDAO, neurohealth. And then lastly, Emil from CryoDAO. CryoDAO is cryogenics.
And then that will pass one around. Okay, all right. Yes, we should be sharing a mic, like so. Okay, thank you so much, everyone, for joining us. As you can see, we have a very packed panel, so I'm going to keep my questions short. But before I do, I would just love each person to give their name, the DAO they're working with, and then we can move on to questions. So why don't we start with Lawrence?
Lawrence Ion, VitaDAO, funding early stage longevity research, and then spinning out companies.
Ines Silva, AthenaDAO. We are funding women's health research and spin out companies.
Hi, Balazs PsyDAO, and we work on psychedelics.
Hi, Morgan, ValleyDAO, and we are funding and translating synthetic biology research for climate.
Mark Milikovich, CerebrumDAO, where we are translating and funding and creating brain health interventions.
Emil from CryoDAO. If Lawrence is not working
fixing the problem of longevity with IPTDAO. We're taking over with organ preservation or whole body preservation.
So we first started our first cohort working with BioDAOs back in 2022, and it's crazy to see how far it's come along in 3 years. What I wanted to ask each one of you is just if you could talk a little bit about what it's like to do, to work day to day inside of a BioDAO, because folks who have never been part of a BioDAO have no idea what it looks like to be inside of one, besides the amazing website and the cool research that you all fund and work on. Just whoever wants to go can feel free.
Well, I feel like working inside a BioDAO is like working inside any organization where you're trying to go from 0 to 1, as they say, if you read Appeal Thiel's book. There's always a lot of ideas, aspirations that we have, and I was just in a UX conference, and they also have the same problem. They have a great vision for the future. They don't always achieve or feel like they're achieving what they had in their mind. And that leads to frustration, but it also, there's this great potential where we just find the right ways to work together and go step by step to get to that goal.
Yeah, I'd say one of the things we don't talk about a lot is how much noise there is. Being in part of a community with lots of different voices and every stakeholder being empowered to make decisions. So I think one of the things that we really tried to figure out and are still figuring out is how do you convert noise into signal? And I think that's like a structural problem and also a cultural one as well. And I think it's something that's also really exciting because the traditional scientific system isn't necessarily great at that. And so, yeah, I'd say it's really addictive. Always, like every day is doing something different. And yeah, I can't imagine myself being anywhere else right now. I love that.
So I think PsyDAO is probably the least mature from the DAOs that are represented on the stage here. And I'm coming from a purely academic perspective. And I'm like, still on the young side within academia. So I see a lot of the problems that Tyler has mentioned, the publish and perish culture in academia. And there's also like, the big fish just get bigger in academia. And, sort of like where you are as like a young researcher, you are at the bottom of the food chain. It's not a nice place to be. And then when I got I almost said dragged into PsyDAO. That's not exactly true, but it's been very, refreshing that suddenly, there's like actually, much more focus on like ideas itself, and also having like a bit more of like the big real life perspective on scientific research. Like, before that I was just always thinking in terms of like traditional academic grants and how could I get to that grant and what is possible within the small confines of academia. And even though it's a challenge to balance my activities in PsyDAO and my daytime job, but at the same time it's very liberating. I feel like it gives me much more of a big picture perspective, what's possible, and a little bit breaking out of the small mindset of traditional academia.
Yeah, I think also, we are very privileged and lucky to be able to work in this space. We spend the day with people that are mission aligned, incentive aligned, and what we are trying to do is like to bring more of them on board, work with and collaborate with more of those, and really show that like in our case, like we have this mission of like really scouting, funding, incubating, translating these women's health research projects, and there's so much that we can do, and I feel very privileged to be able to work with other people, women, men, and others like that really are aligned with that mission. I think also another thing that's very interesting is like we are not only building DAOs, but we are also building an ecosystem, right? This side, DAOs won't survive if this side doesn't grow and keeps on expanding. So we have this double mission of like making sure that, of course, we want to fulfill our mission, making sure that more people come in and we are able to onboard them into AthenaDAO. But at the same time, we are also onboarding them into DeSci, and that ecosystem part, at least for me, it's like also very exciting.
What I really like is the fact that there's this spectrum of how much you want to be involved. It's that anyone can contribute just capital if they want to. or help source a project, right? When they're just going to their conferences, meeting an interesting researcher, they might say, oh, let me introduce you to VitaDAO or another DAO, depending on the industry, and they get a bounty or so on. And others can get a lot involved. This is like the most interesting thing to them. They can work as many hours as they have. And what's really cool is that there's a sort of filtering out effect, or it's just filtering for the people who are really proactive and resourceful, because you don't really get told what to do, right? You need to find ways to bring value, and yeah, we end up with an amazing group of very entrepreneurially spirited people that care a lot about what they're doing.
So my next question is about how the science is actually done inside of these DAOs. I loved your point where you're saying, in academia, scientists are sort of at the bottom of the food chain. They're the ones that things are kind of outsourced to, but it sounds like in BioDAOs, actually scientists do rule, they have a lot at stake, and they can call some of the shots. So can you talk a little bit about, for those of you who have engaged in the science, how does the science actually happen inside of a BioDAO?
So the main difference, I think, is, so I studied medicine in the past because I wanted to take the drug. I didn't care about publishing. I wanted to take the drug that makes me live longer. Right? This was my original plan. And then after being in academia a while, I figured out this is really, really tough in academia, because all the pressure is always to publish and not really to make the drug that you take the drug, right? That's the reason why every paper ends with the sentence, further research is needed to see if this can be implemented into a clinical setting, right? And this future research never happens, or rarely happens. So I think the most interesting thing, and I think this is also where DAOs might have the biggest impact, is as long as the team, the core team, and the community stays aligned, and this is what we do at CryoDAO, we want to do stuff that then people can use, either in a clinical setting, or as I said, for the whole body. So this, I think, is the biggest advantage. So when we try to select projects, research projects, and by the way, there's Eli, who is leading our deal flow team over there, who he's actually responsible for that. We try to select the criteria, or build the criteria and the community, and educate the community, and incentivize the community to do stuff that later then can be directly used, that will not end up as another paper in someone's drawer. I think, and this is, I think, the core difference, as we said before. And it's not easy, but the incentives are the core, and it's really difficult to keep them aligned. And I think, but this is the main difference here. And otherwise, I think the science is being done the same way, just that we tell the researcher, hey, listen, dude, this cannot just be a paper. It needs to actually work.
So the one thing that I would add, which I find very refreshing, is the lack of hierarchical organization within the DAOs and how science is being discussed. In traditional academia, there is a very well-defined chain of command, and probably your PR is sitting on top of you, and then there is the department chair, and it's a very strict hierarchy. And I find it refreshing that, within the DAOs and this ecosystem that we are building here, the only thing matters is how good your idea is. It doesn't matter whether you have a PhD or not, or whether you're new to the field, or all of that crap and noise is gone, and what matters is the idea itself, and I love that.
There is one similarity, though, with company builders. There already are companies that seek out projects from academia and try to spin out companies like a venture studio. So I was curious so they would also, just like our DAOs, encourage academics to take that research towards something that could be commercialized and ultimately becomes a medicine we can take. One really interesting thing here, though, is all this permissionless nature. I really love in VitaDAO's governance forum, there's sometimes debates, right? There's people that even come with a pseudonym, so they might be worried to use their real name, to disagree, or so on. And the fact that we can use pseudonyms on our governance forum is really amazing, because ultimately what matters is getting closer to the truth. But then also, it doesn't have to be all debating and everyone has an equal say, right? You ultimately have a consensus mechanism, and just like in companies, I think most shareholders, most token holders, similarly also don't want to get involved in too much of the nitty-gritty, and they empower a group, in our case, experts in that specific field, to give a review, right? Then ideally they say, look, if the experts are saying this or that, then we go with them. So you can inform the board of experts from anyone, right? But then they still give a certain rating, and then I think the whole community ideally listens to them, but importantly can disagree, right? If you think, oh, this head transplant research, something is like crazy, and the usual reviewers from academia wouldn't fund that. The key is that the community here can say, actually, I know it's crazy, but it's our money, so I might as well just fund it, even if the experts disagree. That's very important.
I really liked what Tyler opened the conference with this morning, in that like the ideal of what we want to get to is like deinstitutionalizing science. And I think it's something that happens everywhere and everybody's doing, whether they know it or not. And I think DAOs really enable people to break away from having to have an identity that's associated with an affiliate, like an institution, in order to have credibility and respect or to make an impact in the world. And I think something like, as a very young person going into science and having no reputation and no credibility, was really confused as to like why I need to spend 7-10 years like gaining respect for anybody to even hear me out if what I'm doing is actually like, provably making an impact. So like, to summarize, I guess, DeSci is science done by the people, for the people.
Yeah, so my background, I started also in academic research. We did like corporate stuff, startups, and I feel like the DAO really embodies like the most critical components that we need to make things happen. We're right now in Cerebrum talking about our product roadmap, but we also have our deal flow process. So we're not just thinking about how do we fund something, but we want to see how do we make that happen. And I see this reflected in a lot of DAOs, where each DAO really has its own purpose. And that's like really driving the mission, so like driving the organization forward. And having it be bottom up, a great analogy, I have a really brilliant friend in Switzerland. He wants to do like basically some organoid brain research, but he just has a master's. He's not part of the research institution. And he has, this big problem, like, oh, how do I get funded? How do I package this idea into a way that would be viable in academia? And I believe we're really just more purpose-driven to say, here's a problem, we want to fix it, and we don't have the hierarchy inertia. So I would say that's probably the way that DAOs are creating this niche in the world.
Yeah, and I think what I heard across the DAOs is that the science is done by anyone who is qualified by their interest, their merit, their curiosity, as opposed to preordained by the academic system of hierarchies to say like, oh yeah, you're qualified to do something. I think we have time for maybe one more question before we have to go to the end. And so for that, I want to ask a little bit about how the DAOs that you all work on, what it looked like when you first started, how they are now, and then where you think the DAOs are going to go into the future. Because in 3 years, I feel like we've learned a lot, and DeSci is just in its first innings. And so if you could also maybe comment on where you think your individual DAOs are going to take things in the next 3 years when we do another snapshot in time.
I mean, we haven't been around for that long, so not that much has changed yet. I think we just went through the first real step of professionalization, right? Having the teams in place and so on and so on. So, I mean, we're starting now to fund we were lucky, we got a good amount of contribution in our first round for unknown reasons, even though, of course, I think this topic is kind of quite hot in the crypto community. Apart from that, sure, but I try to not bring this. No,
it's true.
So we were lucky in that regard. So we're now funding the first research, and then so the goal would be just to fund significantly more research and keep it aligned so that it's actually good research. Because even though I think in theory, I think the misalignment of incentives or the slippery sloping, it exists in BioDAOs technically as well, or in any type of DAO. So I think it's a fight to keep this aligned. But then do good research and get more contributions to do more research. I think this is going to be the cycle that we're going to do for the next couple of years.
Yeah, so basically, AthenaDAO, we started in 2022, right? Yes. So we have been around for 2 years. And I think something that I think we talk a lot about tokenomics, governance, and so on, but something that I don't think that we talk enough is also about the operational side of things, right? Your question about like what science, what happens like in terms of science inside of the DAO, but also how operations happen inside a DAO, right? How can we make sure that we have an organization or with people that are very much aligned, we have a strong vision, people can contribute as many hours as they want, but there's like this common vision to build this DAO. And I feel like that's, I think, the biggest difference from the start to now is just like, we already came to DeSci and came to, like when we start building AthenaDAO with an idea about governance, so the idea about tokenomics, VitaDAO was already basically in place. So we already have a few examples, also coming from DeFi and other areas. But I feel like the operational layer is like where we actually evolve the most in terms of like how can we scout for the best science, right? How to make sure that we have processes in place, even though I think is like, this is kind of words that usually don't like to talk about, but that's what actually allows us to get to here and feel like, okay, so this is how much we actually have done, right? So I think going forward, there's so much we can do. And something that we realize, like with AthenaDAO, we are definitely not constrained by the quality of science. There's so much amazing science out there for us to fund, incubate. That's definitely a given. There's so many areas of opportunity for us. So what we want to do is more resources so we can really scale and really take off. And you're going to the moon or to Mars with what we have in mind.
I love that. Yeah, I'll try and keep mine short. So I think we started, or our evolution is kind of more like a dampened wave. In that we started hopelessly optimistic, thinking that crypto was going to solve all of our problems. Then we went to extremely pessimistic, thinking that regulations were going to ruin all of our lives. And now I'd say we've landed on pragmatism, where we understand enough of the white space in between, like what can we do, what can't we do, what is useful and what is not, and how do we bridge from where we are today to the future we want to build tomorrow. And I think that's going to take time, it's going to take money, and it's going to take a lot of people. But I'd say we're really like consolidated on our narrative as to where we need to be and why we need to be here.
So Cerebrum, I'm probably one of the younger DAOs on the stage. You know, I guess a year ago, I don't know, it was still very much an idea. Did a lot of building, implementing, and now we're really focused on, after our token launch, to basically execute and implement. The biggest difference is just going to be really a lot more work, I would say. I mean, you have an idea, ideas are great, but then you get the funding, and now you really need to build and really engage the community. And the building of products, releasing them, engaging the community is, I think, what will lead to growth over the next year, 2 years, 10, 20 years, hopefully. Yeah, so that's where we're headed to.
So for us, what we talk a lot about, like, you know, IPs and like how that can be the economic engine behind DeSci. But for us with PsyDAO, we want to take a smaller step first and just get to a point where we publish our first study within the next few years using the open science psychedelic platform that I was mentioning during my talk. So earning some traditional academic street cred, like I think that's the next step for PsyDAO.
So we're the oldest DAO, right? Tongue-in-cheek, sort of trying to get better with age and make it such that as we get better, also make humans get better with age, not degenerate and get diseases and die. So, yay! I would say that it's been 3 years, right? Initially, we had to prove ourselves. We had this money. 4 or 5 million, and we were trying, like, why is it so hard to give this money away? People, please, like, take of course, good projects, but take our money. And like, people hadn't really heard about DAOs and all this stuff, so it was difficult, but eventually we built a good name, especially in the longevity field. I think we have really good awareness. Now it's a lot more about setting up this well-oiled machine to scale up, to be the place for anyone who wants to live longer to be a member, right, and leverage all of that so that we have so much more resources to also fund really good science and enable a lot of teams to have the autonomy to do the really good work of spinning out these companies and raise their funding via IP tokens. And VitaDAO itself just moving towards funding a lot more projects and each one of them getting amazing people to run them and hopefully also take them all the way through, right? Vertically integrate DeSci and actually try things out in humans and actually have an intervention that works. There's nothing proven yet in longevity to work on humans, right? So my personal hope is that we get to that within a few months. I know, crazy, months. And then within 2 decades, we have aging under control.
I would sign up for that feature. Aging under control in 2 months. I love that.
No, in 2 decades.
Oh, in 2 decades. Okay,
So,
yeah. Oh, yeah.
Making therapies within months instead of 10 to 15 years. And yeah, within 2 decades, we have aging under control.
Under control. Okay. All right. I'll be less optimistic, more pragmatic, and I think that's something that I heard here. Looks like we have a little bit more time for questions. Okay. So something I often talk to scientists who are, for the first time hearing about the BioDAO model, and obviously, I have many reasons to tell them that they should go ahead and try it and do it. I'd love to hear a little bit from you all around, how a scientist or a group of scientists should think about starting a BioDAO, how they know if they're ready to do that, or maybe even like warning signs of why maybe they shouldn't, if this is sort of the wrong arena for them to bring their ideas or their work to, and maybe some other ecosystem might be better, considering you all are in that space.
I think it's very important for them to know why they want to start, right? And I think it's not about just starting and hoping for the best, right? I think if you are if a group of scientists with a specific area that is focused on a specific area of research or a specific therapeutic or something, if they want to start something, I think it's very important about what does the DAO model bring to them that otherwise they couldn't get, right? I think one of them is very easy to know is the scouting opportunities. We have in AthenaDAO, we have researchers in our science and deal flow team from all around the world, in some of the best universities in the world that are very excited to be working and very excited to scout opportunities for us. And I think that's one of the areas where a DAO can definitely bring a lot of value, right? So I feel if you have a group of scientists that want to start doing something, I think they have to be aware of, on one hand, okay, why the DAO model might make sense for their case, but also be aware of the operational, let's call it, costs that exist for you to actually build a DAO and be able to and make that decision. There's I think a lot of the times with companies with nonprofits, with foundations, there's already a kind of blueprint, right? We are building the blueprint as we speak. So there's a lot for us to build there, right? And I think maybe we are not even spending enough time actually building that blueprint because everything in Web3 goes so fast that it's sometimes hard to actually think about the lessons learned. So I think if you come from an area where blueprints are important for you, maybe that DAOs are not for you, but if you are excited to join a roller coaster and have a lot of ups and downs, then definitely DAO could be interesting for you, for whatever you are doing.
Yeah, I agree with that one.
Yes, I think the advice I would give is the same advice a company builder or a systems engineer would give, which is really understand the problem you're trying to solve. I think in DeSci and probably across all of our DAOs, we're trying to solve fundamentally different types of problems. Some are problems that have an end goal, solving aging or curing hair loss. Other things like women's health and synthetic biology for climate don't have an end goal, right? That we will never pack up and go home. And so the design of the organization, the tokenomics, and our purpose and role in the whole ecosystem has to be well understood. And I think if you don't have that understanding going into it, you'll find it very difficult to navigate the noise that I spoke about earlier and figure out what the hell are you supposed to be doing. So yeah, that would be my biggest piece of advice.
Just quickly, you want to start a DAO? Yes, I love you. just get in touch, and hopefully it can help improve the human condition.
The last question that I have is, what surprised you in your journey, from when you first started and throughout the different experiences that you've had that informed, how you do or what you do in a DAO? I know many of us have very different backgrounds. Some of us have spent time in academia. Some of us are like, there's no way, and I don't want to get my PhD. That's a sign that I'm part of the system, and you're sort of more anarchical. But I'm curious, is there anything that stands out that you would say like, oh wow, this was an insight or a moment or learning that really helped inform me to get to where I am now, and maybe someone at home watching this can resonate with that and say like, okay, I see myself in that. Maybe I should, work alongside you in your DAOs or start my own.
What surprised me the most is how having this idea of a permissionless organization that doesn't really answer to the usual state, it's just registered on Ethereum, how much this being censorship resistant and scalable, how this allows us to think outside the box and be like, not constrained by the usual things that tell us, oh, but maybe I'm not allowed to, right? Permissionless, really, really important. Just taking out a lot of the usual bottlenecks and being like, yes, yeah, it's crazy, and let's do it.
I think for me, for example, when Ella was introducing Benji, Benji was telling the story about like how he just quit his job because he fell in love with Molecule and what the team was doing. And I remember back in late 21, 22, when I first heard about DeSci, I was like, this is it. Yeah. This is exactly what I want to be doing. I had worked in tech transfer office. I saw a lot of the issues there with tech transfer offices, but also with scientists not necessarily wanting to translate their research, the challenges there, the value of that, and so on. And so when I saw this, I was like, this is it. This is what I want to do. I think what I didn't realize was how early we were, right? I was like, okay, this is we have the IP NFTs. It makes a lot of sense. Let's go. Let's build a BioDAO. I think we didn't even call them BioDAOs back then, right? So it was a different name. Yeah. And I was like, this is exactly what I want to do. I think what surprised me is but surprised in a good way is how much we're actually being part of building this ecosystem, right? And I think if anyone comes in now, they are still early, right? They will still be able to build this ecosystem, and there's so much more BioDAOs for us to build. And I think now with VitaDAO being 3 years in, with AthenaDAO and others being a year and a half in, I think we already start seeing those blueprints that I was talking before. And so whoever is coming next, I think will be able to do much more, much faster, and I think that's super exciting.
My first contact with DeSci was DeSci London in 2022, when Chris and some of the other Psycho people invited me, and then I remember the first was like, oh, this is this whole world, and it's totally surprised me. But then I get more engaged. I had a similar experience as you did, to realize and being surprised at actually how much of it is just up in the air in the moment. First you hear about DeSci, it sounds like everything is worked out, and that's not quite the case. But I also, that fills me with excitement at the same time, because it means that there is a space for innovation, and we are doing it together, and just that the journey itself, is very exciting, but there was definitely an element of surprise that oh my God, how long is the way to go still?
Yes, yeah. We are still early. All right, I'm getting the sign that we have to end it there. But before we go, I just wanted to say, if any of you are interested in learning more about BioDAOs, feel free to talk to any of us up here. We will be around. Thank you so much.
Incredible. Thank you so much, guys. At least, I know with working through Molecule, the BioDAOs, we wouldn't be here without them. And so thank you to all the team members who do put in the absolute blood, sweat, and tears to make them work and to make them happen. Our next talk is another panel, a smaller panel this time. And it's going to be Logan, who came and did the Nucleate panel. You know her. And then Anthony and Michael. So Anthony and Michael are the team behind the Artan Bio IP NFT, which is a project that was funded via VitaDAO. They both have an extensive history in bringing companies to fruition and growth. Michael co-founded and launched Recode Therapeutics, which raised an $80 million Series A and has since gone on to raise $300 million and is a clinical stage company. So really impressive track record there. And then Anthony has 20 years of experience in biotech-based startup companies. And he's founded at least 20 startups focused on cancer, rare disease, aging, leading to large financing and FDA approval. So really in great hands. Cool.
Let's get you on microphone. Enjoy. Nice. Thanks, Ella. Thank you so much, Anthony and Michael, for joining me today on this panel. I heard that, Anthony, this is your first fireside chat that you have agreed to, so we are all very honored that you have chosen us today to share your thoughts and insights. So some of you may know both of these guys from working in VitaDAO, but for those of you that don't know, Anthony and Michael come from a traditional kind of biotech pharma background and have found their way into DeSci. So obviously very interested in your trajectory into this space. So would love for you to kind of share your background, your career history, and kind of how you made your way here.
Sure, I'll start. So I'm a serial entrepreneur, drug developer, and a doer, which is, I think, my LinkedIn tagline. But I started I did my PhD at UT Southwestern in cancer biology, and then transitioned my postdoc project to become Recode Therapeutics. This is a genetic medicines company that was, literally my postdoc project in the lab. We raised $7 million, then we did 80 million, and then went on to raise close to 400 million. And I was VP of R&D, board member, co-founder as well. And my program that I started for is a cystic fibrosis program is now in the clinic. So I've taken drugs through the clinic. I'm now CEO of an oncology cancer startup that we're about to close on about a $15 million seed round. I've got a pharma partnership already inked. I got a $2.6 million non-dilutive grant that we literally got that last week. And so I've built companies, but then through my first company, Recode, we had Pfizer Ventures that invested and a few other pharma folks. And it was actually Mike Barron there who contacted me and said, hey man, I'm kind of in this DeSci longevity space. You should come help them, with your expertise building companies and such. And so that's actually how I got connected to VitaDAO was through Mike at Pfizer Ventures. And then, we've been working and helping out with some of the company builds, and then we've got our own project that we submitted. And so, we'll share more about that, but, that's just a kind of brief background on me.
Awesome.
Hi, everyone. I'm Anthony. I'm also a serial entrepreneur like Michael. Contrary to, some of you know me, but I actually started out in AI and computer science and electrical engineering. So I have a little bit of that type of background. But then one day I walked down a hallway and I ran into pretty much a Nobel laureate, and he asked what I was doing. I asked what he was doing. He said, I'm making drugs. And he showed me what an immune cell was on a chalkboard. And he offered me a job. And 9 months later, I filed my first patent in biotech. And since then, I've been part of the launch of about 20 different companies. That company, we pushed several drugs through to IND to phase 1. We also got an FDA-approved product that you can get here in Germany, apparently. And since then, I've been part of all kinds of different companies, I'd say mostly oncology. It's kind of changed more recently. I've been part of a couple different venture capital funds. We helped launch about 3 years ago a fund out of the Mayo Clinic. And some of the companies that came out of that are the ones I'm currently running on the side now. So just like Michael, I'm also doing traditional biotech, traditional raises, traditional. Also work for a big law firm that we help launch companies and get them through the M&A process. And I also teach a class at Hopkins on how to start a biotech company. So I'm very big into starting biotech companies. So how I got involved with Vita, we were actually talking about this today. I think we were messaging each other in 2012 or 2014 when I was at the NCI. and he came down for Rare Disease Day. We went out and got a margarita, I think. And then a few years later, he's like, you like to start companies. I heard about BioDAO. And I was like, yeah, I like to start companies. And I showed up to Montenegro about a year ago. And here we are today. So right now, on the other, outside of normal biotech world, I'm now in the BioDAO biotech world. I'm the, I guess, company builder of BioDAO. So I'm running the 3 companies that we've launched. I won't talk about Artan, because he's going to talk about Artan. But we've also launched Matrix Bio, which is a small molecule company. We just got our first data readout last night while I was attempting to sleep from the jet lag. And we also just launched Fission Pharma, which is targeting aging diseases through basically overactive mitochondrial diseases.
So what I'm hearing is you need a margarita to enter DeSci.
Yeah. It all started with a margarita.
Drank the Kool-Aid, if you will. Right. Cool. Well, thank you so much for kind of giving me your backstory and letting me know how you got here. And as you said, obviously we're here to talk about Artan. Oh, how do I? Does it go? Yeah. Do the thing? Okay, tech support will help me. But obviously we're here to talk about Artan Bio, the company that you mentioned that's launching out of BioDAO. So can you tell me a little bit more about the company and the science behind it and kind of how the process formed of this company starting out in BioDAO and now taking the step to spin out?
Yeah, so the scientific sort of background for Artan started in some work that I was doing as a postdoc, where we were looking at nonsense mutations. These are mutations that cause premature stop codons, where then you don't make any protein. And so if that happens in like a very important protein, you can cause a disease like cystic fibrosis, as an example. And so what I had noticed, though, is that there were certain mutations, that a specific type of mutation that occurs in many different proteins related to age-related diseases, like things that would DNA repair, genomic instability, things that you need to like be good for a long time to stay healthy, that then typically tends to diminish over time. And so the idea was, okay, well, first sort of understanding that, okay, look, there's this interesting type of mutation that occurs across all of these different age-related pathways. What would happen if we were to suppress those mutations from occurring? And they, one other point is they occur, all the time in your DNA and your RNA as well, specific type of mutation. And so the basic idea was, if we could chronically suppress that or permanently suppress that, perhaps we could slow down the accumulation of these mutations that occur in all these age-related proteins. And with that, then it could be a really interesting approach to longevity, where I forgot to mention that a lot of these mutations actually occur in tumor suppressors as well, which help keep cancer in check. And so again, the idea is, if we could chronically suppress that, we could do that. It could be a therapy. And so, as we got involved in BioDAO, this seemed like an interesting project that we could take forward, because again, this is very early research. Hadn't really built any candidates yet to test, although we had some of the assays already sort of in line. And so that then became something that we put through BioDAO through a proposal. It passed from the community, and we got about $90K to start building some of the preclinical candidates, the vectors, the assays, port that to a CRO, the things you need to establish your preclinical proof of concept. And so that's where we are today with Artan Bio. That again, we're launching through DeSci. We'll touch on some of the questions later, but that's a project that would be really hard sell to investors today, to say hey, take a big bet on this type of approach. So.
Yeah, I think the theme that okay, this is a hard project to get pushed through in traditional ways is why we're kind of all here today, right? Where does DeSci fit in? How can we also couple it with the traditional systems that are in place as well? Because it's not either or. It's really how are we all kind of working together today. So a little birdie told me you maybe have an announcement for us today as well about the Artan Bio token launch. So can you maybe explain to me why you decided to go via this fundraising route? So it's one thing maybe to start in DeSci, but it's another thing to maybe have a token associated with your project. So how does the IPT fit into your kind of company and fundraising strategy here?
Yeah. No, so thanks, Logan. I mean, so as she mentioned, we are launching, I guess, the second IPT through the Molecule platform. So that's again something really exciting to take forward. And I mean, just to be very candid about it, and Anthony and I were both at JPM talking to a lot of traditional investors, crypto folks, pretty much anybody, even scientists, Nucleate, undergrads, just anybody. And the real interesting and exciting part, I think, about what is being built here is the ability to fund science in a novel way that enables folks to also, be involved and engage in a different manner than, say, you would be as a shareholder of Pfizer, as an example, right? And so in this case, with governance and the ability to have more insight than you would normally, I think that's interesting for the consumer, if you will. And then on the science side, as if I use Recode as an example, I started that company about 10 years ago. I thankfully still own about 1%. It's 800 million plus the valuation, I think, right now, and hopefully they'll go public soon. They're clinical stage, but like as a scientist, that's a long sort of journey to not have any, upside, if you will, on the traditional biotech space. And so, is there a way then that you can fund science, through this mechanism that, more aligns with the incentives like that Benji talked about earlier? And I think like if we prove this out, like, yes, I think it's also not lost on us that, through today's framework of clinical trials and things like that, you're going to need access to like larger amounts of capital that I don't know that the crypto space will support. I mean, it would be actually really great if it does, but at the same time, we've spent a lot of time to sort of try to launch a company through this mechanism, but then be able to move it further with traditional financing from VC or pharma, and sort of built mechanisms through the legal framework that we started Artan to enable that, and hopefully seeing that be really fruitful. And then we're going to be able to fund more science, do in vivo studies, move things forward down the drug development path, and that's really exciting for us to do through this mechanism.
Amazing. Congratulations also to you and the rest of the BioDAO team. So for those, if it wasn't clear, the token is now live, and you'll all be able to check it out if you follow the QR code to the Vita RNA website. The sale will be ongoing for 14 days, and if you have any questions about any of it, the team is very happy and willing to help and support you there too. So maybe then for one kind of final question to you both, I'm really hoping to kind of get your perspective from what the biggest differences have been for you working in DeSci and maybe launching Artan Bio, going through this whole token sale, things like that, versus how you approach company building in the normal way, and maybe what have some of the kind of tensions or challenges been, given that, like, what Benji was saying, right? Like you have researchers with a certain set of goals and values, and maybe you have like a Web3 crowd with different goals and values. Like, how do you think we should marry, the two in the most constructive way so that ultimately all of us can achieve the goal of advancing science?
Yeah, I think one important thing to note here is we did this all in a few months. If Michael and I wanted to do this, like not just VC or seed funding, grants, we would have been spending 2 years and so much of our time writing grants that could never have gotten funded. At least if they didn't want us, it would have been owned and done right then and there. We can move on. So I think that's another really key differentiator. It's the time. We gain IP, we gain, so someone else can't come in, or they can come in, but there's less time for people to come in and compete with you. Some of the biggest challenges are kind of legitimize the whole thing. That's something that I feel like it's lacking. especially from an outsider, from the biotech stance, because whether you like big pharma, VCs, or regulatory agencies, we need them. So we have to find a way to more legitimize, if that's a word, ourselves with those organizations through, getting things into clinical trials, really refining these longevity models, and animals, I think, need refined. Everyone comes to me with, they made a mouse live longer, but as in the oncology world, I've cured cancer 10 million times and it never works in a human. So if we can get better experimental models or more translatable, I think is essential. There's also, there's people who, as they say, celebrities come in and they say, take this, this, and this, and you're gonna live forever based off just antecedent data. That happens in the normal world, but I feel like there's a lot of that in DeSci, and that kind of, from the biotech side, kind of makes people scared to come in. So I think there's a lot of things we need to make more legitimate to help bring those people in, because that's where all the money is. We can raise, what, 300K, $1 million, who knows, but we're gonna need $50 million eventually. And we're gonna have to be legitimate for people to give us that money to move these assets forward, so then we can actually have drugs for aging and longevity. So that's my spiel.
I may say, yeah, just a few things. So I think, yeah, the challenge is, right, it's aligning incentives like what's been said. I mean, people may have a difference of opinion, but, go fast and break things doesn't really work for biotech, and drug development and clinical trials. You need to be thoughtful, careful. There's rigor for a reason, because, there are patients and safety considerations. Nobody wants to be, put something in people that ends up killing them. You have a grade 5 severe adverse effect, with some of this stuff. And so things do take time to build. I think, again, though, what's interesting is with this model, particularly tokenization of IP, you do have the ability to sort of look at what the potential of what's being developed is ultimately going to be, and through tokenomics, you can participate in that way, and I think that's really exciting and unique, and not something that one can do fairly easily in traditional finance. I mean, you'd be accredited an investor and all kinds of other things, and yeah, there's a little bit more ways to do that, but that's not really, I think, as accessible as having crypto and things like that. So I think it's, just kind of aligning those incentives and continue to have those conversations is really important for all sides of traditional biotech, crypto, and continue to talk through that.
Awesome. Thank you both so much for joining today and sharing your insights. And maybe one more round of applause for the IPT launch. It's the second ever launched. So both congratulations to the VitaDAO team as well as to the Molecule team. It's a huge milestone. And you guys are also paving the way for the next group of scientists who also want to follow this path and kind of creating the blueprints that are needed in this space as well. So thank you guys for being part of the team, and excited to see where this goes.
Cool. Thank you.
I thought I'd put on my AthenaDAO hat just for this announcement. Next up, we have, actually, sorry, I'm getting ahead of myself. Massive congrats on the IPT launch. Yeah, it's really cool to see sort of these DeSci principles and technologies working in action, so I'm really excited to see how things go. Next up, we have Ines. Ines is the operations lead at AthenaDAO. Absolutely great at her job. I watch her from afar and she kills it. So she's going to be joining us to talk today. Here she is.
Thank you very much. I have to say, let's give a round of applause to Ella. She's doing a great job emceeing the event. So. Yeah, and of course, thank you very much for everyone, the Molecule team, to put together this event for the third time. And the reality is, this event has been very pivotal in the BioDAO ecosystem, but also for AthenaDAO. And I will tell you a little bit about that in the next slides. So I'm the ops lead at AthenaDAO. I have been involved since the very beginning, actually since DeSci.Berlin 2022. And what we are trying to do here and what we are building is the leading decentralized community for translational women's health research, education, and funding. So we are scouting, we are funding, we are incubating, we are translating women's health research projects. And there's a lot I will talk a little bit about what we are doing, why we are doing it, but I can tell you that something that I realized over these past 2 years is that the opportunity in the women's health space is actually much bigger than we initially thought. There's much more to do that probably we initially envisioned, and if anything, these past 2 years really reinforced the need for a DAO in this ecosystem, in this space, and again, we are very, very excited to what we can build going forward. So, a little bit on the problem. I think a lot of you already have seen us talk about the data gap, the funding gap, and the market gap. So basically, there's not enough information, data in the women's health research. Women were not part of clinical trials. There are drugs in the market that were never tested in women. And the reality is, like, for many years, we thought like women were just like smaller versions of men. But we now know they're actually very different to our core, right? So we really need more data in the space if we want to build more companies, more therapeuticals going forward. There's also a funding gap. Not enough money goes into funding women's health specific conditions. And this is like across the board, from the NIH grants to, of course, biopharma is definitely not putting enough money into it. A lot of times, funny enough, even though the women are the biggest consumer market, a lot of times people come to me and say like, women's health is such a niche. But it's a niche of half of the world's population, right? So I'm not sure how other niches you have that are as big. So as I can tell you, like, and not only like that, women make 80% of the medical decisions in a household. So we actually make the decisions in terms of healthcare. And so I think that makes not a niche, but actually a quite big market. And every 6 months, we are lucky because McKinsey, the World Economic Forum, and others come with a new reports saying how actually big the opportunity is. This is from January, where McKinsey said that this is a $1 trillion opportunity to improve lives and economies. So again, it's not just us saying this, it's actually other organizations, you might like them or not, but they are actually saying the same, that there's actually a big opportunity, a big market here. So, but what actually have we done, and basically what is the path that we are taking here? And I'm going to tell you a little bit of the story of AthenaDAO. I think over the past 2 years, and of course that it's normal, we spend a lot of time projecting the future, right? And today I will do a little bit of that also in my talk. But I also want to tell you a little bit what actually we have done to get here, where everything started, because the reality is like we didn't start it too much a lot of time ago, right? We started 2 years ago, exactly more or less around this time, in DeSci.Berlin, not far away from here, where a group of women came together and realized that it made sense for us to build something in women's health space. We have to thank Beata that is there, because she was the one that put us together in the same room, so thank you very much for that. And the reality is that the fact that we were there, for us it was very, very clear the opportunity was there. For us it was also very clear that DeSci looked very exciting for us to make an impact in that space. Since then, of course, we launched in August. We joined the BioXYZ Accelerator later in September. And then we launched our first call for projects later in the year with a focus on ovarian aging. And that's like, this is a place where we're actually quite different from other DAOs. We take a cohort-based approach. Women's health, again, is very, very big, and there's a lot of areas of research. So what we decided to do was to focus on specific areas every 3 to 4 months. So we launched with the ovarian aging and a call for submissions. We got submissions from the National University of Singapore, Oxford University, and others. And we could basically see from the get-go that our problem wouldn't be sourcing projects. Our problem would be having enough research, enough funds to actually helping and supporting these projects. We kept going. We funded our first IP NFT. And then, this is actually my old presentation. And we funded our first IP NFT. Then we launched another call focused on basically endometriosis and PCOS. And in September last year, around DeSci.Berlin, we decided to launch our second, our token. And basically that was, again, a very important moment for us, would allow us to get resources to keep going and to keep developing what we are trying to achieve here. Later in the year, we also funded our second IP NFT. I will talk a little bit more about them later. But our story keeps going, right? Basically, we then made our token available on Uniswap. We launched our first entrepreneur in residence position, and that was actually very interesting. What we wanted to understand is like, if people out there were actually interested in working with us, in taking this research to market, and we could see that was definitely the case. We got applications from all around the world, from investors, operators, and previous founders that were very passionate about women's health and really wanted to work with AthenaDAO to take our research to basically to market. Then later on, in March, we actually did our first AthenaDAO summit. And basically that was actually a great way for us to bring leading researchers to Cascais in Portugal, where we were discussing basically roadmapping the future of women's health. Something that was very interesting that came out of this summit was the fact that there was a lot of collaboration, a lot of conversations, and we are now seeing the results of those collaborations, where some of the researchers that didn't know each other or knew each other's work but not necessarily have met are now working together, and are now working together even more with AthenaDAO, and that's very exciting. More recently, as I was mentioning, we work in cohorts. So we launched our gynecological cancers call for submissions. More recently, we are now in the evaluation process. We also got very exciting research. We are available on Base, and very recently we have a partnership with ResearchHub where we funded 3 preprints on hormonal health, and we also launched the Student Leader Awards to support the next generation of researchers in women's health. For you to have an idea, because of the lack of interest and the lack of funding in women's health research, and a lot of the times researchers, when they have to make a decision of where to go, they actually don't pick the area of women's health. And that's something that by doing these kind of collaborations, we really want to incentivize more great researchers to go into the space, because we believe, as I already made clear, there's a lot of opportunities here. And we were doing this while also onboarding the next generation of Web3 members and contributors, right? We have done a lot of in-person events all around the world. We have one happening on Sunday in São Paulo, a breakfast. We have been part of a lot of conversations to really onboard women into Web3. And something that we have continuously heard is how they get so excited about women's health, how they see this is also an opportunity for them. Because maybe before they could not see how their interests would align with Web3, but now, because of AthenaDAO, they actually do. But what we focus, and a lot of our work is focused on the science. And these are our 2 first IP NFTs. One is from Mario Cordero from the University of Seville in Spain. We have actually very interesting results coming in. So we have, basically the project has been accelerated, so hopefully we'll soon have some news to share with you. And then we have Dr. Joshua Johnson in the University in Colorado that is also working with us. Something that we are also seeing for the first time, and again, this takes time, right? I think we are all very impatient about what we want to see and when we want to see it. But something that we are also seeing is that researchers that have worked with us, for example, in the IP NFTs, also bringing us other opportunities. So what we are seeing is this flywheel is actually starting to move a little bit faster, because also the researchers are our best ambassadors out there, and they see the value that as a DAO we can bring. They see the value of our contributors and what we can bring to the table. And now what we are seeing is that they really are bringing us opportunities to work with them. As I was mentioning, we funded these preprints with ResearchHub. We could see how much value there is in the research that they have done. So basically, there's a lot of amazing research out there, and this is also an opportunity to fund that research very early in the stage. And we are also very excited to have the Student Leaders Award, some of them coming from some of the best research labs in the world, working with some of the best, most well-known researchers in the space. And now we are incentivizing them to keep going and to focus on women's health. We are sharing in these days a little bit of more like biographic information about each one of them. And this morning I was reading and I was like already so impressed. They are so young, but they have already won like very well-known awards. They already are doing a lot of research. And basically we are, in the end, we are also onboarding them into Web3 very early in their career. So we see that also an opportunity for us. And all of this has been done by a core and alpha team that has been growing, changing over the past 2 years. We are lucky because we have, it's amazing the quality of the researchers that are coming to us, wanting to collaborate with us in the women's health space. They are very passionate about it. So I think that's really amazing. We have much more contributors, of course. So I couldn't put all of them here. Eileen is there and she's laughing a lot. But if you want to talk to her about what it means to actually work with the AthenaDAO team, please go talk to her. And also, we are building this network of advisors and leaders in the space that are really that really show like how much we can do here. So what's coming next? So as I was mentioning, we work in cohorts. We are very excited now that the next cohort will be on deep tech, reprotech, including the artificially wound, assisted reproductive technology, and in vitro gametogenosis. So there's a lot we want to do here, and I think this is going to be a very special launch for us, so keep an eye out. We are also working, and we have a lot, like, as I was mentioning, like there's no lack of amazing projects for us to work with. So we have 14 NFTs, including two collaborations in the pipeline, 4 IPTs. We have 5 startups that have, like, with who we are basically co-building, and a data platform that we are now working on that will be quite exciting. So if you want to learn more about us, please feel free to talk to me. Feel free to talk to Eileen. We have a slide that I wanted to show you. Unfortunately, I won't be able to, but we are working also this weekend. We will be launching something very, very special. So make sure that you keep an eye out for our Twitter. And yeah, I'm very excited to be here and to basically we are a result of bringing people together, talking about science, some of the challenges, but also collaborating and brainstorming about what we can do together to change, in our case, women's health, but to change science in general. So thank you, and yeah. So we have a little bit of time for questions. Happy to answer them. Any questions? Go ahead. How? So we do a mix of things, right? So a big part of it, of course, is social media, our newsletter, and I think something that we're able to do is like to build a big audience, not only on social media but also on our newsletter that follows our work. But then we also do a lot of like scouting, actively reaching out to universities, research centers around the world, and making sure that they get to know what we are doing. And something that we realize is that they are actually quite open to working with AthenaDAO. I don't think that they feel like, there is this barrier for working with a DAO, or like, as long as we are very clear in explaining, I think like we also bring a lot of value to the process, and that's something that most of them tell us is like, it's not about only applying, but also like the kind of value that they receive because of that, the application, the ongoing conversations that happen after the application process is done. That, yeah, I think that's how we do, like scouting, a lot of emailing, and making sure that people get to know us and yeah, get excited to work with us. Of course, we have a governance token, right? So people that have our token holders, are able to vote on our governance decisions, including which kind of funding we should fund, right? So that's what the token is for. We are also thinking about and ways of making to bring more utility to the token. In the past, for example, we have made some like specific events only for token holders, and we are thinking about like how more we can build on top of that. Yeah. Cool. Thank you very much. Have a nice event.
Awesome. Thank you so much, Ines. The AthenaDAO token sale was actually my first token sale that I ever participated in. I had to make a wallet for it, so it was, yeah, an interesting experience. But yeah, if I can do it, anyone can. Okay, next up we have Vincent talking. So Vincent is a familiar face around the DeSci ecosystem. I'm sure many of you will recognize him. He used to work for Molecule, still does in a very reduced capacity, but he has moved on to start his own startup called Prime Intellect, which is about compute power, as far as I understand, but he's going to explain it more.
Thank you. Perfect, yeah. So for those that don't know me, I'm Vincent, and I basically helped initially start BioDAO and then also joined Molecule to help on ecosystem efforts and some product-related things. And yeah, now I started a company called Prime Intellect, and really the high-level goal is to commoditize compute and intelligence, and basically making compute power much more accessible, also with a theory that like it will be quite foundational, as well as also introducing novel, almost like business models for open source AI models. So the talk today is a bit about like how kind of like scientific progress might, like to an extent, like increasingly be driven by AI, and also what role decentralization can play, and kind of like naturally also almost like what the drivers are that drive like AI into like a decentralized and open context. Yeah, so I'll talk initially a bit like kind of like our broader vision with Prime Intellect is really broadly to make compute more accessible, as I said, and also create like incentives for people to contribute to openly accessible intelligence. And more broadly, really, because I think it's also like one of the most concrete ways how we can advance not only scientific progress, but also in general, like I think it will be quite foundational to have like universal access to intelligence that is potentially more powerful than your own. Because I think otherwise, like we run the risk to an extent to be what like maybe like animals in our current world that is like run by humans. So I think it will be quite important that it's like collectively owned and governed. Yeah, so like obviously you might have seen this chart on the left. Like I would basically make the thesis that like to an extent scientific progress is like a key driver of more general progress. Like I think the reason for why like progress across basically every relevant metric I think is driven by like progress in science, by progress in engineering and related domains. And I think the thesis of this talk, and I'll go into more depth, is that like this will be mainly in the future driven by AI, and to an extent like accelerated by AI. And obviously you also on the right like know kind of like the scientific method, and I think it's useful to almost like visualize like which of those things AI can already help with, and then also might fully take over in short time. Yeah, and I'll go into more of that. And like maybe as a starting point, I'm not sure how many of you have heard about the scaling hypothesis. Maybe raise your hand if you've heard about it. Okay, it's like a few people, but not so many. So basically, it's this biggest lesson that can be read from 70 years of AI research. It's basically that generally methods that leverage computation are ultimately the most effective and by a large margin to increase intelligence. And you see this on the right. It looks actually much small, like it looks like it's not that exponential, but it actually kind of like on this axis, like in the middle, like it's basically GPT-2, which was around about like $20,000–$30,000 of compute. Like GPT-4, for example, for context, is $200–300 million. So like that's like orders of magnitude, and already kind of like the big like CEOs of AI companies said this will scale to $1 billion, then to $5 billion, then to $10 billion, then to $50 billion. probably equal out at like 50 billion, but like that's quite a jump from $20,000. Like, and it's not only that we jump from like $20,000 for like a model like GPT to $50 billion, but actually also in the meantime, you get much more compute actually for the 50 billion than you got for the $20,000 per dollar. So it's basically like a double exponential to an extent of like scaling this compute. And my theory is like to an extent, which I think sounds crazy today, but like which is interesting like metric. It's like right now like 0.1% of like GDP is compute. I think it's quite plausible it will become 1% and 5% and 10 and then probably 99. Like and it sounds completely crazy, but I think like if one takes it seriously, I think it won't be so crazy anymore at some point, because if you literally have every car run by autonomous like agents, if you literally have science be mainly done by that entertainment, like every area of life basically, then there's literally no limits to how much you can like leverage computation for scientific progress and every other area of life. Yeah, and this basically observation is by the inventor of reinforcement learning, who was one of the key scientists at DeepMind. So it's basically also the thesis that like the big companies like Google, OpenAI, DeepMind have, and why they succeeded also in recent years so much. Yeah, and this is like an interesting website called Epoch AI on these trends. So basically, you can see that there's like 4x growth rate every year in the amount of training compute. So like every year there's like 4x more compute being spent for models, like for the big models. But there's also like actually not that many algorithmic improvements. It's not like I think it's like a declining rate in the physical compute requirements. So like there's some also algorithmic improvements, but they're actually quite shallow. Like ultimately, GPT-2's architecture is not that different from GPT-3 or 4, which is surprising to a lot of people. But then also compute got more performant. Yeah, and I think one interesting context of this is like this graph, which is compute used for scientific models. So this is also scaling up, and it's scaling up like orders of magnitude less still. So the biggest scientific models are still only like 10 million, like not 200 million. And actually, like this interesting thing is like this blue area is like the area where you need to now to follow the executive order by Biden and report on your model. So basically, you already have to report to the president at like a $10 million training run, which soon is only like a $2 million training run. So basically, already like the scaling laws for scientific models also run into, to an extent, regulation, mainly due to worries for like bio threats, etc. But it's relevant to understand because scientific models are like 2 orders of magnitude higher governed. So basically, if you spend like 20 million on a scientific model, you already have to report on this. If you spend 200 million on a general model, you don't. So it's basically scientists fall under much stricter regulations, which probably will also to an extent hold back scientific progress, maybe also some risks, but obviously also some benefits. So it's worth for the scientific community to like understand and probably to an extent even lobby for like better regulation frameworks. And I think like one interesting framework to think about kind of like progress in the future is this blog post by one of the folks from OpenAI, which is called GPT 2030. And the point of the blog post is to extrapolate like what could general purpose transformer models like large language models and agents be capable of right about by like 2030 if you scale them further. You can find the article actually if you Google GPT 2030. It's quite interesting. And the main premise, and I think it's actually to an extent pessimistic, like he's almost like lowballing it a bit, is that it will be superhuman at every task from like coding, hacking, math to protein design and a bunch of other scientifically relevant domains. And that's like in 5 years, like or 6 years. I think like if you ask some people in the field, they say it's in 2 years, like superhuman at coding, superhuman at protein design and a lot of other relevant tasks for science. That's like fairly like in due time. Like I think even if people are pessimistic, like then it might happen in like 7 years or something, but like not never. Like so we're quite close to it that it already becomes quite relevant for science. Yeah, and like I can recommend this piece without going into too much detail now, but like it's quite relevant because it also touches on a lot of scientific aspects of AI progress. And like one interesting intuition to build maybe for also like what will be relevant for science, and an interesting chat also with one of the authors of this recently, is like how also these models are evolving. So this is one project by DeepMind, and it's basically, you can visualize it as a language model, but it's running more stronger reasoning and planning. So it's a bit like you have probably heard of AlphaGo, and some of the DeepMind breakthroughs on Go, on these games that became superhuman. And they mainly achieved that by almost running like reinforcement learning and a lot of like planning and reasoning. And there's now basically, that's like rumored to be the next wave of progress, like basically behind the next generation of like OpenAI and Gemini models is basically applying much more of this like reasoning and scaling up basically compute to basically run through all possibilities. And the interesting example with this project is basically Google was running a language model like ChatGPT and was able to make novel math discoveries with it. And it's literally a language model. It's not even like programmed to do math, but just by applying reasoning. So basically they gave it feedback like, hey, is this a novel theorem? Yes, no. Like, is this a proper solution? So it was actually able to solve like very hard mathematical problems that like no one in the world could solve until now with a language model. So not with a even math model, but with a general model, which obviously is like one relevant aspect. And that's the intuition, like when I chatted with some of those researchers, they have like for every area of science, it's like when you basically have a feedback, like a mechanism, and ground truth data, like in math, it's very easy to get to the solution. So there's basically now the race is to an extent to find the right reward functions for science to just like brute force solutions. And the theory is like when I chatted to a bunch of people, it's like that increasingly there's more and more obviously simulations like AlphaFold is one that I'll also touch on for protein design to basically simulate science to then brute force solutions in a way that like humans wouldn't be able to. So the implications like from this are kind of like for math, for example, is that like math will probably be solved like to an extent in every theorem that could be proved will be proven, every theorem will be basically stated. Like I don't want to give timelines, but probably fairly soon. And like it will basically automate significant portions of math, and obviously math is kind of like underlying a lot of other sciences like physics. So it's like kind of like moving up the stack, like to physics. Biology is obviously way harder, and so it's only approximating probably some of those domains like biology, while it's actually to an extent more able to brute force, say, mathematics. What obviously is kind of like this meta progress is like actually machine learning research itself, increasingly being done by AIs, but also, for example, semiconductor design, materials design that, like NVIDIA is already improving the chips mainly through AI. Like they mainly apply AI to make them more efficient to discover novel materials or drive further like improvements on their compilers, for example. So on biology, it's a bit harder, but like it's also starting to happen. And two good examples of this, of two scientific models, like you've probably heard of AlphaFold, like they also released a new update recently. And that I think is like obviously one of the most impressive models that is really good at predicting the structure of interactions of molecules. But then what's also really interesting and came out recently is another model similar to this called EVO by ARC Institute, which is also worth following, which really is like also kind of like between the interactions between DNA, RNA, and proteins. Like it basically is able to do novel things more like with a language architecture, while AlphaFold is mainly with proteins. So there's basically like probably now like when I tracked it like a few hundred really good scientific foundation models. So across every area of science, you have a lot of models. Some of them obviously are much more scaled, but one key intuition is most of them are like have $25,000, like $50,000 of compute spent on them. Not like 10 billion or 25 billion. So my intuition is like to an extent that like the future generations will become more like general scientific models where there will be good reasons to also throw billions of compute into them to scale them up basically further. So the scaling laws haven't been like basically tried yet for science, but they do hold. Like AlphaFold got better also through scaling. So basically there's still a lot of low-hanging fruit, but just throwing more compute at all of these scientific foundation models doesn't work for all domains, but like in some domains where you also have enough data, like which is also obviously necessary. Yes, so I touched on AlphaFold, and because I'm running out of time, like and Evo, like I can recommend you to check those out. They're freely available. And maybe like as a bridge, I think they're only kind of like tools. And obviously what becomes more interesting is like with this scientific method on the right is scientific AI agents. And basically on the left, you see kind of like a rough architecture of this. where there's obviously kind of tools and tool use, like it could use all of these scientific models, but it could also obviously store the knowledge, like has memory, and it can do planning, like I mentioned with this earlier example of fund search. Basically, everything we do that like has interesting outcomes obviously is connected to an extent with planning and like reflecting on it. And then obviously can act out these things. And I think like if one understands this architecture on the left, it maps quite well also to the scientific method. Like each of those things, I think, can slowly be done by AI. And I think like obviously some of them are much harder. But a good example of this, which I'll touch on, is actually some of the already concrete examples of this. And what it needs to an extent is obviously this kind of like architecture and compute, but also some reward function, right? Like it needs to know what is it optimizing for. That's also where DeSci will come in. But basically one example worth checking out is Future House. It's funded by the former Google CEO. Big effort to basically fully automate science. And what they do is like they basically not only create AI models, but they also create physical labs that are fully automated that then can run these feedback loops. And like when I chatted with their team, but also, for example, with folks like RetroBio, which is Sam Altman's like big longevity investment. Like they're already starting to do this. Like they're literally using like GPT-4 in their like automation. Obviously, it's still very rudimentary, but like they're starting to go there. And like it took longer than people expected. Like for example, with Cloud Labs, but I think it's slowly starting to happen. And the whole goal is obviously to run these closed loop discovery, like to really scale up science. Like for example, you could pipette as much as a human could in their lifetime overnight. Like you just parallelize, you have a cloud lab, it's pipetting much more accurately than you, much faster than you, and you don't need to do it anymore, so you basically level up. Like now you have like superhuman pipetting machine or superhuman reasoning engine or superhuman like hypothesis generation tool. So I think the interesting thing is like scientists can like level up to grander challenges than pipetting, for example. And as I mentioned, like I think the interesting thing how this maps to DeSci is, to an extent, you need these reward functions. And like what are the best reward functions in the world to an extent is like dollars for something. And I think that's what crypto is all about. It's like designing kind of reward functions. It's like designing crypto economic incentives. And Vitalik had this interesting blog post on some like how crypto and AI overlap. And like he had these categories, for example, as like crypto as a reward function, or AI as a player in a game, maximizing a reward function, for example. And I think that's what's going to happen. And like to illustrate this example, I've picked the example of like a BioDAO, which to an extent can be viewed as an environment, because like an agent can start to make a proposal, it can get rewards, it can, and you kind of like don't even know, to be honest, like on some folks, if they could be a machine, like they could have a name like a human, but like they have their 0x identifier, they have their username. You've never met them, right? So I think it's actually an interesting environment for machines to come into, obviously on different functions of it. And I think increasingly over the very long term, I think it's interesting to think about like what will be the last thing that humans have left, like right, like and the last thing for humans to do is to an extent capital allocation. Like you're a state, right? You have trillions, and you're like, hey, which department to give it to, which company or which agent? And I think DeSci and these DAOs, like they'll have money, and the main function is to an extent capital allocation. So they're kind of ready for an age where science is like decentralized and autonomous and done by machines. It's literally in the name. So I think it's like there's ways to basically move in that direction. But because I'm running out of time, like I'll basically run through quickly like a summary. So like I think the key that I want to convey is like I don't know if it happens in a year or 2 or 5, and that's kind of not the point. Like obviously progress is happening always, and especially recently starting to become more exponential. And I think the interesting thing is like how the overlap between basically AI, decentralized AI and science could look like is that decentralized organizations like leverage compute and AI agents and novel incentives to really make science much faster and collaborative and accessible, because like everyone in the world can contribute. Ultimately, I think it's still important that humans are involved in some capacity. Otherwise, like it could become a bit risky, like if they're completely out of the loop, which I think is also plausible that they will be, because at some point if a machine writes 10 million lines of codes per second, like it's hard to overlook that, like it's hard to debug that. It's just like superhuman at code writing and much faster, obviously. So and I think it will be similar for science. Like if pipettes like 10 trillion pipettes per second, like how do you overlook that, right? Like you kind of then need to overlook the AI that overlooks this process. So I think like there needs to be also mechanisms to basically slowly grow into this. But I think, yeah, like this key like aspect how science could look like if there would be pretty exponential AI progress would be that basically DeSci's main function will be like a capital allocator, which I think cryptos is to an extent, where people decide like, hey, which areas of science do I care about and where do I put my money, which basically is also compute, where do I put it into? So basically I think that will be one of the core like long-term trajectories like for decentralized science. Yeah, so that's about it. Like I'm happy to take questions if there's still time and explore collaborating and supporting the organization. Didn't touch too much on like what we're doing, but like we're, among other things, providing like cheap compute and funding scientific foundation models. So we're basically like quite directly involved in a lot of those things. Yeah, and excited to explore collaboration with some of you. Thanks.
Thank you so much, Vincent. You can give that to me. Okay, everyone, we've got a 15-minute break. Go outside, get some fresh air, have a snack, coffee, whatever you want, and I'll see you in 15 minutes. ResearchHub Foundation. He's also a third-year bioengineering PhD candidate at the Polytechnic of Milan, working on the development of a point-of-care health device for oral screening via salivary diagnostics. Very interesting. He also has published several peer-reviewed articles in international journals and received multiple academic awards, so we're really excited to hear from him.
Thank you. Cool. Excited to be here, Berlin. So, yeah, a bit about me before we start talking about ResearchHub. So, as I said, third-year PhD student, still in academia. That's what basically drove me into DeSci, because I was facing the problems myself in the lab, especially reproducibility has been a big issue for me. I was trying to reproduce papers that were not working. I was questioning myself. I was like, maybe I'm not that good. Turned out the papers were actually not that great. So, yeah, that brought me into DeSci 2.5 years ago. 3 years ago, basically. Big thank you to BioDAO. BioDAO actually got me into the space with the first symposium, which is back in October 2021, I think. And then from there, started to explore the space. I found out about ResearchHub. I joined as an editor, and then started to do a bunch of other stuff. And then I got involved, inside, management team. And now I just started this year as a director. So, yeah, enough about me. Let's talk a bit more about ResearchHub. What is ResearchHub? So ResearchHub is, as we like to call it, like a modern day preprint server. So it's like your go-to place if you want to discuss articles, if you want to collaborate with other researchers. It's kind of like a Reddit style forum where you can talk about researchers with other peers. One thing that we're really passionate about is incentives. And so I'm going back to this concept. I'm gonna go back to this concept of incentives during the talk, because even Benji today mentioned incentives, how good, how important they are for science, and turned out they are really important. Another thing that we like to do through incentives is accelerating the pace of scientific research. So, many of you are familiar with the concept of acceleration, so, making progress happen faster. We want to do that for science, and we think, ResearchHub could potentially play a role in that through collaboration and incentives. So this is how I like to show, how the platform actually looks like. So if you go to ResearchHub, this is how you'll, potentially see the homepage. So again, Reddit style, you see upvotes, downvotes, comments, and so on. We have some specific features that are, peculiar to ResearchHub. So we have different kind of contents. We have papers, posts, questions, like you would post questions on ResearchGate, trying to get some answers. And then we have bounties, which is a pretty cool concept, borrowed from the software space, where you can put together a little amount of money for someone to come in, complete the task, and get rewarded for that task that you need an answer for. For example, you need some help in your research. So on top of that, we also do funding. We started with the first 2 cohorts of funding. So we funded some AthenaDAO projects. We're really happy to see that collaboration going. We funded some other projects. So we do micro funding, so like 5K, because for bigger projects, you could go to other players in the space. But we wanted to get that initial, kickoff, that kickstart on ResearchHub for people to just explore ideas and publish that in the open on ResearchHub. We also offer you the possibility to do, to write a paper. So you can upload papers that have been posted, but you can also write your own paper and publish it through our lab notebook. While writing a paper, it's important to keep track of your references. So in case you need a reference manager, we also built that. It's in beta, so it's like a very bare bone structure, but you can also, keep track of your references on ResearchHub through our reference manager. And lastly, I want to drive your attention to that sub-tab, because that's what I'm going to be talking about today, which is the peer review tab. So that tab basically shows the peer reviews that have been posted by our community members on preprints or already published papers, so like post-publication peer reviews on ResearchHub. We want you to basically build your profile. It's important for us to see you complete your profile, have all of your achievements within your profile of ResearchHub. So you'll see your bounties, the completed one, the one that you opened. So for example, if you want to fund something on ResearchHub, will all pop up in your profile. We're also revamping this to take into account, you'll see a reputation score up there. That's only a ResearchHub reputation score. We're updating that with some in real life kind of metrics. So for example, your H-index, stuff like that, coming from traditional scientific metrics. So we want you to build your profile, because with your profile, you can basically earn on ResearchHub user knowledge. So this is a cool example from a guy in our community. He had some data. He wanted someone basically to help him analyze some data with specific tools and so on. He posted a question, and he got someone come in and help with this task. So again, pretty cool stuff happening on ResearchHub right now. Today, I wanted to talk about a peer review. So I think when I think about the problems that we're facing in science and academia, there's 3 themes that are recurring. One is about money, so it's expensive to, unfortunately, publish, read, interact with science in general. It is expensive, and it shouldn't be too, that expensive. Another one is time, so it takes a lot of time to get to publication. I don't know how many of you, publish a paper, but, it can take up to 6 months, 1 year, even 2 years for like big journals, which is insane. And the last one is reproducibility. I talked about that already, but most of the papers, unfortunately, don't reproduce. So today, I'll be talking about the first 2. And in relation to that, this is kind of like a very simplified version of like the journey, a journey of a researcher that, you start from taxpayer dollars, they go to funding bodies. The funding bodies basically, receive applications from researchers. That takes some time to screen through the applications. Then the researcher receives the funding. After that, the researchers actually have to do the experiments. That takes some additional time. But once that's done, and the researcher wants to submit the paper to a journal, that should take, I don't want to say almost no time, but very little time. So that's where we want to act, on that portion there, where there's the recruitment for peer reviewers from journals, and the publishing of the paper on the journal itself. Same journey, but for money, because again, I was talking about the 2 problems, money and time. Again, in that corner of the screen, we have 2 numbers which are quite far apart one from each other. One is how much you pay to publish a paper in a journal. The other one is how much the peer reviewers get. So that discrepancy is quite big, and we're trying to do something to reduce that gap. So that said, we started on ResearchHub in August to launch this initiative called Financialized Peer Review. Basically, what we decided to do is, okay, the peer reviewers should get paid. Why don't we start? Where are we not, the one to make the first step? And so we decided to basically start this initiative where we pay $150 to anyone that comes on ResearchHub and leaves a peer review to a paper or a preprint. And so this is an example. This is one of our community members that left a peer review on a paper on ResearchHub, combining what he called a peer review panel, so comments, general comments that you leave to a paper, with some inline comments. So we do allow inline commenting, which I think is pretty cool, because normally when you go through a paper, you want to leave comments that are specific to a part of the paper. And so what you can do on ResearchHub is basically highlight on the PDF that part of the paper and leave a comment, in addition to some general comments on your peer review. So it's really easy to go from basically a preprint to a peer review on ResearchHub. The way we do it is we pull we pull preprints daily from bioRxiv. We have a system that every day pulls the preprints from bioRxiv. And then what happens is we want to signal from the community on which peer reviews should be, which preprints should be peer reviewed first. The way we do it is basically once a preprint gets 5 upvotes or more, a bounty is automatically posted on ResearchHub. So it's $150 that gets attached to that preprint for someone to come in and leave a peer review. Then what happens? Peer reviewers come in, leave a peer review. We have an internal team of editors that span across several expertise that will assess your peer review, ask you for additional comments, additional details if necessary, and then once they verify that a peer review is legit, the content is good, we will, as the foundation, award the bounty and basically get you the amount of the bounty in your hands in your ResearchHub profile. Some of the results so far have been pretty encouraging. Again, we started in August. It's our platform has about 1,000 users every week, so we are not expecting huge numbers. But this has proven to be pretty effective because we've seen a lot of people being really interested, specifically in some fields which will resonate a bit with the audience since it's a bio audience. We're seeing that most of the fields being peer-reviewed, also because we're pulling preprints from bioRxiv every day, are actually from the biospace. So you'll see biology, you'll see neuroscience, medicine, immunology, and so on. So there's definitely a niche in the biospace on ResearchHub that are passionate about doing peer reviews and living commentary on preprints. So to wrap it up, key takeaways from this peer review initiative that we started in August, again, 3 quarters back, 9 months ago, we have received more than 600 peer reviews, which is about 2 peer reviews a day. We have shortened that time that I said it was an actual problem getting that time to be so big to 16 days, which is quite below average for the bounty to be posted to the bounty to be awarded for a successful peer review. And also we have started to pay peer reviewers, earning about 330 RSC on average, which is about $150 current price. For the peer reviews. And as I said, most of them are coming from bioRxiv preprints. So we're also being pretty successful in accelerating at the pace at which people can get their preprints out, get some feedback, potentially make their paper better before it gets published. So hopefully helping accelerate the pace of scientific research through peer reviews on ResearchHub. If you're interested to learn more about a peer review initiative, to join the community, to just stay updated with what we're doing, the first link is to sign up to ResearchHub. We're active on socials, so you'll find us on LinkedIn and Twitter. And if you want to get in the fold of actually, where the action is, feel free to join our Discord. We're always happy to, welcome people in our community. Thank you.
Thanks so much. I remember one of the sort of most horrifying facts I ever learned was that the biggest academic publishing houses have profit margins higher than Google, which is just absolutely insane for something that should be a public good. It's the sharing of scientific knowledge. So thank you very much for the work you guys do. Next up, we have Martin Karlsson speaking. He is a co-initiator of Coordination Network and a co-founder of Lateral IO. He creates services that simplify and accelerate access to information.
Hi, everyone. Thank you very much for listening. So this morning and throughout the day, there were a few key questions that were asked in presentations and panels. And what I'm going to be talking to you about today is essentially a way to answer those questions. So the first one was linked to, how do we achieve outcomes faster? So I think for DeSci to succeed, one of the great opportunities we have is to demonstrate that we get results faster than traditional methods. And I think there's a lot of opportunities for how this can be done on the funding side and on the operational side, and I'll be speaking about how that can be done. There's also the question of how we make funds go further. I think this is another key element that can help provide a very clear-cut argument for why DeSci is such a powerful force. How can we do with $10,000 what used to take $100,000 or $1 million? These are things that I think will be very exciting to showcase. And then I think this was mentioned on the investor panel as well. How do we increase participation? Science is inherently very complex. I think Paul likes to say that DeSci is ultra hard because it's science, which is hard, and Web3, which is hard, combined together. And so again, how can we address that question of how do we make it easy for people to onboard into the ecosystem, participate, and help us make progress? So the answer that I'll be proposing is by scaling expertise. And what I mean by scaling expertise is that we now have, as Vincent alluded to in his presentation, the capabilities to use LLMs and agents to be able to run in parallel what would take us a long time if we were to do it manually in a linear fashion. So what we're working towards is how can we give tooling that enables you to take the ideas in your head and externalize them and have these LLMs assist you and augmenting your abilities, and then taking multiple people with augmented abilities and allowing them to collaborate seamlessly. And I'm going to show you some examples of that in a second, but before doing so, I also want to mention another very important thing. Because as the status quo is today, there's a high risk that your expertise is actually going to be stolen. Because centralized models are going to invite you to use their tools for discounted prices or possibly for free, and you'll be training their models without having any say of how that eventually gets used. They might put in their terms and conditions some things that make you feel somewhat safe, but I would just be highly skeptical, essentially, of committing your expertise into a lot of these models without having optionality of what models you want to use. So one key thing for us is that rather than your expertise being stolen, we want to celebrate it. The second point is that your earning potential might be compromised if you use these technologies in a way where you don't have optionality or control of how your expertise is used, because it might be that you're basically feeding a system that eventually reduces your earning potential. Instead, what we want to do is to have your earning potential scale based on your contribution of expertise. And so for us, it's very important that you have control and that you have choice, and I think this speaks a lot to the ethos of a lot of Web3 and decentralized infrastructure, and I think DeSci is one of the best examples of the importance of that as we come into a new era of acceleration where these systems will have a huge impact on our life, and we should retain agency as we introduce them in our society. So what Coordination Network really is on the one hand, an open source platform that's LLM native, that lets you be able to externalize these ideas and share them with others and run them automatically. And then on top of that, by using that, you also become part of a problem-solving network where as soon as you make a discovery or craft a method that others can make use of, they can become aware of it as well. So this is what we're working towards to maximize access to the system, maximize its distribution, and maximize alignment. So that was a lot of kind of high-level side of things, so now let's get into kind of more practical side. What we've been doing for the past 2 years or so is effectively working with a lot of fantastic organizations that are quite value-aligned on this mission, on different methods that are key to kind of complex problem solving and resource allocation. So you see here road mapping and tech trees that give you kind of a high-level view of pathways to solve complex problems, rapid evidence collection as a way of substantiating claims being made, sourcing researchers in order to understand if you find a bottleneck, how do you find the people that can help you unblock it, and also if people want to participate, how can you help them translate their idea into a proposal, and how can you make those reviewing those proposals have the easiest job possible. And the other ones that I haven't listed in a little card is what we're also excited about is that we're also looking at things like patent review, which plays an important role, and there's a lot of exciting opportunities of how that can be revolutionized. And then also even more kind of next level is that triggering basically computational biology experiments as well, so that you really can go from kind of mapping a problem, understanding possible solutions, substantiating the path, sourcing those who can contribute, coming up with ideas, running experiments, all in one kind of setting off a chain of events that can be run in parallel and feed back to each other. So this is all very exciting. It's also rather complicated. So what we've been doing is essentially we created an interface that lets us prototype and evaluate how well are LLMs actually able to do these things today. And so I'm going to show you a couple case studies linked to other presentations that you've seen today as a way to kind of bring this to life, because a lot of conversations about AI can feel very kind of like abstract. So I wanted to show you kind of where things are at today and where they're going. And so before I show you the interface, a couple keynotes. The first one is the interface that you'll see is intended for experimentation rather than mass adoption at this stage. So it's quite an early adopter experience, to put it that way. So I just want you to keep in mind that what you see is really a way to play around with these type of pipelines for analysis, and then think that in the future you could basically just automate the entire thing while having full transparency as to what is being done. The second point is you'll see a lot of nodes. It's a kind of graphical flowcharty style interface. And the reason you'll see all these nodes is because nodes allow us to capture information at multiple granularities so that you can take a proposal and then you can split it down into its sections and you can put next to that a bunch of papers, and they're all different forms of nodes. So that's just to give a bit of a backdrop as what you're about to see. So the first example that I want to show you is linked to the Catalyst project that you saw Benji announce. And what's been really fantastic here is that we've gone are entering a second phase there already. So we've been working a lot with Logan, who's an incredible person in terms of like the amount of knowledge she has. And if you talk about like methodologies, her ability to translate those methodologies into a structured process is wild. So that's been a privilege to work with her, and also with Lutz and Benji, who have also provided a lot of input into this process. And then the funny thing is we've also essentially been working with Jack Scannell via his document, which is kind of an early example of working with a digital twin of someone in order to get input into this process. So what I'm going to show you, and I can't live demo via this, so I'm going to show you a video, but I'll give you a quick prep, is essentially bringing an idea from the Catalyst platform into the interface. And then I'll show you how Logan has basically put in some best practices into a node that can then be run against that proposal. And then I'll show you Jack Scannell's method being run against it as well, and I'll take it from there. So here's what this looks like. You have a node already there. It's the PDF for the project. And then you have a node with Logan's questionnaire. Within that node, you essentially have these key questions that she developed by reading a few different papers on how to help facilitate translational science. And so what you can do is you can basically select those two nodes and you can say, please evaluate the proposal using the questions from Logan. So quite straightforward. The whole idea is that you can take a verified methodology and run it against an input and it's not just kind of black box making it up every time you do it to the model, but it has guidance from the expertise of the individual. And then it's giving its answers to those questions. And I think what was great is like through I think to Vincent's point as well on kind of scientific agents, this has allowed us to work with people with deep domain expertise to very quickly, call BS if it's not working, and also give a sense of like, where is this relative to their expectations? And this is the whole iterative process that is now underway so that we have a benchmark from which to improve the process from there. And now I'm finding Jack Scannell's, I've broken this down into multiple steps. And again, you can basically then, Jack Scannell created a proposal, anyone in VitaDAO might have already seen this, a guide for how to review incoming proposals. And this lets you basically run one of those methods and get a first pass. And so why do this? Well, to the point of scaling expertise and scaling participation, this would mean that somebody arriving at the Catalyst Pro platform could put in an idea and get an automated review with the team behind Catalyst feeling safe in the consistency of what that pipeline looks like. So you're scaling the expertise of the Catalyst team to be able to give feedback on incoming information. So I think it's a very exciting way to already kind of see this coming to life. Now, the other thing to mention, to just see if there we go. The other thing to mention is like a full review pipeline might end up looking like something like this, which can look very complicated if you suddenly arrive on this. The point is you might not even have to see this because all you'd be doing is sending the information into the process and then seeing it run as an evaluation. But the second kind of meta level that I wanted to mention is that what's great is that by using the tool to develop this, it also means that you can share what you created with others who can then take their own spin off it. So Kishore, one of the Nucleate fellows, accepted that I could show him how he was basically able to take some of this as inspiration to then create his own review pipeline. So the whole idea is that you both are able to scale the ability to do the review and analysis, but also scale the team's ability to fork that idea and take it further and adapt it to their needs. And this is all to this theme of this acceleration that we want to facilitate. So that's giving an idea of how you can scale the expertise for proposal review and proposal drafting. The other part of it that I want to highlight is also kind of on a higher level in terms of that road mapping side. How can you translate the great ideas that you might see from talks or transcripts or workshops into a roadmap very rapidly? And this is where we've been working closely with the Foresight Institute, who for decades now have been on the forefront of pushing a lot of these frontier technologies forward. And what's very exciting there is that they've been a great partner to kind of bring these ideas together. And we've also been working with Protocol Labs, who have had a team dedicated to looking at how can you collectively synthesize information. So what you'll see now is basically how you could take a transcript, so you could just speak or take a presentation and translate it into a roadmap. And I'll show you in a second why this lays the foundation for something very exciting. So here I'm just loading a transcript from a recent Foresight event from Jeremy Barton, who has some pretty cool ideas of creating an open source platform for molecular machines. And you see here the transcript is just text. It's pretty trivial to create transcripts nowadays. And then Silva has developed what is called a research roadmap methodology, which is really a guide for how do you take an idea and create a structured output out of it that allows you to pursue it efficiently. And so again, it's basically take the transcript, take the method, and say, in this case, she has something called a goal card, which gives you a summary of what are the key elements that are needing to be addressed in order to achieve that goal. And so it translates that summary, or that presentation, into structured information. And in this case, it's a short summary, a long summary, and then the key nodes that need to be achieved in order for that goal to be successful. Now, the reason why all of this is so important is because this gives you the foundational layers to then introduce agents into this environment to help you take action independently so you can imagine you could have a conversation or a presentation, and then right as soon as you're finished, it sets off an entire team to go and do your idea, basically. And importantly, there's full attribution as to where that idea came from and so on, so that you can kind of be rewarded for how you're linked into the further pursuit of it. So this is, what we're doing here is kind of building the different components that allow us to have transparency of how these AI agents work. And just to give you an example, this goal card can then be translated into these subnodes, which then can be pursued individually by agents. And what this means is that, for example, from Foresight, you suddenly have a host of ideas that are being populated into a curated library that are there to be pursued and translated. And there's some pretty amazing ideas in there that I think can be, for example, combined with the Catalyst program so that you could have someone coming up with an idea and then they could find ways to support the pursuit of it, and you have this chain of events for a brighter, faster future to emerge. Thanks. So this last piece is a little bit harder to demo when I'm doing a video because it won't look as cool. But the next step, as I mentioned, is then how do you integrate agents into this? And just to kind of illustrate that, I have a video which shows basically one of these nodes being taken, and then we've created a research agent that goes and translates that node into keywords, goes and fetches papers, evaluates the papers relative to the original node, and is just a kind of quick example of the types of automation that can be enabled. So here, this is actually for one of the BioDAO proposals for fission, who I think is here. And it's then translating that into keywords. It's then finding papers from Semantic Scholar. It's evaluating the relevance of that paper to the original. And what you can imagine here is it basically can parallelize a lit review for you with full transparency as to every step that was taken. An important note to mention here is also that Maryna from Cerebrum DAO was very influential in giving feedback in terms of methodology here, because there's the Prisma guidelines for how to do systematic reviews, which basically give you a perfect instruction for agents as to how to report back in a way that is academically rigorous. So this is kind of what the different pieces will look like. And what's exciting is that what that means is that you basically go from a high-level tech tree roadmap of where you're trying to go, you have all of the dependencies that are going along the way there, and you have then the ability to conduct research and undertake experiments for those dependencies. And what that means is you have a high-level guide that guides the lower levels that informs back to the higher level. And it's all composable, so it can speak to other systems as well. So this becomes this dynamic world that allows us to have full visibility as to how we solve the problems that we want to solve, and understanding how it was arrived at. And just a quick jump back to the interface, this means that these nodes, if you imagine kind of like a lot of sci-fi movies, what this means is that these nodes can then be presented to you in the order and in the wording and in the format that best allows you to learn and make use of that information. So it's not going to look like this for most people very shortly. It will look far more dynamic. I mean, you could even imagine an AI avatar literally presenting a news channel presentation of the idea, like whatever you want. This becomes an authoritative source that is expert verified with attribution as to who did so, who created the method, what model was used, et cetera, et cetera. And behind it all then becomes this reward layer that allows us to link into a lot of these retroactive incentives that have been discussed here today, so that we help those that are trying to solve meaningful problems do so faster, and the network and those that contribute both with methods and with developing components can participate in part of those rewards as well to help, in a value-aligned way, accelerate our progress towards those solutions. So yeah, basically a network of expertise with a scalable on-ramp, because anyone who then wants to participate has an interface that allows them to learn the steps to do so. So everyone gets to know how to participate in DeSci. And this is kind of the whole idea, is to help make this easier for everyone and have this way of seamlessly exchanging ideas, know-how, expertise, and so on. So we dramatically increase the capacity of domain experts and expand the pool of contributors to achieve outcomes faster. We seamlessly identify synergies and pool resources to uncover novelty with maximum speed and resource efficiency, supporting barrierless aligned acceleration to the bioact future that we all want to see. And I will leave on a final note before I close, and that's just to say that this journey started 2 years ago at DeSci.Berlin. So I think another thing to speak to is that the community that has been fostered within DeSci and the organizations and the BioDAOs and Molecule, this, like the value set of openness and willingness to share is fundamental to something like this getting as far as it even has. And it's really like testament to operating in this new way. Allison from Foresight wrote this book called Gaming the Future, where kind of Pareto-aligned outcomes are kind of what we strive towards. And that's kind of, over the past 2 years, basically been how I've been operating. And it's allowed us to move very, very quickly with a very small team. So just want to do a big shout out to many of you in this room who have contributed already. And we're really excited now that this kind of next formalization takes effect, where a lot of that contribution can also be acknowledged. So thank you very much for listening. Yeah, I don't know if there's time for questions, but okay. Just come to me if you have any questions or would like to try it. Thank you very much.
Cool, thank you so much. Yeah, I mean, it's amazing to hear that. I think after AthenaDAO, a now coordination network of 2 things that started at DeSci.Berlin, which was quite cool. So if any of you have any ideas, start pitching them so we can keep that track record going. Okay, so next up we have Lou. She's from the Foresight Institute, which I think Martin was also even talking about recently. And Lou is a governance researcher exploring alternative economic justice and political systems. Thank you so much.
Thank you. Thanks. Hello, everyone. I'm just checking that this is the up-to-date version. Yes, it is. Thank you so much. Okay, cool. Let's talk about opportunities for DeSci within the context of network sovereign. So thank you for introducing me. My name is Lou. I have 2 hats, which I'm using today. One is Foresight Institute. I am program director there and accelerating breakthrough technologies for the benefit of life. And I'm also a political science researcher exploring governance models beyond the nation state. I'm also a community builder through Fetopia. Well, okay. Is there a little... So, I wanted to start this talk with a video with Brian Johnson, who is talking about something and introducing the topic in a really interesting way. But does this support video? Is this gonna work? Thank you for whoever is troubleshooting. I appreciate. I could try to do my best Brian Johnson imitation, but I am not sure I really have the vibe, you know. Ah, thank you. Sound. Thank you so much for helping with the video. So there are a few things that are interesting to me in this video. The first part, like, you know, the sort of like unhinged, God complex comment about levels of ambitions for humanity and what those may be. But there is also that it introduces this idea that we need potentially, and we should explore new models of governance for the world. That there should be something after the nation state, because there are gaps into fulfilling a few of the, or like solving a few important problems that we may have. And, you know, this is what Brian Johnson care about, and this is the way he wants to go about it, like create a new state. But the question is this the only way? Should we stop like our ambitions here, and are there other potential opportunities? But first of all, let's define a little bit like the terms that I'm going to talk about here. I'm talking about network sovereigns when I'm speaking about new forms of collective human organizations that have been emerging in the context of networks, within the context of networks. And this movement is propelled by technology. It's been a bit that the current global political system that is founded on the idea of the nation state, which is the Westphalian nation state, and the idea of sovereignty, the ultimate sovereign being the nation state, is put into question. You know, first and foremost because of globalization and, you know, questioning in general borders and territories, but also because of new technologies. And this is, you know, I expect this crowd to be most familiar with this argument, but as in many different domains, the possibility, you know, the fact that we have digital technology, communication technology that transcend boundaries, and now the fact that we have the possibility to create tech, to build trust, to not have third parties, to have contracts and enforcing them, to have new voting mechanisms, all these open new possibilities for governance. This has been an idea popular in this, you know, in the Web3 crypto ecosystem for a while now, of course. And nonetheless, then Vitalik Buterin, founder of Ethereum, if I need to say it, created this pop-up city last year in 2023 called Zuzalu, and it was put together in 2 months in Montenegro. I thought the picture was hilarious. It's from a little bit this like sensationalist article, and they put like Emad Mostake from Stability, Vitalik, and Grime into this. I don't know. This was actually the city. For those who went, you may recognize it. Anyway, so Vitalik wanted to experiment with like creating this pop-up village, experimenting with governance, innovation, right? There was a lot of like science and tech there, and seeing like if we can, by, you know, trying these new ways of living together and collaborating together, advance things differently. This idea was inspired to Vitalik by Balaji Srinivasan, when he wrote this book in 2022 called The Network State, in which he proposes this idea of a sort of corporate state in the end. Like it starts with a startup, there is a founder, the startup acquires real estate and a territory, and it has its own like crypto money, and then it grows in size, has more and more citizens, and ultimately, by, you know, like the way of having a census that shows that it has a lot of citizens and like a lot of whatever their token is, can be recognized by nation state as, you know, having sovereignty and become a state in a way. I think I will give it to Balaji for something, which is this idea has had a lot of mimetic power. Like, I think most of you have very likely heard about the network state. And it is important that people, you know, get this idea in their head that it is possible to have forms of governance beyond the network state, that there is something else that is possible, that there is no, let's say, nation-state realism. But I have a few critiques as well of Balaji, which is, actually, if you read the network state, there is no proper like governance model that is proposed, or at least the one that seems, you know, if you, I think there is once the word governance in the book. If you look at the model, this like startup founder, it's reproduced a lot of the ideas of that generally the crypto community has with nation states, which is, it's very centralized, it's extremely oligarchic, right? And it's territory based. So maybe, you know, we can use our imaginations for like seeing what could be possible that is even more ambitious. And my biggest critique is it's an exit-based strategy. And why is this a problem? Is because we have huge challenges right now that we need to coordinate on as humanity, you know, to solve like on a global scale. A few of them maybe, you know, just like being near a potential ecosystem collapse, or you know, AI coordination, AI alignment and coordinating around it and making it so that there is no harm's race. All of that in the context of, you know, a rise in autocratic regimes right now on the political level, and the UN that is completely, yeah, like sort of pretty useless in terms of world governance at this point, and has lost a lot of its credibility and power. Yeah, so, you know, I think that if we go the network state way, it's not going to work for us in this context of huge challenges for humanity. That's why, with a group of researchers, we went actually to Zuzalu with the goal of proposing an alternative to the vision of the network state, being like, okay, actually, you know, that's just one proposition in a landscape where we can propose multiple forms of governance, new forms of human coordination for the world beside the nation state. And we proposed one, but it doesn't have to be the only one at all. You know, it's also to encourage more thinking in that direction. The one we tried to play with the word like state and be, okay, we don't want something that's territorial. We want something like transcends boundaries, and the word nation, which, you know, in political science relates to the idea of like, it's the culture, it's the more like the relationship, the fabric of relationships between people who are part of the same nation. And so we called it a coordination. And it is a proposition for a new institutional structure for global cooperation. That is very like voluntary based, that is tying the local to the global, and allowing for systems that are interdependent, very decentralized, but integrated, and that are really acknowledging this interdependence that is like, you know, a fact. We don't really have a choice. We are interdependent, like all connected in this world, and we have to build systems that reflect that. I also wanted to talk about actually real life sort of empirical examples of where this sort of like movement is starting today. There have been a few sort of like spin-offs after Zuzalu. Vitalia is one of them. I don't know if Lawrence is here. I saw him like a few minutes ago, but I'm sure some of you have been there. I think Vitalia is like openly a sort of like proto-network state. It is built in the context of, within the territory of Prospera, which is a special economic zone that has like a different legislation, which is in Honduras. And something that is interesting here is the legal system allows for sort of like different research sort of ability to do, like, to conduct research. And this is something that can be leveraged for, you know, you can imagine like medical tourism, like people come and like come try and like new therapy and like biohacking that's not allowed otherwise, and that accelerates potentially research and also create like resources. And you know, you could think of like Vitalia wanting to create like different cities in this way and expanding. Other possibility, there is Edge City, which is, I think, actually more taking this coordination like approach, just in the sense that it's not territory based. They're really focusing on like the fabric of like the community, building the relationships, sharing resources, putting things in common, and very much still focusing on accelerating science and tech. For instance, I'll be there with Foresight from the 10, I'll be there all month. It's in June in California, in Healdsburg. But I'll be there also, especially under the Foresight hat, from the 10 to the 16, and we are going to work on the intersection of AI, neurotech, and bio, like basically see how we can, build friendly relationships with AI and become really cool cyborgs, if we want to. And we'll be, with the help of Martin's tech trees that he just wonderfully showed us, mapping all the space of this, making, seeing like how we can make that happen. Like HCT is a really interesting approach. You can scan the QR code if you want to like check this out and join us. I told you I was a governance researcher, so this is a residency that we are doing on the topic of network sovereigns. There's Morgan, who is here, who is part of the residency, and some of you know it maybe as well. If you want to check it out, you can also scan the QR code. We are, doing more research into these empirical examples of where network sovereignty may be helpful, and with Morgan in particular on the DeSci aspect. So just to wrap this up a little bit, tie it back into the opportunities for DeSci in the context of network sovereign. I think I want to insist that, to Brian Johnson's point, there are indeed gaps, like institutional gaps, and things that are left, important things that are left unaddressed. And really, I think DeSci has a lot of a big role potentially to play into doing super important things. The question is, what are these things that we are going to choose to do? There is the Brian Johnson, approach. And I'm not saying that this is not important, this is very important. You can have it, like, no problem. But we also, longevity is important. It's a big part of the work of Foresight. But I think we should be even more ambitious. There is a lot to be done into working on systems that can give us planetary coherence, full planetary coherence, make it so that we are balanced within our ecosystem. There is a lot to be done potentially in working with AI and making it so that we build a relationship with AI that allows us to benefit from the full potential of the human-machine coexistence and cooperation. And, on the other side, if we can't make it work, we won't have network states or longevity in all areas, and so this is really important. And so maybe DeSci will be the last part of the chain, but hopefully it's also a friendly relationship, right? Not everything has to be aggressive and competitive. Ideally, we build a very loving relationship with AIs. This is the details if you want to read a little bit more about this, but thank you for listening.
Thank you so much. I definitely think you win the prize for most entertaining slides today. Okay, next up we have George and Charlie. George is a general manager at Trace Labs, where he leads the company's key projects, deploying trusted AI solutions powered by Origin Trail in collaboration with global partners. And then Charlie is an investor at ID Theory, a liquid and venture-focused crypto fund that invests in the next trillion users over 3 verticals, which are decentralized AI, DeFi, and DeSci. Cool.
Hi, thanks for the intro. So, just for clarity, my name is not George. That's probably the English translation of it, so Jurij. But I go by George sometimes as well, so it's fine. Are the slides here actually okay? Because the video seems to. Okay. Yeah. Okay. Great. All right. Fantastic. So. Thanks for the intro. We're going to be talking today, and Charlie will come on the stage a little bit later, about decentralized science on the decentralized knowledge graph. So before going into the details, and just see if I can't seem to get the slides to move. Is this big button next, right? No, it's not moving. Back. All right. I've had this in my previous presentation as well. It didn't work. All right, let's try again. Now we got it. Okay, thanks. So. Before going into the details, I'd like to just set the scene a little bit by exploring the history of knowledge, so to speak. So humanity has had three big, large knowledge revolutions that really propelled humanity forward. The first one being the Gutenberg's printing press that really, before that invention came to be, knowledge was really concentrated in the hands of very few people. It was very difficult to be replicated. If you wanted to copy a book, you had to rewrite it, literally. And then the printing press came, and all of a sudden, books could be printed, and knowledge really was distributed to a scale that was, not possible before. And that was what, some 580 years ago now, kind of ushered in an era of knowledge dissemination for humanity, right? And then quite a couple of hundred years later, the internet came about, right? And the internet enabled this knowledge. So now you didn't have to go into the library anymore. You could access knowledge online. You could even produce knowledge. Everything was a lot more connected. So it really kind of sped up the cycle of how knowledge was consumed and how knowledge was generated by people. So arguably, both of these two inventions, they had some very good impact on humanity overall. Of course, a couple of pathologies were present as well, but overall, very positive impact. And now we're in the midst of the AI revolution, right? So we are kind of building on the internet, and the question here really becomes, how do we enable AI to reach its full potential? So to avoid the pitfalls, to avoid the risks that actually have surfaced already quite often in the past year and the past couple of years, and are related to everything from IP protection to actually being able to trust what you see, and so on and so forth. And what we see here is actually three building blocks that need to happen for AI to unlock AI's full potential. The first one being information provenance and verifiability. Now, what does this mean? This means, I'm sure everyone here has at least sometimes used tools like ChatGPT, Gemini, and whatnot. How often do you get an answer that you can't really verify? It's coming from somewhere, might have some source attached to it. You don't know who issued it. You don't know who wrote that. So how can you trust the answer that the AI generated, right? So if you want to have full potential of AI, this is kind of it must be rooted in information, in verifiable information. And that's especially important, what Charlie will talk about later, for scientific research, right? You need to trust what you see, otherwise you're kind of, even if it's 90% correct, it doesn't really work, right? The second piece is around data ownership, right? So we have challenges with IP protection models being trained on data they shouldn't be trained on. Recently, it was just like Scarlett Johansson and OpenAI again with some clash, right? So the infrastructure that supports AI needs to have data ownership built in, so everybody gets what they're due, right? The value is distributed. And the third and last piece that we see as really, really critical is embedded incentives. So we need to have a mechanism that incentivizes people to produce quality knowledge, so that AI can use that quality knowledge either for research, either for training, or for whatever purpose we would use AI in the future. And Jan LeCun, the Turing Award winner, phrases this really nicely in his quote, right? So the AI systems will have to be crowdsourced, and if you want them to be a repository of all human knowledge, all humans need to contribute to it, or at least have the ability and option to contribute to it. And this is where verifiable internet for AI comes in. And what is the verifiable internet for artificial intelligence? We see this as an intersection of crypto, internet, and AI. And Origin Trail is one of the core components that we see as enabling this verifiable internet for AI. And Origin Trail introduces a couple of really exciting concepts and components. The first one being the data is organized in a decentralized knowledge graph, meaning it's highly structured, it's highly connected, it spans across individuals, it spans across organizations, enabling any AI system actually to tap into it, right, and have a lot more, let's say, knowledge available to do research, to answer questions, to answer prompts, queries, and whatnot. Going one step further, for those of you who are in the AI field, you probably have heard of retrieval augmented generation, which is a framework where you find some external knowledge, you feed it to the AI, and AI does a summarization kind of based on the input of the knowledge that you provided, right? To maximize accuracy, to increase actually usability of AI. Now, Origin Trail introduces something called Decentralized RAG, Decentralized Retrieval Augmented Generation, which enhances this concept by allowing not only more precise extraction of knowledge, specifically important for scientific research, right? You need to be able to extract the right pieces to be able to use AI in a trusted way, but also that all of those pieces that you extract are actually verifiable in terms of who issued them, who modified them, who is the current owner, and so on and so forth. So that's a very important piece. And all of this verifiability and trust is rooted in blockchain. And blockchains, Origin Trail is a multi-chain system. We'll cover that a little bit later. It can connect to several ones. So that's one last thing that it introduces. So one really cool thing is the incentivization of knowledge creation through tokens. So that's also a very important piece if we want to generate quality knowledge, as mentioned before. And we'll see a little bit later how that works exactly. So for more details, you guys can scan the QR code. That's the white paper that we released a couple of months ago that talks about these concepts in a bit more detail. Just a quick example of how the decentralized retrieval augmentation and Origin Trail work in practice. So we did a little test of the GPT-4o when it was released a couple of weeks back, and did a test just GPT-4o with browsing capabilities, and then we integrated it into the ChatDKG and the Origin Trail framework. And this is the answer that we got. It was a sustainability question around Heineken's Scope 3 emissions in 2022, broken down by category. We get some answer that is not really what we asked for, some reduction, no numbers, no categories, some source. Okay, it's something not great, right? Kind of terrible. This is the same question on ChatDKG using the same model, right? So it's what were Heineken's Scope 3 emissions broken down by category, because we have Heineken's carbon emission report as a knowledge asset in that decentralized knowledge graph. The AI is able to extract the knowledge and answer all of these things in a lot more detail. And of course, you can see up there, I'll get a laser probably here. So in the here you can also see the source knowledge asset, which means that this Heineken report, somebody issued it. In this case, it was Origin Trail as a demo to actually be able to for AI to be able to access it. So very kind of plastic example, but just to give you an understanding of how what a difference these things can make. Last thing I'll introduce is the concept of knowledge paranets. So I introduced the Origin Trail decentralized knowledge graph. So knowledge paranets are, let's say, clusters of knowledge in the decentralized knowledge graph that have that focus on a specific topic, and they have specific AI agents, services associated with them. So AI solutions can actually tap into them, use them. Now, they're led by and created and led by a paranet operator who defines all of these parameters. So what will the blockchain be? What will the AI services be? What ontologies should be used so that the knowledge is actually useful? What quality checks will be performed? All of these types of things. And the last but not least, these paranets can be incentivized. And I think that's what I mentioned before. You can submit a governance proposal on Euroweb, which is a blockchain on Polkadot tailored to the decentralized knowledge graph. And if the community votes that this makes sense, that this knowledge is valuable to humanity, we can have incentivized parentage, meaning that anybody in the world can mine knowledge, and if the knowledge is of expected quality, they can get compensated with Neuro tokens. And all of these paranets at the end of the day, right, you can have solutions that tap into one paranet or multiple paranets depending on what you're using the AI solutions for, and do really, really awesome things. Last thing for me is just a quick insight into the future. We have the decentralized knowledge graph version 6 running for about a year and a half. We have a lot of solutions that are utilizing it in the enterprise world. So from the British Standards Institutions, the SCAN, which is kind of like a aggregate of all largest retailers in the US that use this to exchange audit reports, to travel safety with Swiss Railways and so on and so forth. But what we have upcoming with version 8 is really even 100 times more exciting. So we have a bunch of scalability updates upcoming to support the growth of these paranets that we just went through. A bunch of new AI integrations, specifically also targeting AI agents that can do all sorts of awesome things. DPIN, right? So for private knowledge, so that you can use your phones, mobile devices as also a store for private components. Not everything needs to be public, of course. Multi-chain growth, expanding into additional blockchains. And of course, at the end, the autonomous DKG. And what does this mean? Once we have a lot of paranets, a lot of knowledge assets, a lot of knowledge connected on the decentralized knowledge graph, the knowledge graph through inference can actually grow new knowledge on its own, right? So it can expand and grow without actually people needing to interact with it at all. And that will be it from my side. Charlie, hope it didn't take too much time, because I forgot to put the timer, but I'll pass over to you.
Thanks, George. Ooh, thanks, George. Thank you. Nice to be here. Thanks, everyone, for having me. If you are still awake at this late stage, I hope you're wondering how DKGs can actually improve DeSci. Jurij has already been through many of these, and I'll take you through them one by one just so we can hit the point home. But the main point really is, what most of you have already talked about today, is how can we better coordinate as we unravel from our old institutions into our new shiny ones? How can we coordinate across the globe with all of us pushing towards the same goals? And knowledge graphs, as Juri's already said, are very good for compiling composable stores of data that we can make new complex relations with other people and coordinate. But decentralized knowledge graphs add some new things into the mix. So in terms of scalability and composability, we obviously all know about blockchains. They're very good for establishing trust, but not for all forms of data. And then data held outside of these is very hard to share selectively and make those collaborations across borders. Whereas the solution Jurij outlined with DKGs plus the blockchains, they're a lot better for dynamic scientific data and complex relationships that I'm sure many of you are working with in your studies. That means that we can make them more scalable, more collaborative, and more machine readable, which is what we'll get onto a little bit later. Verification, obviously, a very important part of it when we're talking about scientific assets. You know, scaling truth and trust across scientists across the globe is very difficult, especially if we have no aligned framework for it. And using the DKG for data provenance will be especially important for scientific models, especially when you start looking at hallucinations and biases. You know, I'm sure many of you experienced using one of these models and come up with a hallucination. And honestly, some of them are quite funny, and some of the biases are quite funny and well documented. But when it comes to science, it gets a little bit more life or death. Like, we can't be basing any of these breakthroughs on this stuff. In terms of ownership and privacy, again, massive part of it. Storing and monetizing important or sensitive data is very tricky today. Whereas in the DKG, scientific data can be wrapped as knowledge assets with tailored data management, and you can have attribution if you wish, optional privacy for assets that need it, and you can monetize if your asset so deserves it in the future. So I work at ID Theory. I mean, we had a nice little intro there with the tagline. So we're a crypto-focused fund, investing in decentralized AI, science, and finance, and anything in between, really. And internally, we spend a lot of time thinking and mapping out the future of what we think that should look like, and trying to work and build towards that with other founders. Our co-founder James has written this DeSci blueprint. I don't know if anyone's come across it, but it's a very good read. I recommend if you've got some time after this. But through all that time, finding the correct partners is not always easy. And with something in your head that you think would be perfect isn't always ready built. So this time around, we wanted to roll up our sleeves, get our hands a little bit dirty, and start build towards that future we wanted to see. And we came across Jurij and the guys at Origin Trail. It really was like a match made in heaven in terms of what we're trying to achieve. So the simple goal is to establish the ground truth for autonomous research and decentralized scientific advancement. Sounds pretty easy. Might take us a little bit of time to get there, and we'll get on timelines in a second. And what we're setting up is a framework for knowledge mining on science-specific research, where users can receive incentives for adding and indexing and verifying relevant scientific data onto the DeSci Paranet. And then in the future, there will also be incentives creating AI tools for accessing the research and value inferencing of the new knowledge. At the moment, we're going to be building a query and DRAG interface, which we'll be demoing later, but then more sector-specific apps or services can be done in the future. So you can kind of imagine some kind of gene Paranet where decentralized 23andMe apps on top, providing rewards back to the data used, which is a pretty cool future. I'll walk through some timelines quickly and what we're hoping to achieve in the further future. So we have short, medium, and long-term goals with this Paranet. The V1, which hopefully will be Q3 24, is more human-focused. So neuroscience to start. It's a field very close to some of the founders' hearts, and we will hopefully be expanding that to other fields in the future. But what we really wanted to focus is making this accessible for everyone in all types of levels. I mean, I personally will be able to use this. I have a background in psychology, so it's a pseudoscience. I'm not sure anyone recognizes it here, but it does work. And we'll be making it very accessible through our UX and data pipeline. So you'll be able to simply drop a PDF, a research article, into the pipeline. It will structure it as a knowledge asset for you, and then publish it and map it with the relevant ontologies to make it machine readable. And there will be financial and social incentives for contribution. You already touched on the financial side. The social side is something very close to me. I mean, personally, I think social capital is huge for open science, and I think all of you have experienced that in your troubles. Being paid isn't always easy at the start, but receiving some form of reputation and social aspect for the work you've done is really important, and I think it will continue to be so. So a bit of a shout out here. If anyone's working on some composable reputation system that they might want to plug in here, would love to speak afterwards. I'll be around. And then the jazzy future, we've actually already heard a couple people speak about this earlier. It was very interesting to hear. We are looking to make this an autonomous agent-focused Paranet, hopefully by the end of year 24. Why? I think we've already touched on this briefly. I'll go over again. If science is about finding truth in the most efficient way, these autonomous agents are the ultimate truth seekers. They have less general biases. Well, remains to be seen as of yet on the training data. Citation games, they're not hanging around playing bibliometrics. And in terms of funding chasing, they don't necessarily need to be playing that game the whole time. They're not out at the bio rave tomorrow whispering in everyone's ear asking for money. They'll just be away working towards their general goals. They'll be make massive strides in overcoming risk aversion that we've heard from earlier today, creating novelty explosions and efficiency. They really are just exponential query machines. And paired with a knowledge graph where they can make all of the relevant connections, there just really is no limit to it. It's a very far-flung future. Eventually, these things will transition from research assistance to IP generation, and then translational science in the future. But first, we need our data and coordination layer, so that's what we're hoping to build. And I think we've got a good demo coming up for you, which George is going to try to do.
Yeah, let's see how the video performs here. since, all right, seems like it's gonna work. Just before I click play on this, what we did for the demo was what Charlie mentioned. We transformed some of the scientific papers into the knowledge graph, created these highly connected knowledge assets, and built a DRAG, so decentralized RAG pipeline that actually, through this interface, finds, based on your query, right, based on your research question, the relevant pieces of information, and then feeds it to the LLM to generate an answer. So I'll press play now. Okay, so it's playing. So we'll just ask a question. I think this one is gonna be related to the Alzheimer's disease, to list all of the papers. So now the retrieval is happening, right? So the DRAG is working. It's retrieving pieces of the knowledge graph. And there we go. We found an answer. We found these two papers. You can see the source knowledge asset over there. You can click on them. You can see a little bit of more details on the actual papers. We'll look at how these actually look like on the in graph form in a little bit. But for a second, we just take a step back and ask a follow-up question, also related to to the Alzheimer's disease, and specifically specifying, like, use the gene graph ontology to answer this question. Same thing happens, right? We find the appropriate knowledge asset, appropriate pieces of the knowledge graph that is able to extract this and then provide the answer. And now if we go into the knowledge asset quickly and actually open it on the graph, and I see again 1 minute, I think it's just 1 minute left anyway. So open it in the DKG Explorer. This is Decentralized Graph Explorer, Decentralized Knowledge Graph Explorer. It loads, and actually you can see the graph form of the scientific paper, which was a PDF before we transformed it, right? And here you can see how this actually looks like. So we got the knowledge assets represented, then we have a bunch of objects that are representing paper contents, and results, and all of the exciting stuff that you would actually use in research. Now, the cool thing here is when we look at the resources, right? So when we go into the knowledge asset, we can see that this is actually using, so the paper was translated using a lot of different ontologies, from the SPAR ontologies describing the actual paper, to OB ontology that describes what methods were used, and then also gene ontology that actually kind of describes the results, right? So you have everything there that you need to do the research. And now I think actually the demo will end anyway. And yeah, I think just Charlie, if you wanted to have a couple of sentence or two of conclusion or anything to add. Yeah, there we go. Yeah, maybe, yeah. So, maybe just a last sentence from me. So if you want to also become part of the Origin Trail verifiable internet for AI, help build solutions that contribute to advancing in this direction, feel free to connect. If you scan this, take you to our X account, and you have everything in there. And yeah, you can get involved with the upcoming paranets. We have the ID theory DeSci Paranet. We will have a couple of others also up and coming, and yeah, we can help build this verifiable internet together. So I don't know, Charlie, if you want to add something, but that'll be it from my side.
Yeah, I mean, yeah, more of the same for me, really. If anyone wants to get in touch or get involved with the Paranet, the DeSci one specifically, please feel free to get in touch with Twitter, or here, yeah, I'll be hanging around afterwards. That's it. Thanks, guys.
Thank you so much, guys. Yeah, I mean, I think we've all been on ChatGPT before and seen some of the very questionable stuff it can say, and with utter conviction. So I think decentralized knowledge graphs are really important. Okay, we've got one more talk left for the day. It is by Paul Kohlhaas, who I'm sure many of you know from Molecule. He has a background in economics, has successfully founded his own company, Linen Labs. And then him and Tyler got together and started building Molecules in about 2018. And Paul has also recently taken on sort of a really strong role in the BioXYZ leading team. And yeah, they're doing some exciting stuff. So here he is.
Cool, thank you so much. Yeah, first of all, a big thank you to all of you for sticking throughout the whole day. Keeping some of the most exciting things for last to keep you guys engaged. No, yeah, I really truly appreciate all of you coming, engaging, spending time here in this nascent emerging ecosystem. I think it's still so early, and maybe to kick things off and to lighten up the mood a little bit, we want to showcase kind of a video impression of why we think BioXRZ is really important. This is still kind of unreleased. We're still working on the final version, but to kind of lighten up the mood, we're going to show you guys a little peek preview into the mission and vision of what we're trying to build with the Bio protocol. Let's hope this works. Yeah, I think this is a first nice artistic impression in terms of where we want to take the ecosystem. We really see the Bio protocol as becoming this connective tissue. This is a first version. Wait, maybe just something. Oh, okay, weird. Sorry, the formatting on the slides is weird. Can you check that it's not a PDF, but that it's a, or just the directpitch.com link? Okay, it's weird that it's in Times New Roman. Okay, no worries. I'll just roll with the punches. Cool, so BioXRZ was actually formally announced at DeSci.Berlin 2022, so just about 2 years ago. Since then, we've seen a whole innovation of BioDAOs emerge from the underlying systems and protocols that we're developing. And today, I kind of want to share with you all what we've been building towards at Bio, and how we actually intend to solve a lot of the issues that we've seen emerge in the BioDAO ecosystem, and kind of usher in a next wave of a crypto demand side to really come in and direct capital into where we think it's most needed. So I often like to say that I think today we live in a time of science friction and not a science fiction. And so one of our core goals is to bring DeSci back into being sci-fi, into being science fiction. And Bio really aims to fix this by building BioDAOs that bring science on chain, enabling scientific communities and patient communities to direct capital to build IP portfolios and to sell products directly down to consumer. So vertically integrated virtual R&D organizations. Scientists today and patients are really disenfranchised from each other. So if we think today how the two core value groups in drug development, in medicine, you have scientists on the one side, you have patients on the other side, and throughout this pharmaceutical industrial complex that we've created over time, they've been really disenfranchised. So we see a core role of BioXYZ and of Bio to kind of to realign incentives for collaboration, leading to better cures and healthier outcomes. How does this work? So this is one of the typical BioDAO kind of flywheels that we've seen and developed over time. You have enthusiasts and backers that come into these organizations. Ideally, you have patient groups that they work with, and then you have scientists, and that kind of creates a flywheel of innovation. We've heard a lot of different the DAOs present today, a lot of the different models, but fundamentally we think there's something extremely powerful here in this novel framework. Something that actually an increasing amount of BioDAOs are also doing are directly issuing products to the communities that they create. So the BioDAOs can partner with pharma organizations to out-license IP. They can create IPTs, which we heard about earlier, to their communities. They can sell products directly to D2C businesses or partner with universities to bring in IP. Our community today has already built over 6 of these BioDAOs. I think we're actually at 7 or 8 now. And yeah, we're only getting started. I think if you kind of you have to remember that we're 2 years into this movement, and that I think the railways have yet to be fully laid. I spoke with a lot of folks today, and yeah, the space I think today is aching similar to where Ethereum was in 2018, 2019. I often liken it to where DeFi was in 2017. Like, we're only beginning to see real primitives emerge. And I think now that we've seen this first wave of BioDAO innovation, what we aim to do at BioProtocol is really kind of lay the railways for this to become a lot more scalable. Sorry, I never use Times New Roman, so please apologize for that. So what are we doing at Bio? So Bio incubates and accelerates these BioDAOs. That's what we've been doing to date, and we help them create liquid token economies that accelerate research. What you'll see on the right, for instance, is Cerebrum DAO's recent token auction that raised a total of 1.3 million for neurodegeneration and neuroscience research broadly. So we're really excited that capital continues to move in. But we've also increasingly asked ourselves, like, how can we actually scale all of this? A lot of the BioDAOs today are still operating through this convolution of snapshot, multi-sig, legal agreements, being incorporated in different jurisdictions, and we want to bring that whole series of steps from the Web3 set that have to be done into a Web3 native environment. What we have today, I think, is a flourishing ecosystem. Treasuries, over 20 million raised, over 10 million funded in research. The total ecosystem market cap is just around 200 million in the BioDAO space. We have DNA from industry giants. Pfizer made an investment into VitaDAO. We have the former chief scientific officer of Novartis, for instance, wanting to build a DAO with us. We've been featured 4 times in Nature Biotech. Which, even if you think about that, over the past 2 years, there have been 4 independent articles about this movement in Nature Biotech. And an increasing amount of interest in DeSci from folks like Vitalik, Brian Armstrong, Balazs, and CZ. So this early success has now accelerated this bio flywheel and grown the bioeconomy. The best ideas and teams rise to the top. This creates an increased amount of funding to solve problems. More milestone achievements in DeSci leads to more interest in DeSci problem solving, leads to more ideas. And so we're currently at a stage where this flywheel is beginning to spin. And we think now is the time to actually accelerate it and make it spin a lot faster by applying best-in-class crypto economics. So I said this earlier, we launched actually at DeSci.Berlin in 2022 by Molecule. And I've been working really hard over the past couple of months to actually ensure that bio as an ecosystem can now fully decentralize. So we launched our first cohort in 2023, and then also formed the BioXYZ Association. So the BioXYZ Association is a Swiss nonprofit entity that is essentially taking over the stewardship of the brand and the ecosystem that has been created here. And we just had a board decision about a couple of weeks ago for bio to be fully spun out of Molecule. We're very actively working on the next cohort. And in the next couple of slides, I'll actually tell you about what that decentralization entails, how it's going to work, and what it means for the ecosystem. So our vision at Bio is really to become a fully automated liquidity and curation protocol for the formation of on-chain scientific communities. So this also now moves out of the space of normal biotechnology or drug discovery research. For example, in our next cohort, we have the preeminent researcher in quantum biology that approached our team a couple of months ago wanting to build one of these BioDAOs with us. And so we think this can actually go far beyond just biotech and be applied as a general new model to foster scientific innovation on-chain. With Bio, our goal really is to blend DeFi and DeSci, so decentralized finance and decentralized science, to kind of create a new category, which our lead engineer, Malik, has colloquially termed science finance or sci-fi. So moving out of science fiction into science fiction. And Bio, in this way, provides meta-governance over all of the communities in its ecosystem, and as an autonomous protocol, directs capital and talent into this growing DeSci ecosystem. We're essentially in the middle of a launch. Some of you might have already gone onto the Bio website where you can claim your airdrop. But there's a DeSci airdrop that actually, I think it started yesterday. Yeah, yesterday. There's a Genesis event that, if all goes super smooth with our development team, is going to start happening at the end of next week. So stay tuned for that. And then the next step after that is really to launch what we colloquially call the Bio Pharmacy, bringing in some of the best system dynamics that we know out of DeFi into DeSci, and really enabling the broader crypto capital market and DeFi market participants to come and provide liquidity in this emerging ecosystem. So something that we found over time, that most of the BioDAOs today still really struggle to attract traditional DeFi capital, because they're like, most of the tokens that the BioDAOs have issued are kind of like passive governance tokens, meaning you can't actively generate yield on them. And this is something that we aim to change with Bio. If you're an active builder or participant in the ecosystem, if you've ever participated in a BioDAO auction, if you hold BioDAO tokens, if you've been active in one of the discords as a scientist, if you participated in the VitaDAO Genesis auction, if you voted on early VitaDAO proposals, if you participated in the DeSci Gitcoin funding rounds. So we've kind of taken a snapshot of the on-chain DeSci activity that we've been able to find through date to ensure that if you've been an active user, participant in the DeSci ecosystem on-chain, that you can essentially also be an active participant in the Bio network. The next phase of the launch is essentially seeding the Bio protocol. So we have a Bio Genesis Fair launch that will enable anyone that holds BioDAO tokens, or even DeSci tokens more broadly, to contribute into seeding the Genesis protocol in return for 20% of the initial network supply. And this also includes organizations like ResearchHub, for instance, that will be included in this broader meta-governance layer that the Bio protocol is building. I believe that just like decentralized finance did, DeSci really has to thrive on integrations, on open APIs that kind of integrate the space in a cross-connected way. Here's a little snapshot of what that's going to look like. But this is essentially following the same vein that many of our BioDAOs have followed. We really believe in these fair launch principles. If you hold BioDAO tokens today and are interested in participating in the genesis of the network, would love to speak to you or would love to have you involved. So what are some of the features of Bio? So Bio really provides meta governance. It's a single token that unlocks voting across a number of these BioDAOs. And meta governance in DeFi has often been a negative sum game. So as liquidity protocols grow over time, you have token holders that want to extract more and more value from the protocol in the form of API. And we actually believe that in DeSci, meta governance can become a positive sum game, because ultimately all of these organizations, all of these BioDAOs are fundamentally backed by scientific IP. They're fundamentally backed by the research assets that Molecule's framework is bringing on chain. And as we've already seen, organizations like industry giants like Pfizer are actively interested in owning governance in these organizations. For me, I liken Pfizer's early purchase of Vita tokens to kind of like, it happened so early, like we were really shocked about it at the time that they had the strong interest to get involved. And it's a bit, if you compare this to DeFi, it's a bit like if JP Morgan or Goldman had decided early on to be a liquidity provider in Uniswap. And I think what's fundamentally different from DeFi to DeSci is that TradSci, so both academia and pharma, are actually really interested in engaging in these new models because they solve a fundamental pain point that the industry has failed to solve, which is this kind of valley of death. Then it's liquidity, so deepening liquidity pools, and Bio creates efficient on and off ramps for different BioDAOs. And then funding. So voters in the bio ecosystem can drive capital to specific BioDAOs or IP assets and bring them to life. So we really see bio as connecting and supercharging BioDAOs and becoming a gateway to the emerging DeSci economy. Why now? Because we're proving the success of the BioDAO model, and there's an increasing amount of EAC. If you may be familiar with the EAC movement, there's now an emerging BioAC movement, and this really kind of, I think, hits the zeitgeist of where the space is at. So yeah, CZ recently tweeted about the into the current zeitgeist of a much broader community, and that we have the ability with something like BioAC and bioaccelerationism to onboard a much broader community into crypto, ultimately of biotech builders, of the next generation of scientists. And I'll just finish with something that's important to me. I really think if compute is a substrate for intelligence, if compute is a substrate for AI, then biotechnology itself should be viewed as a substrate for life. And I think we need to accelerate our biology and integrating it into society and culture rather than being afraid of change and rather than decelerating. So this plays into the EAC movement, where over the past year, we've had a lot of voices around we need to decelerate AI, we need to be super careful how we're, what the impact that this has on humanity. I think the same rings true to some extent in biotech. But I think in biotech, we've been really, genetic modification is viewed as something overtly negative, and biotech often has a very negative connotation, whereas we should actually just lean in fully and accelerate it and consider it a part of culture and life. So for us, BioAC really fuses three megatrends. It's biotech, Web3, and then artificial intelligence. So another thing that we really focus on at the Bio Protocol is, you heard on some of the previous talks, how AI agents, how LLM networks, how knowledge graphs can be integrated in these different BioDAOs to generate so much more efficiency for the researchers and patients that are coming into them. And this is another core role that we see ourselves playing at Bio, is integrating all of these emerging systems into the BioDAOs as they come in and making it as seamless as possible for research teams that have very little exposure to Web3 or even to this DeSci ecosystem to begin spinning up these organizations and accelerating biology. So we're here to accelerate longevity, accelerate neuroscience, accelerate genetic engineering, accelerate synthetic biology, accelerate fertility, and ultimately to accelerate life. Accelerate life on Earth for all humans. So that's what BioAC is about. And why we think, that we're at the start of something really important here. We wouldn't be anything without all of the amazing builders that we heard speak today. And yeah, really excited for tomorrow, really excited for building this next chapter with you. And if you're interested to get involved in the Bio Protocol as we're kind of in this decentralization step, please don't hesitate to get in touch. We'll be releasing a lot more information and details on how the protocol is going to work in the coming days. There's always, maybe some of you investors are familiar with this, there's always a bit of a process entailed with decentralization where you need to be careful what you communicate in certain parts of rolling out a decentralized system. But yeah, if you're interested to learn more, interested to get in touch, or even interested to contribute, please don't hesitate to reach out to me or any members of our team. We built a really powerful team of kind of DeFi builders that are now coming into the DeSci space to really enable scientists and the next wave of BioDAOs to be a lot more efficient. And if you're still in town tomorrow, we're organizing a BioAC rave together with some folks from PsyDAO and some other AI folks that are in Berlin at the moment. If you're attending to DeSci.Berlin, you automatically have entry to the event anyway. It starts at 9 p.m. tomorrow at Eve. And yeah, again, if you need more information, if you want to come, want to be on the guest list, just let me know. And I think with that, I'm really excited to close the first day of DeSci.Berlin and really excited to see all of you tomorrow.
Cool. Okay, you can all leave. Thank you so much. We'll see you tomorrow.